out for like 2 seconds. So you. Yes, ma'am.
Back. Okay. This one's delayed. Okay, well, I'll just stay on the screen. I'll just keep working here until everything is called to order. So, Labor-H is first, did you say? Did I hear that right? Or second?
One, two, three, 1, 2, 3.
I call this meeting of the Committee on Appropriations to order. Before we begin, I'll remind everyone of some of the practical details of today's meeting. For those of you joining virtually, once you start speaking, there will be a slight delay before you are displayed on the main screen. Speaking into the microphone activates the camera, displaying the speaker on the main screen. Do not stop your remarks if you do not immediately see the screen switch. If the screen does not change after several seconds, please make sure you are not muted. We have set up an email address to which members can send documents such as amendments, motions, and other unanimous consent requests. That email address has been provided to your staff. I would remind all members that they must verbally request unanimous consent separately from sending the document or written UC request to the email address. Finally, lunch today is courtesy of Ms. Granger, and I will let everyone know when it is ready so that you can make your way down to 1036. So thank you, Ms. Granger. Yes. And I want to not only welcome everyone who is here present in the room, but all of our colleagues who are virtual this morning. Before I get started, I just want to say that today is Child Tax Credit Day. Families with children under 6 today receive $300, children 6 through 17, $250, life-changing. Families are dealing with extraordinary expenses, food, childcare, diapers, health care, and clothing. And it is because, the reason why I am mentioning this today, people are wondering why, it is because of this subcommittee that helped to move the needle to get to today. It was in 2015 that the full committee accepted by voice vote an amendment introduced by our colleagues, Congresswoman Lucille Roybal Allard and Barbara Lee, to fund a comprehensive, nonpartisan National Academy of Sciences study on child poverty in the United States. The evidence-based report was to, quote, provide its assessment of the most effective means for reducing child poverty by half in the next 10 years. The report found a fully refundable child tax credit was the cornerstone to achieve this historical poverty reduction. After working on the child tax credit, myself and with others for the last 18 years, and people ask how we did get here, I always say it was the National Academy of Sciences study that raised the profile and demonstrated the evidence of what the expanded and improved child tax credit can do for children and their families. So our deepest gratitude to Congresswoman Lucille Roybal Allard and Congresswoman Barbara Lee. Thank you very, very much for your efforts. Our first order of business today is consideration of the Labor, Health, Human Services, and Education Appropriations Bill for fiscal year 2022. To start, let me first say what a pleasure it has been to work with the ranking member of the subcommittee, Representative Cole, for the past 6 years, and in everything that he does, Representative Cole demonstrates a profound integrity and a steadfast commitment to the American people. And it has been such an honor to work with him on the Labor-HHS subcommittee and to work with him in building a better, brighter future for all Americans. I am also honored by the commitment of all of my colleagues on this committee and for the great work that you have done in the past and the work that you are currently doing in getting us to this point. Now, Ranking Member Cole told us earlier this week that the Lugar Center recently ranked the Appropriations Committee as the best performing committee in the Congress. That's a testament to the hard work of all of you, your dedication to this nation, and your dedication to the people that you represent. And I'm proud to chair, very proud to chair this committee. So thank you all very, very much. And this commitment is reflected in the $15,000 funding request the Labor-HHS Education Subcommittee received this year, the vast majority of which I am pleased to say we were able to meet. Together, I believe we have done great work, and I very much appreciate your efforts, as well as those of our front office and our personal office staffs. Over the past 5 months, the Labor-HHS Education Subcommittee has held 14 hearings and a public roundtable with the director and deputy director of the Centers for Disease Control and Prevention. And we learned how our public health infrastructure, which is outdated, ill-supplied, and losing workers, was not prepared to meet the demands of the COVID-19 pandemic. We discussed how sustained funding by Congress for basic biomedical research at the National Institutes of Health led to the rapid development of the COVID-19 vaccines and the need for an even greater funding. We heard about our nation's behavioral health crisis, which has been exacerbated by the pandemic, and how they are causing more Americans, including children, to experience suicidal ideation and substance abuse. We considered how sending mental health professionals rather than law enforcement in response to mental health crises calls keeps more Americans safe. And we examined the terrible effects of the maternal health crisis in our communities, especially communities of color. In addition to the many health-related issues we discussed, we examined how many families are still struggling to obtain the safe, affordable child care they need. We heard how our agricultural workers are still facing dangerous conditions in their workplaces, and we reviewed the many astronomical barriers students still face to obtaining the high-quality education that they deserve. Informed by these instructive hearings, I am proud that this bill provides $253.8 billion in funding, a historic increase of 28%. Through this funding, we are fulfilling our debt to the generations, families, and communities we serve, and tipping the scales for the hardworking middle class and the vulnerable. With $7.4 billion for the Child Care and Development Block Grant, $12.2 billion for Head Start, $450 million for preschool development grants, we are cultivating a nation that supports working families and nurtures our children. With an increase of nearly $20 billion to strengthen federal support for high-poverty schools and a $400 increase for the maximum Pell Grant, we are making post-secondary education more affordable, accessible, and achievable for more students. And with $1.13 billion for programs serving historically Black colleges and universities and minority-serving institutions, community colleges, and under-resourced institutions of higher education, we are making our education system more accessible and equitable. I also want to note that this bill provides $100 million for the Strengthening Community Colleges Training Grant Program, which is a program that some of us have championed through the Labor-HHS Subcommittee going back to 2019. The increase of $1.6 billion in this bill for the Employment and Training Administration, including a total of $285 million for registered apprenticeships and $3.1 billion for Workforce Innovation and Opportunity Act state grants, will enrich our nation's workforce and create jobs, especially as our young adults move into the workforce. And to protect workers' paychecks and benefits and ensure workplace safety, this bill provides $2.1 billion, an increase of $305 million for worker protection agencies such as the Occupational Safety and Health Administration and the Wage and Hour Division. I am proud that these investments will sustain good-paying American jobs and give more people a better shot at the American dream. But even as we foster great opportunity for more Americans, we must learn from the COVID-19 pandemic and rebuild our public health infrastructure while preparing for the public health crises of the future. And to that end, the bill provides $1 billion for a new flexible funding stream for public health infrastructure and capacity, and an increase of $250 million for CDC's global health efforts. It includes increases of $50 million to invest in our public health workers and provides $100 million to improve and update the way public health data is collected and utilized. Building on the investments this committee has made over the past 6 years in a bipartisan way in biomedical research, this bill increases funding for the National Institutes of Health by $6.5 billion, including a $3.5 billion increase for biomedical research at existing NIH institutes and centers, and to provide an across-the-board 5% increase for each institute and center. To accelerate the pace of scientific breakthroughs, this bill supports the President's request to establish the Advanced Research Projects Agency for Health, or ARPA-H, which will be indispensable in achieving breakthroughs in the treatment of diseases such as diabetes, amyotrophic lateral sclerosis, ALS, cancer, and Alzheimer's disease. To address our country's mental health crisis, which has been profoundly aggravated by the COVID-19 pandemic, this bill provides $100 million to help communities create a new mental health crisis response partnership pilot program, which would respond to mental health crisis calls with behavioral health teams instead of law enforcement. Many of these programs are in partnership with our law enforcement agencies and come directly out of the suggestions made at one of the hearings where we discussed mental health and law enforcement. And to save lives and to help keep guns off our streets, this bill builds on the investments we have made in the past 2 years, with $50 million for gun violence prevention research at the CDC and the NIH. The COVID-19 pandemic uncovered a vast number of disparities and failures in our public health and human services systems that left far too many vulnerable Americans fending for themselves. That is why I am proud that this bill promotes equal treatment for women through increased funding for Title X and by repealing the discriminatory Hyde Amendment. I know that this is a source of much concern on the other side of the aisle, but I do believe repealing the Hyde Amendment is the best thing that we can do to support our mothers and families and to help prevent, rather than penalize, unwanted pregnancies and later riskier and more costly abortions. I am profoundly proud of what we have done here and am grateful for the collaboration and input of all of my colleagues on both sides of the aisle. I want to again thank Ranking Member Cole and all of the staff, and specifically our Majority Clerk, Stephen Stegleiter, and his team, Jared Bass, Philip Tizzani, Jennifer Kama, Jackie Gilroy, Lori Mignon, Becky Saleh, and Tricia Castaneda. Thank you as well to the minority staff, to Susan Ross and Catherine Salmon. And last but not least, I must thank my own personal staff, including Liz Albertine, Christian Lovell, Caitlin Peruccio, and Marie Gualtieri. And what I'd now like to do is yield and recognize the subcommittee ranking member, Mr. Cole.
Thank you, Madam. Thank you, Madam Chair, and I want to congratulate you on your hard work on this Chairwoman's mark. Before I do, I certainly want to reciprocate your generous remarks. I have enjoyed our partnership over the last 6 years and our friendship, which will last well into the future, I'm sure, whatever our temporary differences are. You know, in the 5 years before you and I became chair and ranking member, roles which we've swapped back and forth, this bill never got out of this committee and never got across the floor of Congress. The 6 years that we've worked together got out of this committee every single time and across the floor every single time. And in each of those occasions, we've both voted for final passage of the bill, regardless of who the chairman was, regardless of what party was in power, regardless of who the President of the United States was. I think that is an enviable record. Could not have happened without you. Your cooperation, your expertise, nobody knows this bill better. I don't think anybody in Congress cares about this bill more. And so I look forward to working with you as we go through this process. As I said on Monday, I also want to thank you for incorporating so many of our shared priorities into this bill. You and I agree on the need for continued investment in biomedical research, public health infrastructure, and preparing the nation for the next pandemic. In fact, I actually support the President's higher request for the NIH, and I hope we can work together to achieve his recommended level. You and I also agree on the importance of funding special education and programs like TRIO and Gear Up, which help first-generation students complete college and change the trajectory of their lives. Thank you for recognizing the importance of these shared priorities. You've also been fair in including community project funding requested by the members on both sides of the aisle. Bringing some control of this funding back into the hands of elected representatives is not without its challenges this year, but you've more than met those challenges, and you've been fair and accommodating to both sides, and for that, I thank you very, very much. Despite our many areas of agreement, however, I'll be opposing the bill presented today. At the end of May, President Biden sent a $6 trillion budget request to Congress for fiscal year 2022. The bill presented today mirrors the request closely. Proposing the highest spending levels since World War II, the price tag alone is utterly unrealistic. And while Congress holds the purse strings and is ultimately responsible for providing the annual funding for the federal government, the President's budget request reveals his own radical priorities and, frankly, his disregard for fiscal responsibility. First, instead of focusing on the urgent priorities for all Americans, President Biden's budget request elevates controversial policies over pressing needs like strengthening our national defense and bolstering the tools to address and manage the crisis at our southern border. In fact, the budget calls for billions of dollars in progressive policies like Medicare for All, Green New Deal, and those outlined in the so-called American Jobs Plan and American Families Plan, while recommending an effective cut in the funding for our military. With China and Russia growing their militaries by the day, such a move is misguided to say the least. Beyond shortchanging our defense and spending big on progressive policies, President Biden expects the American people to foot the bill. His budget proposes a $55 trillion tax increase on American individuals and businesses over the next decade. Moreover, the President endorsed raising the corporate income tax rate and other taxes targeting individuals, small businesses, and our independent energy industries. Despite promises made during the campaign trail not to raise taxes on those with low and middle incomes, the President's budget would also allow existing tax cuts to expire, which would immediately increase the tax burden on hardworking Americans. As individuals, families, and small businesses continue to recover from the coronavirus pandemic, such levels of unprecedented spending and taxation would only lead to inflation, slowed economic growth, and the highest national debt level in American history. Finally, most egregious in the President's budget request, which I was very disappointed to see reflected in the bill presented today, is the removal of the Hyde Amendment, which protects life and prevents federal taxpayer-funded abortions. Since it was first enacted in 1976, 45 years ago, it's estimated that this provision has saved more than 2 million lives while protecting the conscience right of the great majority of Americans who are opposed to publicly funded abortions for religious, moral, or fiscal reasons. Even when President Biden was serving in the United States Senate, he then expressed his support for the inclusion of the Hyde Amendment in appropriations bills and showed support for that inclusion as recently as 2 years ago while campaigning for president. Moreover, it's been supported by lawmakers, including every member sitting in this room today, and signed into law by presidents of both parties every year as part of the appropriations bills. Madam Chair, you know the Democrats in Congress do not have the majorities capable of passing this bill on their own. In the days and weeks ahead, it's my hope that members on both sides of the aisle and in both chambers can negotiate spending that is responsible and will not lead to financial disaster. But the first step toward negotiation will be the full reinstatement of the Hyde Amendment, including conscience protection language added 16 years ago that has also been removed from this bill, even though the President supports that language. That provision protects American doctors, nurses, and other healthcare professionals from participating in an abortion if they have a moral objection. This is an essential right of every American, and its removal is a danger to us all. Again, I want to point out that even President Biden's budget did not propose removal of this important language, first authorized by then Representative David Weldon in 2005. These protections need to be reinstated if the bill is to move forward. Quite frankly, everybody in this room knows the bill will never pass the United States Senate without the inclusion of the Hyde and Weldon amendments, and the majority of the American people support that view. In closing, while the bill does many good things, and while I certainly appreciate the openness of the process in which the chair has approached the development of the mark, I will be opposing the bill today. The price tag is too high. The bill contains many poison pill policy riders, and many unauthorized programs, and it bows to a leftist agenda that is out of step with the values of the American people. I would like to emphasize again that even if all these issues were addressed today, removal of language that protects the lives of unborn American children and the rights of all Americans to freely exercise their conscience with respect to abortion assures that the bill, as written, will never reach the President's desk. This decades-old bipartisan compromise must be included before we negotiate on spending levels and other policy. It's just that simple. Again, I want to thank the chair, the gentlelady, and her staff for all the hard work, and I do pledge to work with you in good faith, as we have so many years before, working together. Again, you and I have passed this bill through the Congresses under both parties, a variety of presidents, and we've avoided a continuing resolution time and time again. It's my sincere hope that we will be able to accomplish that again, Madam Chair, and with that, I yield back my time.
Thank the gentleman. Thank you for your kind remarks. And with that, I'd now like to recognize Ranking Member Granger for her opening remarks. Representative Granger.
Thank you very much, Madam Chair, for yielding. First, I want to thank the Chair and Ranking Member for their work on Labor, Health and Human Services and Education Bill. I have great respect for Chair DeLauro's dedication to these issues. I also appreciate Ranking Member Cole's ability to find common ground that's necessary and also to clearly highlight when the parties disagree. I need to begin my remarks today by noting concerns that Tom and I share about this year's Labor-H bill. The bill includes an unprecedented increase that is nearly 40% more than last year. This is simply too high, especially when many programs in this bill have already received billions of dollars over the past year from COVID spending bills. That said, the incredibly high price tag is not the only problem with this bill. For the first time in nearly 50 years, this bill abandons long-standing bipartisan language that prevents federal tax dollars from being used to pay for abortions. The bill also removes language carried for the last 16 years that protects American doctors and nurses from being forced to participate in abortions. This is the first time in such an extreme position has been taken in this bill, and this shift in policy could actually destroy decades of bipartisan work. There are many other controversial items included in the bill that must also be addressed, including language relating to labor law, excessive spending on new unauthorized programs, and provisions relating to immigration enforcement. Madam Chair, Republicans stand ready to discuss top-line spending levels and funding for individual programs that will help improve the health and lives of the American people. But restoring language that protects the lives of unborn children and protects medical professionals from being forced to participate in abortions must be the first step. I urge my colleagues to consider the amendment today to restore this bipartisan language, and I hope that it will be agreed to before the bill proceeds to the House floor. In closing, I would like to thank all of the subcommittee members and the staff for their hard work on this bill, specifically our minority clerk, Susan Ross, and our majority clerk, Stephen Stigliger. Thank you, Madam Chair, and I yield back.
Thank the gentlelady, and I too look forward to working with you and with Ranking Member Cole as we move forward. Are there any other members wishing to make general comments on the bill? Here. Congresswoman Frankel.
Thank you, Madam Chair. I think this mic's working here. Madam Chair, Ranking Members, Granger and Cole, I thank all of you for your work, and also the subcommittee members that I'm honored to serve with on that subcommittee. It has been said, Madam Chair, that spending bills represent our values, and this excellent package does just that. Most Americans, when they're asked what's most important to them, will tell you it's their family. And this bill reflects the love and the commitment we have for our families from the very young to the very old. The bill gets our children off to a good start with historic funding for pre-K and quality childcare. We increase funding for Title I grants to low-income schools and funding for students with disabilities so all children have access to a high-quality public education regardless of their zip code. We want to make sure our children have the chance to live out their dreams, so we make unprecedented investments in Pell Grants for college students, including DACA recipients, and workforce development. And our grandparents, they have given us so much, and now it's our turn to make sure they age with dignity and comfort. And this bill increases funding for home and community-based services, home-delivered meals, research on Alzheimer and cancer and other conditions that are especially impactful to older Americans. And of course, we all want our families to be safe and healthy. The bill doubles funding for research on gun violence and adds substantial resources for mental health treatment and to reinforce and advance our public health system. And this is a country that honors our veterans. In this regard, I'm proud to champion the Centers of Excellence for Student Veteran Success programs on college campuses that help veterans transition from active duty to civilian student life. We doubled those efforts in this bill. And before I close, I have to jump up and down, but I'll stay seated for this. But I wanted to say this is a truly historic bill that eliminates the cruel barriers to reproductive care for working women struggling to make ends meet. Thank you, Madam Chair, Representative Barbara Lee, for your leadership on this. We have eliminated for the first time in decades a racist, discriminatory policy of blocking Medicaid beneficiaries from accessing abortion. And we do this while making historic investments in Title X Family Planning Program, which provides birth control, STD screenings, HIV treatment, breast and cervical cancer screenings, and more to millions of low-income patients in our most underserved communities each year. We recognize that the decision to become a parent is a personal one to be made by each woman and not by politicians. This, Madam Chair, is a bill filled with love for our families and hope and justice that lifts them up. I'm proud to support it, and I yield back.
Mr. Molinar.
Thank you, Madam Chair. It's good to see that many requests for scientific research, universities, healthcare professionals, and community organizations have been included in this legislation. However, there are many concerns with this legislation that cause it to fall short of what our country needs. The legislation harms businesses who need workers, and it penalizes schools. The legislation would prohibit the Department of Labor from processing H-2B visas, creating uncertainty for American businesses and harming the tourism industry in my state and across the country. The legislation sets an arbitrary limit on processing and leaves employers at the mercy of the economic conditions that are far beyond their control. It also denies people who seek better opportunities for themselves, and it hinders seasonal businesses where there is a temporary demand for labor. This part of the legislation would harm the economy and the recovery from COVID that so many small businesses need. I hope this part of the legislation will be removed as the bill progresses. Similarly, the legislation attacks parents and students who have chosen to pursue educational opportunities at charter schools. It raises the operating costs of those schools by making it illegal for charter schools that receive funding from the government to also contract with private companies for food, busing, janitors, textbooks, and the technology students, especially those with special needs, use for their lessons. The higher costs imposed by this legislation will raise costs for parents who want their children to pursue new opportunities at charter schools. As the co-chair of the Congressional School Choice Caucus, I've met with many parents and students who appreciate the choices that charter schools provide, and I know they will be disappointed when costs go up if this piece of the legislation becomes law. This is an unnecessary targeting of charter schools, and all of us have families in our districts who will be concerned about the implications of this dramatic and drastic change in policy. To slip in such sweeping language based on misguided assumptions will have dire consequences for students with special needs, those who have been bullied, and those who are unable to assimilate to a traditional school. It will also hurt professional development opportunities for teachers and administrators. Finally, in a rare instance of this legislation actually underfunds one of President Biden's proposals. This legislation cuts funding for the charter school program that helps our nation's charter schools develop best practices, find suitable facilities, and collaborate with traditional schools. This 10% cut to the program will hinder progress and opportunities for students and their families. As students continue to recover from the detrimental effects of the pandemic and the restrictions they've had on their education, this committee should not be limiting their opportunities, but instead it should allow them to pursue opportunities at the schools that are the best fit for them. These are the major shortfalls in this legislation that I hope will be addressed as we go forward from here. Thank you, Madam Chair.
Ms. Rybel-Allard.
I strongly support the Labor-HHS bill, and I thank Chairwoman DeLauro for her passion and leadership in crafting such a strong bill for FY22. Madam Chair, you have done a commendable job in your first year as Appropriations Full Committee Chair. Despite the challenges of a pandemic, post-insurrection restrictions, and bringing back community project funding, you have held a record number of hearings and are moving all 12 bills to markup and floor consideration before the August recess. I thank you and Ranking Member Cole for being so responsive to requests from members from both sides of the aisle. We are privileged to serve with two such dedicated public servants who truly understand and respond to the needs of the most vulnerable among us. I echo the sentiments of my colleagues for the appreciation we all have for the Labor-HHS subcommittee staff, both majority and minority, who with good humor worked long days and late nights to help produce such a historically robust bill while navigating the environmental challenges of a virtual work situation. This Labor-HHS mark rightly deserves its reputation of being the people's bill. I particularly want to thank the Chair for your generous support of so many of my priorities, including continued funding of my underage drinking and newborn screening programs, my request for the creation of an HHS Coordinating Committee on Children's Health and Welfare, and my request for a National Academies of Science study on underage and perinatal marijuana use. Your continued commitment to strengthening our public health system is also remarkable, as reflected in the flexible stream of funding provided for public health infrastructure and regional capacity building. Increased investments will also significantly expand the impact of programs like REACH, Childhood-Led Poisoning Prevention, Climate and Health, and the Chronic Disease Education and Awareness Program. As co-chair of the Paternity Care Caucus with my friend Representative Jamie Herrera Butler, we are particularly grateful for the strong investments in mothers and babies, including large increases in the MCH block grant, the Healthy Start program, and Safe Motherhood programs. Thank you for expanding the capacity of the Maternal Mental Health Hotline, the SAMHSA Pregnant and Postpartum Women program, and at my and Jamie's request, thank you for doubling funding for the midwifery education set aside within the scholarships for disadvantaged students. Finally, I truly appreciate that the bill specifies an interagency coordinating committee within the Office of Women's Health to promote optimal birth outcomes. This new endeavor, which Jamie and I advocated for, will build a much-needed system of accountability into our government-wide efforts to improve maternal and infant health. Madam Chair, in crafting this bill, which boldly invests in workers' needs, our children's education, and in helping ensure all families and communities have access to quality health programs, you have truly upheld the promise of the Labor-HHS and Education Appropriations Bill as being the people's bill, and I am proud to support it. I yield back.
Mr. Rutherford.
Madam Chair, Ranking Member Granger, and Ranking Member Cole, I rise today to express my sincere appreciation First, for the collective hard work that you all put in on this bill, and also for two specific projects that have been included in this year's bill. My district in Northeast Florida is quickly becoming a national, and I dare say international, medical destination for patient care. And thanks to the two community-funded projects included by this committee, even more innovative health services will now be provided, soon be provided, in Northeast Florida. Nemours Children's Hospital, for example, will receive funding to build out their technology infrastructure for their pediatric center of care, center of excellence. And UF Health of Jacksonville will receive funding to facilitate one-stop care for underserved patients in our area. I look forward to both of these projects providing care to individuals in need in Northeast Florida. Now, I still have concerns with the overall bill, but I intend to express those concerns as we move forward. But I wanted to first make note of my appreciation for this important and critical funding that will benefit the constituents that I serve in Northeast Florida. With that, Madam Chair, I yield back.
Ms. Clark.
Thank you, Madam Chair. I'd like to express my appreciation for you and the hardworking subcommittee staff in producing the Labor-HHS appropriations bill. As a member of this subcommittee, I am proud to support this bill, which not only confronts the challenges that have been exacerbated by the pandemic, but helps us build a more equitable future that levels the playing field for the American people. This is a comprehensive funding package that directs dollars towards good-paying American jobs, education, childcare, public health infrastructure, women's rights, and much, much more. It includes many of my key priorities, and I am grateful for you helping women and families in Massachusetts and across the nation with the increases in the Child Care Development Block Grant and $12.2 billion for Head Start. For student parents at community colleges, the bill provides the C Campus program with $95 million, absolutely critical funding for our student parents. And for communities suffering from addiction epidemic, this bill dedicates $28 million to expanding a loan repayment program for substance use disorder workforce. We know this funding is even more critical after learning yesterday that more than 93,000 Americans died from drug overdoses in the past year, marking the highest increase in 50 years. I urge the committee to maintain and increase this robust investment, and I am grateful for your help in strengthening the pipeline of health professionals that can meet the needs of this crisis. And for the equal treatment of women, this bill repeals discriminatory bans on abortion coverage, including the Hyde Amendment, and increases funding for family planning services under Title X. I am so grateful for your support and partnership on these issues. I urge my colleagues to support this bill, and I yield back.
Mr. Quigley.
Thank you. I want to thank the chairwoman, ranking member, for working so diligently with me and my staff and with my partner on Act for ALS, Mr. Fortenberry, to provide so much funding to support the fight for ALS throughout this bill. Specifically, I want to thank her for explicitly including ALS as a targeted disease in the $3 billion for the new Advanced Research Projects Agency for Health, also known as ARPA-H. Through the committee's robust investment in health research, our country will transform medicine and provide breakthroughs in technology and our ability to treat and one day cure ALS. For years, we have worked to secure ALS research funding, and I'm proud to see it included in such a robust fashion in this bill. We are changing this story one day at a time, and this is a big deal. Across the board, this bill goes above and beyond to ensure that our resources are dedicated to treating and curing this disease. Thank you again.
Congressman Harris.
Thank you very much, Madam Chair. And, you know, you've long said that this is one of the most important bills that we deal with in Congress, and it is. Because we deal with agencies that are pervasive throughout the lives, prosperity, and the future of Americans and their families. You know, it covers education. Nothing more important than education to families and to parents. And it gives us the opportunity to attempt to reverse the decline in American primary and secondary education and to try to reestablish our primacy in education in the world. It gives us the opportunity to provide educational opportunity for all young Americans, no matter what neighborhood you come from, no matter what your background is. It would allow us to provide educational opportunities to everyone. With regards to the labor section, clearly workers are the people who drive our GDP and our prosperity in America. And we have to get the careful balance that protects our economy while protecting our workers, and this bill is one of the means to do it. And perhaps most importantly, as we learned during the COVID-19 pandemic, there is a lot of policy, health policy, that we need to agree on, that we need to realign in order to protect ourselves from a future pandemic. You know, but there are some things in the health policy that I think need to be pointed out. We've got, for instance, Operation Warp Speed has delivered using the foundation that this committee has provided, for instance, funding mRNA research. We funded DARPA, which of course was important to the development of mRNA vaccines. And whereas Dr. Fauci at the beginning had said it would take 18 months to produce a vaccine, we had it not only produced, we had it, the administration beginning within 10 months, and 18 months after the initiation of this virus, we have more vaccine than Americans willing to take the vaccine. A tremendous breakthrough. And Operation Warp Speed used all the abilities of the federal government to make sure that happened. Now, ARPA-H has been mentioned. I do have some concern about ARPA-H, although obviously the idea of developing and promoting breakthrough technologies is important. I think it's also important to note that we might want to take our time in figuring out how to do this absolutely right. It's interesting that the journal Science, the foremost journal, one of the foremost journals in the world in science, this spring in discussing the ARPA-H proposal, said that, quote, the White House might see locating ARPA-H at NIH as the fastest way to launch it because the move doesn't require new legislation in Congress. Well, I would suggest that something as important as ARPA-H and what it can do requires careful thought on where to place it. Because we know, for instance, the National Institutes of Health already has the National Center for Advancing Translational Sciences, and I guess it didn't work well enough because we're now proposing ARPA-H. But to put it in NIH merely as a convenience because we don't need to legislate, Congress doesn't need to legislate that, is probably a bad reason, because I will remind you that a former president famously said the closest thing to eternal life on earth is a government program, and once you put a government program somewhere, it's hard to take it away from that or to move it. And therefore, I think we need to carefully consider where we place such a key program for the future of American health and science. Finally, I want to identify myself with the remarks by the ranking member of both the full committee and the subcommittee with regards to blending very important policy decisions regarding things like health, labor, and education with a poison pill, removing the Hyde-Weldon Amendment. I will tell you, as a practicing physician, the Weldon Amendment is incredibly important at protecting people with deeply held conscious and religious beliefs from being forced to participate in something that they don't agree with. It doesn't respect conscience rights. That's a basic right of every American, and removing the Weldon Amendment for me personally is just a bad idea. Anyway, with that, I'm sure we'll have more discussions on that. And again, Madam Chair, I thank you for recognizing that this bill is, in fact, one of the most important and pervasive bills affecting Americans' daily lives and their families. And I yield back.
Thank you. Congressman Watson Coleman.
Thank you very much, Madam Chairwoman. I'd like to thank you and Ranking Member Cole for your leadership on this subcommittee. I am grateful to continue serving as a member on this subcommittee that is protecting families, workers, and our most vulnerable population. I'd also like to acknowledge the hard work that went into drafting this year's bill and the inclusion of many of my top priorities. Coupled with the president's budget, we have put pen to paper and written a bill that advances fairness and equality for all. The bill's historic 28% increase over FY21 levels demonstrates a commitment to strengthening the floor beneath our underserved communities who are simply fighting for a chance to live a life with dignity. As someone who has been directly impacted by health issues, this bill will go a long way towards achieving equity in health, education, and labor, regardless of one's income or zip code. Some highlights included in this bill will fund key priorities for my district and our country. They include the $50 million increase for the reintegration of ex-offenders programs, $30 million increase for maternal mortality research, over $115 million in increase for suicide prevention programs, and increases to mental health programs with a focus on children, including a $48.5 million increase Project Aware to support children's mental health services. Additionally, there's a $500,000 to examine special enrollment period for pregnant individuals that my bill, HR 3126, the Healthy Mom Act, addresses. There's $2.25 billion increase to Pell Grants, and there's funding for minority-serving institutions and HBCUs. And so much more is included in this bill before us today. As the co-chair of the Congressional Caucus for Black Women and Girls, I want to thank the chair for working with me to include various provisions that address gaps in healthcare system for Black women and girls. This bill will get us one step closer to reducing the maternal mortality rate for Black women, currently 4 times the rate of white women. It will also invest in our children's mental health and youth suicide prevention, as well as take a serious look at the diversity in the NIH, its workforce, its grantees, and its clinical trials, as well as its reviewers. Lastly, I would also want to commend the inclusion of community funding projects in this year's process. In this bill, over $2 million will go towards combating learning loss through a summer STEM program, which introduced high school students from underrepresented populations into new career pathways and provide much needed medical training equipment for our health workers. Once again, I want to thank you and the ranking member for working with me to get my priorities into this bill. This is truly a statement of our values. The measured increase to these programs were done thoughtfully to make a real difference and uplift the lives of the people who need our help the most. I continue to work with my colleagues as we move forward in this bill, and I urge our support from our colleagues. I thank you for the work, I thank you for the support, and I yield back.
Thank you. Congresswoman Lee.
Thank you very much. First, Chairwoman DeLauro, let me thank you so much, and Ranking Member Granger and our subcommittee ranking member, Mr. Cole, for their leadership and for putting this bill forward. Let me also just thank our staff for their hard work and their commitment and dedication to these issues. Madam Chair, you have made sure that this bill was inclusive of the bipartisan requests. And I know not only is this a reflection of our priorities for the people, but it also reflects your life work as a true public servant. So thank you so much. This bill comes at a time when we can no longer ignore that systemic racism is at the heart of every crisis that we face today, from the COVID-19 pandemic disproportionately impacting communities of color to the crisis of police brutality. I am so pleased to see that this bill prioritizes funding for poverty reduction programs, life-saving medical research, reproductive health and education, and labor programs that produce socioeconomic opportunities for the next generation. And I want to thank you, Madam Chair, for your 18 years of persistent efforts to enact the child tax credit and for your gracious comments regarding Congresswoman Lucille Roybal Allard and my efforts, along with this committee, to ensure that the bipartisan National Academy of Sciences could provide the framework and roadmap leading to the progress of your work for the last 18 years. So thank you so much. I am proud to support this bill, which prioritizes health equity. We need to bridge the gap between medically underserved communities and life-saving treatments. We need to work with communities to overcome historical injustices and combat the racist system that stands between people of color having equitable access to care. We also need to make investments in mental health, especially after the challenging past year and a half. And so I appreciate that Chairwoman DeLauro support these issues as priority issues. The Labor-H appropriation bill also includes my request to require HHS to develop a comprehensive plan to develop a national center on anti-racism and health equity. This center will be a cross-cutting effort that would address the shortage of behavioral health professionals and specifically Black men in medicine, barriers for people living with HIV, and the need for increased research for diseases such as sickle cell and COPD, which my beautiful, wonderful late mother died of 6 years ago. And we've talked about the lack of research and strategies, but now finally, because of this committee, NIH is developing a pathway to find a cure and how to prevent COPD, and also empowering trusted messengers of our communities. This bill also funds a pilot program under the Office of Minority Health to oversee grants to support community-based organizations working to address structural racism in public health. I would like to thank Congresswoman Presley and Senator Warren for partnering with us in this effort. Now, as the co-chair of the Pro-Choice Caucus, I'm proud that this bill removes the Hyde Amendment and the Weldon Amendment and makes critical investments in reproductive health. It funds Title X family planning programs at $400 million and increases funding for the Teen Pregnancy Prevention Program. As co-chair of the Majority Leader's Task Force on Poverty and Opportunity, I am grateful for the inclusion of my request to fund the creation of the Children's Interagency Coordinating Council, which would bring together federal agencies to address additional pathways out of poverty. I'm also happy to see increased funding for life-saving programs such as the Ryan White Program and the Minority HIV/AIDS Initiative. As co-chair of the Congressional HIV/AIDS Bipartisan Caucus, I look forward to continuing to work with all of you to end the HIV epidemic by 2030. This bill also makes large investments to address the mental health crisis in our nation. I'm so glad that this bill includes $181 million for behavioral health workforce education and training programs, $1 billion for school-based mental health professionals, and language specific to address the shortage of behavioral health professionals and Black men in medicine. The bill also includes increased funding to strengthen HBCUs and minority-serving institutions, and I thank the chair for providing $184 million for the Howard University Hospital, including an increase of $150 million to modernize the hospital and facilities. Finally, as co-chair of the Congressional Cannabis Caucus, I was glad to see cannabis research as a priority through federal agencies. Gaining scientific data on cannabis will be valuable in furthering understand its potential benefits. Again, I'm not only proud to support this bill, Madam Chair, but I'm excited to support this bill centered on enhancing the quality of life for each and every person in this country.
Thank you, gentlelady. And Ms. Lawrence, and before Ms. Lawrence gets started, I want to just take a moment to say thank you to yourself and to Mr. Harder for really having the idea of a hearing with regard to mental health and law enforcement. And I know a number of other members on both sides of the aisle care deeply about this issue, and it was very, very fruitful. You recognize Ms. Lawrence.
Thank you, Madam Chair. I want to begin by thanking you for your amazing leadership. It's been an honor to serve with you, and Ranking Member Cole, thank you, and the subcommittee staff for efforts in drafting this Labor-H funding bill. I'm proud to support this bill. This bill provides funding for many critical programs that will have a tremendous impact on this country, on my district, and the state of Michigan. including firearm injury and mortality research, investment in our workplace health centers, school-based health centers, certified community behavior health centers, early childhood education, student financial assistance. Notably, this legislation also removes the harmful policy riders that targets a woman's right to make her own reproductive health decisions and provides robust funding for critical family planning programs. COVID-19 has highlighted the need to address mental health crisis in this country, and I'm proud that this bill provides robust funding to do just that. And I want to thank the chair for her wisdom, her compassion, and her leadership in recognizing this country can no longer stand in the shadows and just say it's mental illness, but what are our values and priorities reflected in appropriations to address that. In particular, I want to highlight two particular provisions. First, it urges HHS to provide technical assistance to states as they develop a plan to ensure all children entering foster care receive a mental health screening. I was lobbied by one of the foster children that I take in every year as an intern, and her question to me is that, Congresswoman, you know, if I'm in the foster care system, I've had a tragedy or a major event in my life. You mandate that I go see a doctor for my physical health. Why aren't you taking care of my mental health? And so I am so proud of this, and the focus will be done within 30 days of placement. The second would create the Mental Health Crisis Response Partnership Pilot Program. It invested over $100 million to develop and expand a mobile crisis response models to divert, and I want to say that again, to divert mental health crisis from law enforcement to behavioral health teams. We all know in our communities, too many of those who are struggling with mental health are put into our judicial system with no other options. I'm so proud of the support I received from our chair. The bill also makes necessary investment to booster our workforce and prepare the next generation to succeed in the classroom. This includes investment in registered apprenticeships, such as the Women in Apprenticeship and Non-Traditional Operations, to ensure that our future workforce is prepared to meet the needs and the challenges of our investment in infrastructure. I'm proud to say, and to quote, "We cannot build back better unless we build back with women, and this apprenticeship investment will do that." I'm also thankful for the investments in some of my priorities. One is the investment in the Holocaust Memorial Center, one of the largest institutes in the country, and it will expand educational curriculum and initiatives, and also funding of my local hospitals to ensure that they have the equipments to address the risk of cardiovascular diseases. Once again, I want to thank my chair, my colleagues, the staff, and I support this bill. Thank you, and I yield back.
Congresswoman Bustos.
Thank you, Madam Chair. I also want to thank Ranking Member Cole and the committee staff for all of your hard work. This bill funds 2 community projects in my district and includes provisions from 4 of my authorizing bills. And I'm really grateful for your inclusion on those. Just want to highlight a couple. The $500,000 in community project funding for Illinois Central College, their Cradle to Career initiative, will help a zip code in Peoria, Illinois, that is 61605. In the entire nation, it is considered one of the most distressed zip codes. So while the community in 61605, the folks who live there, they're vibrant, they're strong, but they have faced historically systemic problems that range from low education attainment to high crime rates to unemployment to poor health outcomes. to inadequate infrastructure, all of that in this single zip code. So this project funding will be used to address a number of these critically tough issues, including improving education outcomes, workforce training, and more. So just so important. The number of challenges that face the folks who live in 61605 really are one of the major drivers that have led me to introduce the Social Determinants Accelerator Act. And so I also want to thank you for increasing funding by $150 million for social determinants grants from this bill. This funding will help state and local governments all over the country develop and implement plans to fight the factors that impact people's, families' long-term health. So thank you very much, Madam Chair, for your hard work. I'm grateful to you. And with that, I yield back.
Ms. Herrera-Butler, virtual. Ms. Herrera-Butler, you're recognized.
Thank you, Madam Chair, for your work on this year's bill. And I also want to thank Ranking Member Granger and Mr. Cole. I love working on this committee. It is my favorite subcommittee, and you all do it justice. I want to say thank you for your continued support for key initiatives that are important to me and folks in Southwest Washington. 2 projects in my district received funding in this bill, specifically funding for battleground healthcare will allow for the expansion of healthcare services at a free clinic that serves underserved, uninsured, and low-income individuals. Additionally, the bill provides funding for Lifeline Connections in Vancouver, which is a nonprofit that runs a program known as Camp Mariposa to mentor children who are impacted by substance use disorder of a loved one. I also would like to thank you for the robust investment in maternal and child health, as my colleague Lucille Roybal-Allard has outlined. In particular, I want to say thank you for the increase in funding for the maternal and child health block grants, which are critical and provide services for 92% of all pregnant women and 98% of all infants. I'd also like to highlight the $10 million for the screening and treatment of maternal depression grant program at HRSA, as well as the $119 million for the Safe Motherhood Initiative at CDC to expand maternal mortality review committees, which have been landmark, and perinatal quality collaboratives to all states and all territories. This year's bill also includes important requests that I made along with Lucille Roybal-Allard to provide $1 million in funding to create the first ever stillbirth task force at HHS. I want to say thank you to Congresswoman Roybal-Allard for her continued collaboration with me on these critical maternal and child health initiatives. I love working with her. I'm also grateful for the committee's willingness to work with my office to include language that holds China accountable and ensures that none of the funds appropriated in this bill will go to the Wuhan Institute of Virology. And this is really important. It also includes language that I propose for a comprehensive review of data that has been withdrawn from the Sequence Read Archive at the National Institutes of Health. A report revealed that early COVID gene sequences were withdrawn from the Sequence Read Archive by a researcher based in China, including samples from Wuhan in January 2020 and February of 2020. The Chinese Communist Party has been deceptive since the beginning of the pandemic and has withheld data from the international community, and this is unacceptable. As a committee, we owe it to the 600,000 Americans who died from COVID-19 and their families to work towards understanding the origins of this virus. Again, I want to say thank you, Madam Chair, and to the ranking member for your work on this bill, and with that, I yield back.
Thank you. Mr. Pocan.
Thank you, Madam Chair, and I'd like to thank you, Rosa, and Mr. Cole for your hard work on this bill. Rosa, as you know, this is an amazing bill full of all sorts of things to help working people and children and people who need a little extra help. I literally have 2.5 pages of individual line notes on this, but in the best interest of not just helping the person who selected the longest time to end this evening, I'm just going to highlight a few of those. One, I want to thank you for some funds for one of my rural counties, Aging and Disability Resource Program. I also want to highlight the additional $100 million for registered apprenticeships as well as some additional language around that. The increase in NIH that's often had bipartisan support here, as well as some Alzheimer's language that was added in that area. And finally, the increase in Pell Grants. As someone who grew up in a lower middle class family and was a beneficiary of Pell Grants to get my education, I'm glad that we're able to start getting those increases in place, and I really appreciate that. And with that, I yield back.
Congresswoman Meng.
Thank you, Madam Chair, as well as Ranking Member Granger and Ranking Member Cole. Madam Chair, I'm especially grateful for your leadership and stewardship of this bill. And of course, thank you to the staff for working so tirelessly on this bill. I appreciate how open and willing they have always been to work with us. I rise in strong support of this bill. It is a strong bill, one that has so much heart. It is indeed the people's bill. It provides transformative investments in education and job training and supports working families by increasing funding for child care and development programs. And it addresses urgent health crises while taking strides to reduce health disparities. I want to thank the chair and ranking member for including a number of my priorities, including $5 million for a new grant program for colleges and universities to provide free menstrual products on their campuses. Last year, during the pandemic, 1 in 10 college students did not have access to period products. No student's education should be impeded by their access to these items. A provision to incentivize businesses to incorporate family-friendly practices in their workplaces, particularly in support of the 2 million women and 1 million moms who left the labor force during the pandemic. A provision to ensure our students in K-12 schools are being taught a full and complete history of our diverse nation. A provision to address the increased bullying against Asian American kids in our schools. A new grant program to address diaper needs, for which I was proud to work with Chairwoman Lee. A provision to evaluate the accessibility of Title IX resources during remote learning to ensure our students are protected in schools regardless of whether they're in person or online. A provision to address viral hepatitis, and the exclusion of the Hyde Amendment and the Weldon Amendment to ensure access to abortion care for all, and the inclusion of historic funding for Title X, standing up for women's rights and their whole health. I'm especially thankful for supporting critical resources to my district to address important community needs, such as improving women's early cancer detection and maternal health, mental health support, patients with end-stage renal disease, immigrant education services, research to prevent the spread of deadly pathogens like the coronavirus, and nutritional and emotional wellness programs for seniors. Thank you again, and I look forward to seeing this bill on the floor. I yield back.
Thank you. Mr. Cuellar.
Thank you, Madam Chair, and I want to thank you and the ranking member for putting this bill together. Most of the bill, I think we have an agreement on. We do have some agreements, but we do understand the process. And as we go on, we will work it in a bipartisan way to come up with a final solution on this bill. I also want to thank the full committee ranking woman also, Ms. Ranger, for all the work that she's been working with you, and congratulations on your first bill on this. And I want to say thank you, your first year, should I say, Chairwoman DeLauro. A couple of things I want to emphasize: education and healthcare. Education, certainly want to say thank you for the Title I increases that we have. Certainly want to say thank you for the $200 million increase for the federal TRIO programs. Certainly I want to say thank you for the $20 million increase for the CAMP, which is a college assistant migrant program. Thank you so much for the $40 million increase for the Gear Up program. And of course, the Pell Grant, as my friend Ms. Prokan also said, I also depended on that. And it is something that's so helpful for students in our area. Health, the increase of money for the LEHEAP, which is the Low Income Home Energy Assistance Program. Thank you again for the $140 million increase for community health centers, are so important in my district and across the country. Also want to say thank you for the $45 million plus monies for the colorectal cancer for prevention and grants, which will be grants that can be provided by the National Institute of Health also. For the children and certain, there's 3 hotlines that were set up. The maternal mental health hotline, thank you for that. The monies that we added for the child abuse hotline, thank you for that. And the domestic violence hotline increased dollars, thank you for that. Finally, on the U.S.-Mexico border, thank you for putting the resources for ORR. But also thank you, Madam Chair, for the U.S.-Mexico border health. As you know, the border is a very dynamic area. So the monies for health and coordination for the people that live down there, I want to say thank you. And with that, I want to say thank you for working in a bipartisan way, Madam Chair. Thank you so much.
Thank you. Ms. Underwood.
Thank you, Madam Chair. I'd like to thank you and Ranking Member Granger, as well as Ranking Member Cole and the subcommittee staff for your hard work to prepare the fiscal year 22 Labor, Health and Human Services, Education, and Related Agencies Appropriations Bill. As a nurse and former senior advisor at the Department of Health and Human Services, I'm proud to support this bill, which makes critical investments in our children, workers, and families all across the country, especially in my Northern Illinois district. Thanks to the Community Project Funding Initiative, this bill includes funding that will be transformative for 4 organizations in my district. The first is a project to expand the dual credit program at McHenry County College, the very community college where last week I was overjoyed to welcome President Biden to talk about how critically important investing in our community colleges will be for our recovery and the futures of our students. Expanding MCC's dual credits program will give more students a jump start on college and strengthen the skilled workforce at the foundation of our community's economy. And at the other end of our educational system, this bill includes funding for an innovative program to address kindergarten readiness gaps in DeKalb County, Illinois, to make sure our youngest minds are set up for success. The bill also includes funding for a nonprofit organization in Woodstock to upgrade their medical record systems to better support adults with disabilities and community members experiencing mental health conditions and substance use disorders. And finally, the bill includes funding for an initiative in Kane County, which will invest in community-based harm reduction interventions. These community projects will improve the health and well-being of my constituents, and I am grateful to Chair DeLauro for including these priorities in the bill. I would also like to thank the Chair for including so many critical investments to address our nation's maternal health crisis, a priority for me and for the Chair, as well as many other members of this committee. In particular, the bill includes significant increases in funding for CDC's Safe Motherhood and infant health programs, including perinatal quality collaboratives, which are state networks of teams working to improve quality of care for mothers and babies. The Perinatal Quality Collaborative in my state of Illinois is leading innovative programs to address perinatal mental health conditions and substance use disorders, expand access to care in the postpartum period, and advance birth equity. In addition to supporting initiatives like these, this bill also includes investments in the perinatal workforce, trainings on implicit bias and racism in healthcare, key measures to prevent perinatal suicide, and increased funding for maternal health programs at HHS, like surveillance for emerging threats to mothers and babies, the Maternal and Child Health Block Grant, maternal mortality review committees, and AIM safety bundles. As a co-founder and co-chair of the Black Maternal Health Caucus, I am proud to support these priorities that will reduce maternal mortality, morbidities, and disparities in our country. And as a public health nurse, I'm pleased to support the robust increases in funding for Title VIII nursing programs and the National Institute for Nursing Research, as well as an unprecedented $1 billion for public health infrastructure and capacity, which will support state and local health departments across the United States. These priorities, coupled with important investments in initiatives to tackle gun violence, strengthen tobacco control efforts, increase immunization rates, and support Title X family planning programs, will save lives and improve the health of individuals, families, and communities. The bill also supports our families and our kids through greater funding for vital child care and development programs, including a $1.4 billion increase for Head Start. Thank you again to Chair DeLauro, Ranking Member Cole, and all the staff who put this bill together. I look forward to supporting it, and I urge all my colleagues to do the same. I yield back.
Thank the gentlelady, and we thank you for your leadership on maternal health. Congresswoman Wasserman Schultz.
Thank you, Madam Chair. I want to take a moment to thank you for your leadership on the bill before us. As the world continues to battle with the COVID-19 pandemic and its ensuing negative effects on healthcare access, especially for women and minorities across this country, this bill includes resources that are vital for not just the response, recovery, and prevention, but the success of our nation. First, as a breast cancer survivor, I'm thrilled that the bill helps ensure that young women have access to coverage for breast cancer screenings. It includes vital funding for Early Act activities, an initiative I passed into law to promote breast cancer awareness for young and at-risk women, and increases that funding to $5.96 million per year. It also extends a moratorium on the outdated and harmful recommendations from the USPSTF concerning access to breast cancer screening, mammography, and prevention through 2024. The bill also includes language directed at these shortcomings within the USPSTF, addressing the need for comprehensive reform to ensure their recommendations further public health for all Americans and address health inequities. And I know the Chair shares my longstanding concern over the USPSTF's policies and the way they make decisions. With COVID-19 overwhelming our hospitals and screening rates dropping dramatically, preventative health care is more urgent than ever. The bill continues to support cancer survivorship through its inclusion of additional funds to programs in the CDC that invest in our quality of life long term. And I'm extremely pleased that the bill establishes a new program, the Alcee L. Hastings Program for Advancing Cancer Screening in Underserved Communities, which will fund health centers to increase access and address barriers to cancer screening in partnership with NCI-designated cancer centers. Mr. Hastings was a cherished friend and mentor, and I'm proud to see a program dedicated to saving lives in historically underserved communities named in his honor. Additionally, this bill doubles funding for Holocaust survivors, many of whom faced countless obstacles as they age. Doubling the funding now, as we have an ever-shrinking population of Holocaust survivors, will make sure that we can maintain and improve their quality of life in their final years. Madam Chair, when it comes to protecting our youth, we continue to prioritize their health, safety, and well-being in this bill. I'm thrilled to see increased funding for the CDC's Office of Smoking and Health, aimed at helping combat the continuing e-cigarette epidemic among youth. The bill also directs $2 million to the CDC to make drowning prevention a priority. For children ages 1 to 14, drowning is the second leading cause of unintentional injury death. The language in this bill not only aims to support state drowning surveillance efforts and a national plan on water safety, it encourages an emphasis on lifeguard science and prevention for those at greater risk of drowning, such as children with autism or specific racial and ethnic groups. I'm pleased that this bill reaffirms our constitutional right as members of Congress to perform oversight by ensuring we have access to ORR facilities for migrant children. I hope we can maintain this language in conference, including the provision that enables us to visit without prior notice. The bill also includes language that prevents ORR from putting unaccompanied children in unlicensed facilities that aren't in compliance with the Flores settlement and other monitoring requirements. I continue, along with many others, to urge the administration to work to stand up more licensed facilities and refrain from using influx facilities to ensure migrant children are housed in the safest conditions possible. Madam Chair, with the next school year quickly approaching, I'm proud that we are reaffirming our commitment to the social, emotional, and physical safety of our youth with a new $10 million school climate and safety pilot program. It will enable states and local school districts to develop and implement evidence-based plans that tackle school-based issues across the spectrum, from bullying to seclusion and restraint to even preventing a future mass shooting. And finally, we know that the pandemic has impacted women in epic proportions, and I'm thankful that this bill combats this she-session in numerous ways, including through my language that will ensure the Department of Labor makes reversing women's unemployment in the U.S. an agency-wide priority. To support women further, this legislation historically excludes the Hyde Amendment for the first time in decades, ensuring that access to abortion care and reproductive freedom is a reality for all women, including those who get their health care coverage through HHS programs like Medicaid. When women are supported, our families are supported, and through this bill is a testament to that notion. I thank the Chair for her work, and I look forward to helping her bring this bill to the floor. Thank you, and I yield back the balance of my time.
Thank the gentlelady. Mr. Fortenberry.
Thank you, Madam Chair. Chair DeLauro, I want to thank you and Ranking Member Cole for your emphasis on working in a cooperative spirit on areas in which you agree and working as well collegially in the areas in which you disagree so that we can continue to move forward in some kind of constructive manner. My point of speaking now is simply to put an accent mark on what Representative Quigley said earlier. I'm so grateful for my friend's leadership on a whole host of things, but particularly in seeking cures and better access to treatment for ALS. Chair DeLauro, you've listened to my plea in this regard. You know the suffering that this disease category has caused and so many other neurodegenerative diseases as well. And all of us, of course, know we've seen what the pandemic has done when we can use a whole-of-government approach coordinated with the private sector to actually think constructively and creatively and create a sense of urgency in order to get things done. So in this particular way, I just wanted to say thank you for helping, again, Mike Quigley, myself, and so many others. We've got about 300 bipartisan co-sponsors on a new bill coming to drive the hope. Thank you so much.
Let me just say a thank you to both you and to Mr. Quigley for your leadership in this effort, and your concerns and ideas and focus has not gone unnoticed. So it's really, thank you, it's a collaborative effort. Mr. Bishop.
Thank you, Madam Chair. I'd like to just take a moment to thank you, Ranking Member Cole, Ranking Member Granger, and the members of the subcommittee for your strong support of the American people through this appropriations bill. You are supporting the important programs in the Department of Labor, the Department of Health and Human Services, the Department of Education, and the related agencies that mean so much to all of the American people. And I just want to thank you for your hard work in this regard. Your leadership, bringing this bill before us in regular order, the collaboration, the compassion, and the passion that is demonstrated in this work product is exceptional. I'd like to just lift up a couple of programs that I'd like to thank you tremendously for. First of all, your mark for the Job Corps, $81 million increase over last year's budget. I'm the co-chair of the Friends of the Job Corps Congressional Caucus, along with my colleague from Kentucky, Representative Brett Guthrie. We proudly led the Job Corps FY22 appropriations, dear colleague, earlier this spring, which received 152 bipartisan signatures of support, which is a record number for any Job Corps appropriations letter. The appropriations letter funding levels showcase the broad bipartisan support for Job Corps and its students, staff, and campuses. This well-deserved funding increase for Job Corps is needed now more than ever as our country emerges from this pandemic. I'm fortunate to have the Turner Job Corps campus in my district in Albany, Georgia, one of 121 active campuses around the country. I've seen firsthand the impact that the Turner Job Corps Center has made on thousands and thousands of young people. This increase will help to ensure that the Job Corps staff who've gone above and beyond supporting their students throughout COVID are compensated fairly while also addressing the backlog of infrastructure projects at Job Corps campuses nationwide. Ultimately, this increase will be of most benefit to the tens of thousands of deserving young people that Job Corps annually serves who are seeking a better path forward for themselves and their families. In addition to the Job Corps program, I want to applaud the subcommittee for its strong but necessary support for the Centers of Disease Control and Prevention and its public health programs. The last year has made it overwhelmingly clear how vital it is for our nation and the entire world to have a strong public health infrastructure supported by the CDC. I'd be remiss if I failed to note that CDC also is one of the crown jewels of Georgia's economy. The CDC has almost 10,000 employees in Georgia, making it one of Georgia's top 15 employers. 60% of CDC employees have a master's degree or higher. And if CDC were a public company, its annual operating budget would rank 107 on the Fortune 500 list, and it would place it among the top 5 largest companies in Georgia. CDC has a 5.3 million square foot office space and lab space in the state, and it has purchased $218 million worth of goods and services from Georgia businesses each and every year. So I applaud the chair, ranking member, and the entire subcommittee for your continued support of Job Corps and the CDC. I'd like to also just thank the chair lady and the ranking member for your support of our priority projects with the community project funding. $100 million to the Phoebe Putney Health Systems in Albany, Georgia, to support the mobile medical units program for the purchase of 2 mobile clinics that will address the crisis in rural health care access in southwest Georgia. $1.1 million for the Caregivers Database Program at the Rosalind Carter Institute for Caregivers in Americus, Georgia. Very, very much needed and very well appreciated. $1.5 million to the Georgia Family Connection Partnership to mitigate the learning loss in all 29 counties in the 2nd Congressional District through implementing and strengthening the 4 pillars of the Get Georgia Reading Campaign, Georgia's 3rd grade reading proficiency initiative. These are very, very important projects, and I want to thank this committee for funding them and for the tremendous support that you're giving. This is a good bill. A lot of work went into it, and I just want to urge my colleagues to support it so that we can continue to provide the tremendous support from the agencies included in this bill throughout our country and Georgia.
Thank you. Thanks, gentlemen. Mr. Rogers.
Thank you, Madam Chair. I want to join in saluting Ranking Member Cole and Chair DeLauro. They've again proven to be great partners, ensuring that many of our priorities are included in this bill. I want to specifically thank you both for providing significant and much-needed funding increases to combat the nation's opioid epidemic, which, as you now know, is soaring anew. And it's now in competition with the pandemic to win the title of being Devil's Choice. So, you know, as many of you on the committee know, my district was ground zero for the opioid crisis years ago. We have made great strides to combat the epidemic, but the recent rise in overdose deaths is a serious cause for deep concern and a reminder that we can't let up our efforts in this fight against opioids. Just yesterday, the CDC reported drug overdose deaths increased by nearly 30% last year. That's 93,000 lives lost in 2020 alone. The most drug overdose deaths in any year to date. We've set a record. We need a multifaceted response to this epidemic. I started Operation Unite, which stands for Unlawful Narcotics Investigations, Treatment, and Education, in 2003. It's a holistic approach, now a nationwide model. And I'm pleased this bill includes funding for programs that focus on all areas of the opioid crisis, from prevention to treatment. In rural districts like mine, it's difficult to find people willing to work in substance use disorder. Yet this is often where these critical workers are in fact needed most. That's why I partnered with my friend Congresswoman Clark to create the Substance Use Disorder Treatment and Recovery, or STAR, loan repayment program for individuals working on the front lines of this crisis. I'm pleased the STAR program is robustly funded at $28 million. These workers are giving their all to help those facing addiction, and loan repayment assistance is just one of the ways we can support them in their work. These highlights notwithstanding, I'm very concerned, Madam Chair, about the massive top-line funding level and the many extreme policy riders in this bill, particularly the removal of the Hyde Amendment. Put simply, not including the Hyde Amendment will make it impossible for this bill to pass both chambers. For nearly 45 years, this simple amendment has been included in our bipartisan appropriations bills. Taxpayers should not be forced to finance abortions, and I'm saddened that this long-standing common sense language has been removed. I hope we can work together to ensure the Hyde Amendment is included as we move forward in this process. Thank you, Madam Chair, and I yield back.
Thank you, and we thank you to the former chair of this committee for your leadership on the opioid abuse issue. Mr. Espaillat.
Thank you, Madam Chair. Once again, I would like to thank you and Ranking Member Cole and committee staff for your hard work in this important bill. The bill supports our nation's workforce, public health systems, education starting from early Head Start through college, and many priorities that we all share. I especially want to thank you, Madam Chair, for including all my community project funding requests. During this pandemic, many of my constituents in Harlem, Washington Heights, Inwood, and the Northwest Bronx have grown to know the importance of their local medical institutions, their higher education institutions, their non-for-profits, and the role they played during the pandemic and the role they must play as we come out of this pandemic and recover. This bill supports many meritorious initiatives that are, for the most part, COVID-19 related and seek to have my district recover from the pandemic. They include, for example, mental health services. As you may know, Madam Chair, many families lost their loved ones and they were unable to appropriately say goodbye to them. Mm-hmm. Folks lost their jobs, so maybe had to shut down their business. People were in the hospital for 2-3 months fighting for their lives. We had to keep our kids at home and instruct them in distance learning. And so this was almost like a perfect storm that has propelled a mental health tsunami. So this bill addresses that need in my district. But it also talks about broadband and Wi-Fi connectivity. And we all know the struggles that parents had with their kids at home and distance learning. It talks about school-based health care as we try to reopen our schools. Telehealth for seniors, right? Many of the seniors now are involved in telehealth with their local physicians. And of course, small businesses and local commerce is so important for the recovery. So I am proud and thankful that this bill addresses all of those areas for my district in northern Manhattan, Harlem, East Harlem, and the Bronx. Neighborhoods that were struck by some of the highest levels of positive cases and death in the country. So I have some of the zip codes with the highest number of deaths during the pandemic. And very clearly remember New York's response to this crisis. And we also remember how we were faced with Ebola not too long ago. And this committee, in its wisdom, provided as per resources to deal with that health emergency. This is exactly what we need to do during the COVID-19 pandemic recovery. there could be a surge again, unfortunately, Madam Chair, of the Delta variant. We see that happening across the country, that is rising across our neighborhoods and cities and states across our nation and overseas, and we need to be prepared. I am grateful that the committee is increasing $25 million above the fiscal year 2021 enacted level to expand the number of regional Ebola and other special pathogen treatment centers. I am pleased to provide $1 billion for the Title III English language acquisition, supporting English language learners. This is so important to my district and the country. These are students, as I was one, whose first language is not English and requires specialized assistance and instruction. Before I close, Madam Chair, I want to thank the committee for its support of the Nita Lowey 21st Century Learning Centers that our former chair was a strong believer in. I am pleased that the committee also has committed funding for the National Museum of the American Latino, an achievement that our former colleague, Jose Serrano, left for many years and saw signed into law during his last term in Congress. And finally, I want to highlight advanced cancer screening for underserved community. The disparity in screening and corresponding higher levels of incidence and adverse outcome has grown wider during the pandemic. And I want to thank the committee for its commitment to closing this gap and the recognition in naming our late colleague, Congressman Alcee Hastings, who passed earlier this year from pancreatic cancer. Thank you again, Madam Chair and Ranking Member, for working with me on many of these initiatives and for your work on these important issues. I yield back.
Thank you. Ms. Wexton.
Thank you, Madam Chair. I would like to thank you, Ranking Members Cole and Granger, as well as subcommittee staff for all of your hard work in preparing the FY22 Labor-HHS appropriation bill. I was pleased to see so many provisions in this bill that support children and families by providing robust funding for some of this nation's most critical programs, including child care and early Head Start, gun violence prevention, mental health and substance abuse services, job creation, and K-12 and post-secondary education. As the founder of the Congressional Task Force on Digital Citizenship, I'm proud to see the inclusion of report language that directs the Department of Education to raise awareness of digital citizenship education in our K-12 schools. As technology becomes an integral part of classroom learning and daily living, it is imperative that students are equipped with the skills that allow them to engage responsibly online. In addition, the bill prioritizes research at NIH on the cognitive, physical, and socio-emotional impacts of technology on young people and encourages a study into the repercussions of increased technology as it relates to suicidal ideations among children. We have a responsibility to ensure our children's digital safety and well-being, and I'm glad this bill takes many steps in the right direction. I would also like to highlight the vital funding, including in the Labor-HHS bill, for the Gabriella Miller Kids First Pediatric Research Program, commonly known as Kids First, which has made significant progress towards understanding childhood cancers and rare diseases. This program was named in honor of my constituent Gabriella Miller, who passed away due to an inoperable brain tumor at the age of 10. I am proud to continue to advocate for this research in her honor until no family has to go through the pain that the Miller family did. Furthermore, I would be remiss not to mention the investment in domestic violence service and prevention of efforts included in this bill. The COVID-19 pandemic has exacerbated the domestic violence crisis in our country, and the decrease in VOCA funding for service providers has left many of our shelters on the brink of closure. The funding included in this bill for domestic violence services, hotlines, and shelters is a great start in relieving some of the weight placed on our service providers, but there is a lot more that must be done to ensure that the resources provided at both the federal and state level can meet the needs of survivors and those affected by domestic violence. I urge all of my colleagues to support this very fine bill, and I yield back.
Thank you. I want to just say a quick note to Mr. Espaillat. Thank you for mentioning Congresswoman Lowey and Serrano and former Congressman Alcee Hastings. Much appreciated in this body. People well respected. Ms. Susie Lee from Nevada.
Thank you, Madam Chair. I want to thank you as well as the ranking member and the staff for this amazing bill. For the past year, we've all risen to speak over and over again about the pandemic and the grief and the mourning, as well as our ability to rise and fight for working families in our economy. And now, as we vote for next year's funding, we have to look into the future. And as this pandemic has hit us all hard, and it's turned all of our lives upside down, perhaps most of all, our children. And as a former education advocate, I carry the fight for our children to Congress. And that's why I am so proud that this funding bill takes the necessary steps to invest in education and invest in our children. This includes funds that are headed back to Nevada, $950,000 for social workers in Clark County schools, which will provide critical services directly to students and families. $975,000 to expand STEM education opportunities with the Nevada STEM CoLab. $35,000 to invest in educating our nurses at Nevada State College, and an increase in $413 million in funding for full-service community schools. But we also learned in this pandemic that there is a lot to be done to invest in our healthcare systems. From the care economy to mental health resources, there are so many ways that we need to reflect on this year's past and build a better, healthier future. And this includes important investments nationally and locally in Southern Nevada to expand training, educational opportunities, and much-needed access to direct care workers with the Direct Care Workforce Demonstration Program. Increased investment for the Zero Suicide Program, a comprehensive multi-setting approach to suicide prevention in community health systems, and $6.7 million increase for area health education centers to continue and expand their work. All of these investments are for a far better, healthier future, and they get to the bottom of the job here on this Appropriations Committee, to invest these resources right back into our communities, building and expanding American opportunity. And fundamentally, I know that education is the key to that opportunity. And for that reason, I urge my colleagues to join me in supporting the incredible investments that we are making today in this funding bill. Thank you, and I yield back.
Thank you. Are there any other members wishing to make general comments on the bill? Mr. Harder.
Thank you so much. I want to start by thanking Chair DeLauro and her incredible staff for all the work that they've done throughout this appropriations process. In May, I spoke in front of this committee about a critical healthcare issue facing our community in the Valley, access to high quality and affordable mental health services. I didn't sugarcoat it then, and I won't sugarcoat it now. We have a mental health crisis in California every single day. It's tearing up our families, and it is worse in our district because we have half the number of mental health providers as the rest of the state. To put this in context, the largest mental health provider in California is the LA County Jail. This system is terribly broken, and we need to fix it fast. And when I spoke in May, I identified 3 common sense, impactful solutions that would make a huge difference in our community. And I'm proud and thankful to say today that all 3 have been included in this bill. They're not pie-in-the-sky, Hail Mary type fixes. These are proven projects that will have an enormous impact in our community this year. First, we're going to be able to tackle mental health access. There's funds in here for the first behavioral health urgent care center in Turlock, my hometown, which is going to be able to hire new bilingual staff, including a behavioral health clinician, and kickstart new programming to fight the stigma attached to mental health care. That's going to help 1,000 new folks every year, largely from our underserved Hispanic and youth populations. Second, we're addressing the joint emergencies of mental health and homelessness by funding the Mental Health Residential Facilities Bed Shortage Regional Partnership. This is going to bring our counties together to make sure that we have a plan for anyone experiencing a mental health crisis or homelessness. This is going to give us a major step forward towards establishing a new mental health facility in the Central Valley. And third, we're connecting with kids with the support for the Promotoras Community Health Outreach Program. These are Spanish-speaking professionals who use their community know-how to connect families to the health and service education that they need. And when we pass this bill, we are going to double the number of full-time staff in the Promotores program, allowing this highly successful program to expand partnerships directly with local schools to help parents and their kids early on before a one-time issue becomes a lifelong health battle. There's no silver bullet to solving our healthcare emergencies. We still need to address the wholesale doctor shortage we've got in the Valley, but these 3 projects are going to go a long way towards making sure that we can help the folks who need it most. So thank you, Chair DeLauro and your staff, for working with me, and our community thanks you as well.
Thank you. Are there any other members wishing to make general comments on the bill? Seeing no other member wishing to make opening remarks, I'd like to recognize myself to offer a manager's amendment, which is at the desk. And without objection, the reading is dispensed with. As I mentioned in my opening remarks, members submitted more than 15,000 requests to this bill. We were able to accommodate the vast majority of those requests, either fully or partially. Over the last few days, I have worked with Mr. Cole, and I have a manager's amendment making a number of non-controversial technical changes to the bill and report for programs that are of interest to many members of the committee on both sides of the aisle. I appreciate the close collaboration I had with Mr. Cole and his staff in putting this amendment together, and we are in agreement. I urge the adoption of the amendment. Mr. Cole.
Thank you, Madam Chair. I just want to thank you and your staff for the enormously cooperative manner in which we work together on the manager's amendment. We certainly has our full support, and urge its adoption.
Are there any of the members who wish to be heard on the amendment? Mr. Aguilar?
Thank you, Madam Chair. I rise in support of the manager's amendment and will just say briefly that this amendment includes language to help Hispanic serving institutions. Hispanic college student enrollment continues to grow more quickly than any other group in the United States, meaning soon we will have more Hispanic serving institutions throughout the country. And while this progress is welcome news, we have to make sure that these institutions are receiving adequate funding and upgrades to ensure that all students can access high-quality education. In my district, HSIs play a key role in allowing students from all backgrounds, to gain education to enter the workforce in confidence. Investments in these institutions like Chaffey College, San Bernardino Valley College, and Cal State San Bernardino are direct investments in our community and in our economies. This amendment will specifically require GAO to study the physical and digital infrastructure needs at HSIs across the country. And it'll give our committees a benchmark moving forward so they can ensure these important institutions have the resources they need to help make sure our students succeed. I thank the chair and the ranking member for their support and urge advocacy. Thanks so much. Yield back.
Are there any other members who wish to be heard on the amendment?
Madam Chairman.
Yes, Judge Carter.
Thank you, Madam Chairman. I ask to be recognized in support of the manager's amendment. And I want to thank the chairwoman and ranking member for including important language that prevents America's hard-earning tax dollars from being used to support the Wuhan Institute of Virology or gain-of-function research in China, Russia, Iran, and North Korea. Since patient zero was identified in Wuhan in December 2019, the coronavirus has killed over 4 million people worldwide. It has devastated economies and has caused endless suffering. While we have much to learn about the origins or spread of this pandemic, one thing is certain: not a cent of American people's tax dollars should go into this lab or toward gain-of-function research into potential pandemic pathogens by our adversaries. I celebrate the inclusion of this language, I applaud the job well done by my colleagues, and I yield back.
Thank you. Are there any other members who wish to be heard on the manager's amendment? Recognize myself for just really one sentence. I urge support of the manager's amendment. The question is on the manager's amendment. All those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it, and the amendment is adopted. Are there further amendments? For what purpose does the gentleman from Oklahoma rise?
Madam Chair, I have an amendment at the desk.
The clerk will read the amendment.
I ask that the reading be dispensed with, Madam Chair.
The gentleman is recognized for 5 minutes on the
Thank you very much, Madam Chair. Madam Chair, my amendment is simple. It restores the language carried in this bill for over 45 years that protects life and prevents federal taxpayer-funded abortions. Since it was first enacted in 1976, it's estimated that this provision, known as the Hyde Amendment after its original author, the late Congressman Henry Hyde, has saved more than 2 million lives. The language has been supported by lawmakers and signed into law by presidents of both parties every year as part of the appropriations process. And every Democratic member sitting in this room today has voted for it in the past as recently as last December. When President Biden was serving in the United States Senate, he supported including the amendment in appropriations bills and showed support for this provision as recently as just 2 years ago while campaigning for president. He's since flip-flopped on this issue under pressure from the far left, which controls the Democratic Party in this area, and has proposed removal of protection in his budget request. But this bill goes even further than just forcing American taxpayers to foot the bill for abortion on demand. This bill also deletes conscience protection language added 16 years ago by then Congressman Dave Weldon. That language protects American doctors, nurses, and other healthcare professionals from participating or providing an abortion if they have a moral objection. This is an essential right of every American, and its removal is a danger to us all. I want to point out that even President Biden's left-leaning budget did not propose removal of this important language. Last month, 22 state attorney generals sent a letter to congressional leaders outlining in detail their objection to the removal of the Hyde Amendment in the President's FY22 budget request. Repealing the Hyde Amendment would impose a pro-abortion funding policy on states that have decided against it, they stated. The Hyde Amendment allows states to choose to fund elective abortions or not with state taxpayer dollars, and the people and elected representatives of 34 states have voluntarily chosen not to do so. I will always come down firmly on the side of protecting and saving the lives of unborn children, as well as defending the conscience rights of American taxpayers. I do recognize that the issue of abortion is emotionally charged and that many Americans have differing points of view. But even for Americans who consider themselves pro-choice on this issue, many, if not most, don't believe tax dollars should be used for abortion. In fact, 60% of Americans oppose taxpayer funding for abortion. Gutting the provision, a provision that has been included in appropriations bills for nearly 50 years, is certainly an overreach by the left. But in my opinion, it also threatens to destabilize the entire appropriations process, because this bill will never become law if the Hyde language is not included. Democrats in Congress simply do not have the majorities capable of passing this bill without Republican votes. The United States Senate will never pass this bill without the Hyde language. And 200 of House Republicans have already signed a letter to congressional leaders earlier this year pledging to oppose any federal government funding bill that would weaken or eliminate long-standing pro-life protections. Madam Chair, I think abandoning all the work done this year in favor of a full-year continuing resolution that simply reestablishes the budget negotiated by the last Congress and President Trump would be a failure in our responsibility as legislators and as appropriators. But that is the path we are on, this bipartisan language protecting taxpayers and vulnerable unborn children is not included. I want to again reiterate those points I made in my opening statement. There are several deeply concerning and troubling parts of this bill. There are many amendments that could be offered to make this bill better and address those concerns. But this is the only amendment we all know must be addressed before any other issue can be considered. If we cannot get agreement here, it does not matter how we handle any other concern from our side of the aisle. The bill is guaranteed to fail. There's no moral equivalent to life or death. The preservation of one of our nation's most enduring compromises to protect life
and respect religious belief goes back to our founding principles. Any other issue falls far short of that standard. That's why we offer this amendment first. That's why this amendment has unanimous support on our side, and that's why we'll vigorously fight to ensure the amendment is included in any final agreement. No other issue that we discuss today will carry such importance. Removing the Hyde Amendment is an extremist left-wing proposal that is out of step with the values of the American people and cannot become law in this Congress. I urge the passage of the amendment, and I yield back the balance of my time.
I rise in strong opposition to this amendment. The Hyde Amendment is a discriminatory policy. For more than 40 years, it has been routinely extended every year as a legislative rider. But the time has come to reckon with the status quo. A status quo that denies help to the poor, in this case, disproportionately denying people of color health services available to those who can afford this choice. I said last year that we would not include the Hyde Amendment in the House Fiscal Year 2022 Labor-HHS bill, and as promised, it is not included in the bill before us today. The inequities in our country's healthcare system that have been exposed by the COVID-19 pandemic all further expose the impact of the Hyde Amendment. Systemic racism makes itself felt here, and it is time that we insist on equality for women, particularly women of color. However we feel personally about abortion, we should not deny health coverage just because someone is working to make ends meet. When Medicaid covers the costs of pregnancy-related care, including abortion, it means someone can make a decision based on what is best for their circumstances. However, 33 states and the District of Columbia deny state funding to women seeking access to abortion. And as a result, the millions of economically insecure women in these states are hostage to their geography. And who is harmed the most by the Hyde Amendment and being forced to continue unwanted pregnancies? More than half, 58% of the women affected by the Hyde Amendment are women of color. Almost 1/3, 31%, are Black, 27% Latina, nearly 1/5, 19%, Asian Americans and Pacific Islander women, as well as Indigenous women also covered by Medicaid. The Weldon Amendment has also been removed from the bill. A patient's health and well-being should always come first. But the Weldon Amendment prioritizes a provider's beliefs over a patient's health needs. It gives the power to determine women's health choices to institutions, insurance companies, hospitals, or any kind of health care facility or organization, rather than leaving that decision to a woman. The Weldon Amendment has been invoked in attempts to block policies to expand abortion coverage by threatening policymakers with the loss of critical federal health dollars. The previous administration weaponized this amendment to threaten states that sought to ensure abortion coverage and to make it harder for patients to access reproductive health care. In fact, in the last days of the Trump administration, they attempted to use the Weldon Amendment to cut health funding from California in the middle of a pandemic, because California ensures coverage for essential reproductive health care. I am proud that the bill we are considering today moves us forward in ensuring access to essential reproductive health care services. It protects women's health. It empowers all women by eliminating these riders, which for years have allowed certain politicians to insert themselves into women's most personal health care decisions. The decision to get an abortion should be made by a woman and her family in consultation with her doctor and in accordance with her own faith. The decision should not be made by the people in this room, and I urge my colleagues to oppose this amendment. And with that, let me recognize Congresswoman Granger.
Thank you, Madam Chair. I shall be brief, but I will be adamant. I support the gentleman from Oklahoma's amendment and his stated reasons for it. The Hyde Amendment has been part of the Labor-HHS annual appropriations bill for more than 40 years. More than 20 peer-reviewed studies have shown that over 2 million people are alive today because of this provision. The Hyde Amendment also reflects a long-standing compromise on a controversial issue. Polls show that even many people who consider themselves to be pro-choice don't want their taxpayer dollars to be used to pay for someone else's abortion. The Hyde Amendment provisions have kept annual federal spending bills from being bogged down in abortion politics for 40 years. The removal of this provision is deeply troubling to me, both morally as well as what it means for the appropriations process and bipartisanship moving forward. I urge a yes vote on the amendment, and I yield back.
Are there other members wishing to be heard on the amendment? Ms. Lee.
Thank you very much, Madam Chair. I am in strong opposition to this amendment to restore the Hyde and Weldon riders in this bill. Let me tell you what Henry Hyde said in 1977 when I was on the staff of Chairman Ron Dellums. He said, "I certainly would like to prevent, if I could, legally, anybody having an abortion, a rich woman, a middle-class woman, or a poor woman. Unfortunately," he said, "the only vehicle available is the Medicaid bill." That means poor women. My majority are Black and women of color. Let us call this out for what it is. It's racist and discriminatory. This is about controlling people's lives rather than allowing them to have the freedom over their bodies. It's a discriminatory, dangerous policy whose impact falls hardest on women of color and low-income women, denying them access to the full spectrum of reproductive health care. And despite my colleagues on the other side claiming that abortion is not health care, it is. The majority of voters in America do believe Medicaid insurance should cover abortion care, just as it covers other related pregnancy care. Now, the other side would also try, which they're doing, to mislead us and give us misleading data. But we have the latest polling that shows the American public truly wants this. Each of us should be able to live, work, and make decisions about our health and our future with dignity and respect. When elected officials can make decisions about their own reproductive health care, make decisions about others' reproductive health care, including whether and when and where to have children and at what point in their life, they have a real focus on taking away women's freedom in terms of their economic security and in terms of their decisions to make healthcare decisions about their own bodies. And so it's not the place for someone else to decide, especially elected officials, whether they should get an abortion, which is a deeply personal decision. Many of us know that. This is a decision someone should be able to make with their family, their doctor, and according to, if they have a faith, according to their faith. This decision is also our constitutional right under Roe versus Wade, and this is about equal access regardless of how one is insured. And it's unconscionable to force low-income and women of color to be unable to make their own reproductive health decisions. because it's our constitutional right. Yet that's what the Hyde Amendment does for too many people working to make ends meet. This is a racial justice and an economic justice issue. I'm committed to ensuring that people of color working to make ends meet can make their own decisions about their futures with dignity and respect. The Weldon Amendment, it's a harmful rider that has been tacked onto this bill and works alongside the Hyde Amendment to interfere with abortion coverage and care. The Weldon Amendment is one of several refusal of care provisions that prioritize a provider's preference over a patient's health needs. Together, they embolden providers, hospitals, and insurance companies to use their own personal beliefs to determine patients' health care and to deny abortion care and coverage. It's been weaponized against states and local governments that want to protect access to abortion coverage or care, including policies that ensure a patient's access to care is not determined by the personal and religious beliefs of others. Patient health care must always come first, but Weldon, like other refusal of care laws, emboldens policies that prioritize personal and religious beliefs over a patient's health. Eliminating it is a crucial step to ensuring that a patient's access to care is not determined by the personal and religious preferences of others. A patient's ability to access health care should never be restricted on the opinions and beliefs of others. I know very well what it's like when access to health care is restricted by discriminatory beliefs. My mother almost died giving birth to me simply because of the color of her skin. When she went into labor, she went to the hospital, she was refused admission, and she nearly died as a result. And I almost did not make it into this world because of the refusal of care due to the hospital's refusal to admit my mother because of their personal beliefs that Black women should not be admitted. That is a fact. So this is the real impact of refusal of care laws. And we must work to put an end to these types of harmful and discriminatory policy provisions. Thank you, Madam Chair, for making sure this bill does not include them, and I urge you to vote no on this amendment.
Mr. Rogers.
Thank you, Madam Chair. I rise in strong support of this amendment. Without its adoption, as Mr. Cole has said, this bill will go nowhere, and all the work this committee's done will go down the drain. I've had the pleasure of serving on this committee for many years, in fact, longer than any of you. But this committee sets the example of bipartisanship so that other committees would follow. But poison pills, like removing the Hyde Amendment to this bill, do not follow that example. I know we don't agree on abortion. This amendment doesn't try to solve that debate. It merely ensures taxpayer funds are not used to fund abortions and protects healthcare providers who conscientiously oppose abortion from being forced to perform one. So, I urge the adoption of this amendment. The American majority agree taxpayers should not be forced to fund abortions with their hard-earned tax dollars. It's imperative that we demonstrate to the American people that we're listening to them and producing legislation that's reflective of their views. The respect for life is one of the founding principles of both our nation and our healthcare system. No system that stabilizes abortions can be said to fully live up to that principle. Abortion is not health care, and women and children deserve better. There is simply no compromising on including the Hyde language because it saves lives, plain and simple. Since this language was first included in 1976, over 2.4 million lives have been saved. The right to life is guaranteed by the Constitution and vested in each human being. We must uphold that right in this committee by including this language and protecting innocent lives. As you all know, I served as chair of this committee for 6 years, all of which took place during the Obama administration. In 4 of those years, we had a Democrat-led Senate, but never did we strike Hyde. Never. I strongly urge the adoption of this amendment, and I yield back the balance of my time.
Ms. Frankel.
Thank you, Madam Chair. I also rise in opposition to this amendment that would deny federal Medicaid coverage of abortion, and I applaud and thank all my colleagues for introducing this appropriations bill without an abortion ban. Here we go again. Colleagues, do you know anything about the woman who wears this shoe? Do you know her age? Do you know whether she has children, 1 child or 5 children, whether she suffers from COVID or breast cancer or deep depression? Does she have family close by? Does her partner beat her in the morning? Do you know that she's working hard every day of the week, just scraping by to pay the bills? Here's the thing. We do not always know a woman's circumstances because we are not in her shoes. When Medicaid covers pregnancy care but withholds coverage for abortion, we are taking away a woman's ability to make important personal decisions based on what's best for her circumstances. No matter how we feel about abortion, politicians shouldn't deny someone's health coverage for it just because they are struggling financially. Each of us should be able to work and live and make decisions about our health and our future with dignity and respect. And when a woman can make a decision about our own reproductive health care, including whether and when to have children, they have more control over their economic security. Here are some facts. Studies show that when policymakers place restrictions on Medicaid coverage of abortion, it forces 1 in 4 poor women seeking abortion to carry an unwanted pregnancy to term. A woman who wants to get an abortion but is denied is more likely to fall into poverty than a woman who can get an abortion. And restrictions on abortion coverage fall hardest on those who are struggling financially, who are more likely to be women of color, immigrants, and young people. Which brings me to the ultimate injustice of the current law that denies federal Medicare coverage of abortion, the law which our bill correctly eliminates. The majority of minimum wage workers in our country are women who are working to support their families, and they are disproportionately women of color. There are hotel housekeepers, child care workers, personal care assistants, restaurant servers. Although many of us would like to consider these folks to be important backbones of our economy, these hardworking women often, they don't get health insurance coverage from their employer, and they cannot afford private health insurance, so they rely on Medicaid. So to have a health care system in our country that restricts access to abortion for women striving to make ends meet is unfair and unjust. My Republican colleagues also claim that this amendment would prohibit discrimination against health care providers who refuse to offer abortion services. Really? In actuality, it emboldens insurance companies, providers, and hospitals to use their personal or religious beliefs to determine a patient's health care, leaving patients without care, coverage, or information they need, and that includes abortion and other reproductive services. And this amendment is especially dangerous because it threatens federal funding for all health services for low-income Americans, not only those needing reproductive care. As our chairlady mentioned, it threatens states with the potential loss of all federal health funding if they try to protect patients. And believe it or not, the Trump administration actually attempted to use this type of refusal law to take away $200 million in Medicaid funding per quarter from California in the middle of a pandemic because the state ensures coverage for essential reproductive health care. Fortunately, the Biden administration reversed that decision. And I've said it before, and I'll say it again, as many times as I need to, Abortion is health care, and a patient's access to health care should never be based on the belief of others. And to say some of us agreed in this amendment and passed appropriation bills is bogus. There is not, nor was there ever anything bipartisan about denying access to abortion. There are many policies that continue because of the combination of procedures and deal-making, and that doesn't make the policies right. And about your polls, nationally, Americans favor access to abortion and Medicaid coverage of abortion services. But look, this is not about polls, because a woman doesn't take a poll to determine whether or not she's going to become a mother, nor does she call her state senator or her congressperson. It's not our place to decide for someone else whether she should get an abortion. It's better that decision be made with her family according to her faith, because the decision to become a parent is one of the most important life decisions that we can make. And when people make decisions that are best for their lives, however much they earn, families thrive and we build healthier communities where each of us can participate with dignity. And I say to my colleagues, this shoe doesn't fit. I don't know what I did with the shoe. I think someone took it from me. But the shoe I held up does not fit you, so don't try to wear it. Defeat this bad amendment, and I yield back.
Ms. Herrera Butler.
Thank you, Madam Chair. I am disappointed that the long-standing bipartisan provisions were stripped from this year's bill, which is why I support this amendment. The Hyde Amendment has saved almost 2.5 million lives since its enactment, and that's non-negotiable. Prior to Hyde's enactment in 1976, Medicaid was paying for close to 300,000 abortions annually. Now estimates show that 1 out of every 9 people born to a mother on Medicaid are alive today because of Hyde. Women and their children deserve better health care options than abortion. It's very clear that Margaret Sanger, who is the founder of Planned Parenthood, is tied to eugenics and abortion. And that's what I find interesting in light of Chairwoman DeLauro's arguments about, and Representative Lee's arguments about race. Margaret Sanger said, "We do not want word to get out that we want to exterminate the Negro population." And she goes on. And I'm going to read to you from an abstract on the ncbi.nih.gov. It's an article on here. And I quote, "Black women have been experiencing induced abortions at a rate nearly 4 times that of white women for at least 3 decades, and likely much longer. The impact in years of potential life loss, giving abortions high incidence in racially skewed distribution, indicates that the most demographically consequential occurrence for this is the most demographically consequential occurrence for the minority population. The science community has refused to engage on the subject, and the popular media has essentially ignored it. In the current unfolding environment, there may be no better metric for the value of Black lives," end quote. The article goes on, but I believe it is really important that we recognize that you talk about it, Madam Chair, in terms of being a benefit to women of color, women of minority status like myself. I look at it as a systematic targeting of minority women's babies. We are missing, almost after 3 decades, a significant population of young people. And we can't ignore the facts. The reality is Americans, no one's talking about taking away a woman's right to an abortion. We're talking about refusing to make taxpayers pay for it. And it's important to look at the numbers. They don't want to pay for abortion. In 2021, a Marist poll found that nearly 58% of Americans oppose taxpayer funding of abortion, with 31% of those being Democrats and 65% being independents. This is not a partisan issue. It's an issue of conscience. I urge my colleagues to support this amendment and stop the partisan politics. We must protect life. I yield back.
Ms. Watson-Coleman.
Thank you, Madam Chair, for recognizing me as I arise in strong opposition to this amendment. Once again, my Republican colleagues are attempting to impose their personal benefits onto others, indicating how little they think of women and the ability to make the best choices for their bodies. In addition, how little they know about or even give attention to the plight of Black women and the Black community. The Hyde and Weldon amendments will not reduce the number of women seeking abortions, and it will only force women to make dangerous and risky decisions. Any restrictions or limitations on reproductive health is both a risk to a woman's health and safety, as well as an infringement on their rights. The Hyde Amendment will decrease funding for sex education programs, stigmatizing and decreasing knowledge of the reproductive process and putting women, particularly young girls, at greater risk of unwanted or adolescent pregnancies. The Weldon Amendment invites the beliefs of third parties to take precedent over the care of a patient, putting the health and well-being of a person at risk if the best healthcare options do not perfectly align with the benefits of others. Moreover, restrictions to reproductive health care disproportionately harm those who are already facing barriers to health care, underserved and overburdened communities, including low-income individuals, young individuals, people of color, immigrants, and indigenous people. No person or government should decide what women can do with their own bodies. That decision, be it to have an abortion or decide against it, should remain a private matter which lies solely between a woman and her doctor. By forcing the government's presence into these discussions, we reduce a woman's autonomy and we restrict her resources and options to only discourage to dangerous and unsafe choices. We also support the continuous discrimination and a systemic discrimination against women of color and poor women. I urge all of my colleagues to vote no, and I yield back on this very dangerous amendment.
Mr. Rutherford.
Thank you, Madam Chair. I rise today in strong support of this life-saving amendment, which would reinstate the pro-life policies this committee has long supported and which a majority of Americans still support. Madam Chair, for years the Appropriations Committee has kept this non-controversial pro-life provisions intact without poison pills that would knowingly delay funding for the federal government. Unfortunately, those long-standing bipartisan provisions have been stripped from this bill, and we have the bill that we have before us today. And those stripped provisions include the Hyde Amendment, which bars the use of federal taxpayer funds to subsidize abortion except in cases of rape, incest, or to save the life of the mother. And the Weldon Amendment, which safeguards the conscious protections of medical professionals who may have a religious or moral objection to performing abortions. For years, these amendments have saved countless lives from abortion killings while ensuring taxpayer funds aren't used to cover the cost of those killings. And they are killings, Madam Chair. The only difference in the act, whether it's in the womb or it's at First and Main Street, the only difference there is geography. The act is the same. The life of an unborn baby is sacred and precious. And regardless of your political affiliation, it is unconscionable to strip these protections. As a law enforcement officer, I've dedicated my entire life to fighting for those who are unable to fight for themselves. I continue to do so in my role in Congress. And my Republican colleagues and I are not the only ones who feel this way, Madam Chair. In fact, a 2021 Marist poll that was referred to earlier found that 3 out of 4 Americans, even those who identify as pro-choice, want significant restrictions on abortions. And folks, this is not complicated. Abortion is not, as was suggested earlier, abortion is not health care. Health care is a means by which we save lives. Abortion kills a life. It's not health care. Even if you support the right to an abortion, this amendment would not ban all abortions, and that is an entirely separate issue. Instead, it would simply maintain those common sense guardrails on abortion services, number one, to protect taxpayer funding, and number two, to protect the conscience rights of healthcare providers. I'm proud to support this amendment and urge all my colleagues, no matter your position on abortion, to look at the big picture here. The American people do not want this, and our medical community does not want this, and it's time that we listen to them, to respect their wishes, and pass this amendment. I strongly urge passage of this amendment, Madam Chair, and I yield back.
Ms. Clark.
Thank you, Madam Chair. I rise in opposition to the Cole Amendment and also in gratitude that for the first time in over 40 years, this committee has introduced a spending bill without the Hyde Amendment. For decades, that amendment has prevented women, low-income women, women of color, from receiving critical care. In this country, 20% of women are enrolled in Medicaid, including half of all American women living below the federal poverty line. That means nearly 40 million women who are disproportionately from communities of color make up most of the adult Medicaid population. This egregious amendment to reinstate Hyde would undermine the health and well-being of that vulnerable population, who has already borne the brunt of this pandemic. We know that nearly half of all pregnancies are unintended, with rates highest among women with limited access to full reproductive health care. Hyde forces 1 in 4 women under Medicaid to carry an unwanted pregnancy to term. Women who have been denied an abortion are more likely to live in poverty than those with access and power to make their own medical decisions. This is clear discrimination. The legal right to an abortion is not enough if you are unable to afford one. Abortion is healthcare, and access to it should not be based on your income or insurance coverage. Every individual should have the right to control their body with autonomy and dignity. By blocking comprehensive family planning services, including abortion, politicians hold women and families back from reaching their full potential. That's why eliminating the Hyde Amendment is not just a matter of reproductive freedom, it's a fight for racial and economic justice. It is not our place to be arbiters of someone else's medical and financial choices as they work to make ends meet and support their families. The Cole Amendment before us today is a regressive and dangerous policy that has no place in this bill. I urge my colleagues to oppose this amendment and deliver justice to the women who are the backbone of our families and economy. I yield back.
Mr. Molinar.
Thank you, Madam Chair. I rise in support of the amendment offered by Ranking Member Cole and appreciate his leadership very much. For over 40 years, language has been included in the Labor, Health, and Human Services Appropriations Bill that prohibits the use of federal taxpayer funding for abortion. This language has been passed by multiple Congresses and signed into law by numerous presidents, both Republican and Democrat. A federal prohibition on using tax dollars to pay for abortion is one of the strongest bipartisan policies our country has. In the decades since it first became law, the Hyde Amendment has played an integral role in protecting the lives of unborn children. Since then, science has proven when unborn babies develop organs and feel pain. And with each new scientific discovery, we find more evidence confirming unborn babies are human beings who deserve to be protected. I believe history will look unfavorably on abortion, and future generations will be appalled that America did not do more to defend and preserve the lives of unborn children. On this committee, we've worked together for many years to pass bipartisan funding for federally qualified health care centers and early childhood education to help mothers, children, and young families. Now, committee Democrats are on the verge of allowing the use of tax dollars to end children's lives before they can even have a chance to benefit from those resources. Members of the Democratic Party, including the President and the Speaker, have previously all voted for Hyde Amendment protections for taxpayers. Now they want to take the tax dollars of hardworking Americans and allow them to be used for abortion. This far-left policy is wildly out of step with the hardworking Americans I represent. Rather than allowing taxpayer money to be used for abortion, this committee should do no harm and should instead promote the sanctity of life, encourage adoption, and continue supporting organizations that help parents and children. Taxpayer money should never be spent on abortion. Science has shown us that unborn children are human beings in the womb who feel pain and develop organs. We should protect and defend their right to life. I urge my colleagues to honor the precedent set in previous appropriations bills by keeping the Hyde Amendment and similar life-saving provisions in the fiscal year 2022 bill and for years to come. Thank you, Madam Chair, and I yield back.
Ms. Underwood.
Thank you, Madam Chair. I strongly oppose this amendment, and I urge my colleagues to do the same. My background as a registered nurse has grounded me in the importance of data-driven, evidence-based policymaking. And the evidence on the Hyde and Weldon amendments is clear. By banning federal coverage of abortion care in most circumstances, a disproportionate number of low-income parents have been denied access to a fundamental form of health care, resulting in a higher likelihood of falling into poverty, worsened developmental outcomes for the mother's existing children, and increased risk for domestic violence against both the mother and child. I know that proponents of preserving these funding restrictions have argued that their durability warrants their inclusion in this year's bill. But as this pandemic has underscored, the old way of doing things wasn't always working, particularly for the most vulnerable, particularly for women of color. We cannot afford to go back to what was broken. We must follow the science that overwhelmingly tells us that Hyde and Weldon are dangerous and discriminatory. Removing them from this bill is a historic step forward, moving us towards the more equitable healthcare system that we must create as we emerge from this pandemic. To create a more just future for all women, and women of color in particular, I urge my colleagues to join me in opposing this amendment and ending Hyde and Weldon once and for all. Thank you, Madam Chair, and I yield back.
Mr. Fortenberry.
Thank you so much, Madam Chair. I was privileged to serve briefly with the late Henry Hyde. He was a man of great gentility and kindness, and when I was a new member, I had a dilemma about a bill that was on the House floor. There were many good things in the bill. There were some bad things, and I sought out Henry Hyde's counsel. At that point, he was very elderly. He was in a wheelchair in the corner. And I told him, I said, Mr. Hyde, I'm in a real serious dilemma about this bill, and I'm thinking about voting present. And he looked at me and he said, well, Jeff, you can do that, but I haven't done that in 40 years. In other words, it was his way of saying, Fortenberry, make up your mind. And so through his leadership and clarity of mind, it's interesting to note, I believe, that Congressman Henry Hyde laid down the choice for this bipartisan marker on a question which so wounds and divides us. This amendment, named in his honor to prevent taxpayer money for abortion, has remained a bipartisan compact before now. Little in Washington has been this stable or stabilizing and widely accepted by Americans. Now, Madam Chair, we're living in an age of contradiction. We say we want inclusivity, we say we want tolerance, we say we want to live in authentic community and uphold the dignity of all persons, yet we leave some of our community out of these considerations, namely an expectant mother and her preborn child. Now, it's been said over and over again, but it's worth saying it again. An overwhelming majority of Americans, 60%, oppose using taxpayer dollars to fund abortion. And this is not some static statistic. It carries deep resonance. Where I live in Nebraska, citizens plead with me to not let our government fund a practice that cuts against their fundamental values, their conscience, their deeply held reasoned beliefs. Yet here we are again about to force Americans against their will to pay for something that they do not want. So here's another idea. Let's have an opposite discussion. When there is news of an unexpected pregnancy, and there is that vulnerable moment of uncertainty, suppose that we, as a community of care, could be committed to the journey of life, to help a mother and her child before birth, at birth, and after birth. That's called solidarity. That's called commitment. That's called love. I yield back.
Thank you, Madam Chair. I rise in opposition to the Cole Amendment. For decades, the restriction of Medicaid coverage on abortion has endangered the health and well-being of millions of Americans, especially low-income women and women of color. As someone who was raised Catholic, I believe that we must extend grace to all people whose shoes we have not walked in and allow them to make their own health care decisions with the dignity that all people deserve. The decision to become a parent is an incredibly personal decision, and denying someone critical health care due to their financial status puts up yet another barrier to care on top of the many systemic obstacles that already exist. It is not my or any politician's place to deny someone the health care they need to make the best decision for them and their family. And when we acknowledge someone's right to make that decision in accordance with their own circumstances and faith, we create communities in which all people, no matter their income, can prosper and live with dignity and respect. And with that, I oppose this amendment and urge all of my colleagues to vote no. Thank you, and I yield back.
Thank you very much, Madam Chair. I appreciate the opportunity to speak on this important issue. You know, for 45 years, even amidst some of the most contentious times in our nation's history, Congress has always been able to come to a consensus that the Hyde Amendment is sound and moral policy. You know, it's hardly news that my friends and colleagues on the other side of the aisle have given in to the pro-abortion agenda over the past several years. But it is particularly concerning that they now reject the common sense principle behind the Hyde Amendment, that pro-life American taxpayers should not be forced to fund programs which violate their deeply held moral and spiritual convictions. That's why I and so many of my constituents are so deeply troubled by this latest assault on a policy that, as you've heard several times today already, is supported by a solid majority of Americans. You know, Madam Chair, cloaking this conversation in the language of freedom of choice does not make it so. The people of my district and the American people in general oppose abortion. So to forcibly take their hard-earned tax dollars and then use those dollars to fund the termination of human life it's not only deeply offensive, but it is also the very antithesis of the freedom of choice that is promised to citizens of a democratic republic. This should be incredibly simple, and I urge all my colleagues to join us in renewing our historic bipartisan commitment to the Hyde Amendment and the conscious protections that it affords. Thank you, Madam Chair.
Thank you, Madam Chair. I also rise in opposition to this amendment. Something my colleagues on the other side of the aisle continually fail to grasp is that it is a woman's right, and hers alone, to choose what is best for her future and her family. Fear-mongering about those decisions is frankly irresponsible and gross. It is unconscionable to force someone to carry an unwanted pregnancy, yet that's what the Hyde Amendment does for too many people working to make ends meet. I am relieved that the Hyde Amendment is absent from this bill, although it took us 40 years to get here.
Since 1976, this language has been inserted as a rider into the spending bill, placing a decades-old ban on women's reproductive rights that disproportionately impacts low-income women who rely on Medicaid, and as well as women of color. Lifting the Hyde Amendment is long overdue and will ensure that everyone, no matter their socioeconomic background, can make their own decisions about their future and health with dignity. During a pandemic, the stakes are even higher. The same people who are most hurt by abortion coverage bans are also bearing the brunt of this pandemic and systemic racism every day. As a mother of three, I can tell you that the decision to become a parent is one of the most important life choices we make. It has never been appropriate for the Congress to be a part of that process. I also stand in opposition to this amendment's attempt to reinsert the Weldon Amendment in the bill, another misguided tactic that interferes with abortion coverage and care. Pregnant patients seeking health care services such as counseling, medical information, and abortion should never be denied this critical care because of others' beliefs. Refusal of care laws allow health care providers to put their beliefs ahead of patient care. We must eliminate this harmful rider if we want to truly protect full health care access. Patients' access to care should never be determined by the personal and religious beliefs of others. Let's put an end to the appropriations process being used to attack access to abortion and other reproductive health care. I vigorously oppose this amendment and yield back the balance of my time.
Thank you very much, Madam Chair, and I would like to speak in support of the gentleman from Oklahoma's amendment. First, I'll deal with the Hyde Amendment. The Hyde Amendment is really about whether or not we're going to spend taxpayer dollars for something that's simply objectionable to many taxpayers. That's simple as it is. But interestingly enough, you know, we've heard a lot about abortion being health care. Now, I've delivered health care. I've been an chief obstetric anesthesiology at Johns Hopkins. I was an obstetric anesthesiologist for 27 years before coming to Hopkins, taking care of mothers and their babies in an inner city hospital where 80% of my patients were minorities. I think I know something about healthcare, delivering healthcare to women. I was taught that there are two patients. When a woman is pregnant, there are two patients. There's the woman, and there is her baby. And they're separate. I remember reading in my embryology text when I was a medical student that from the moment of conception, there is a human being present. That baby is a human being. Now, maybe abortion is health care for the woman. We could argue that. It's certainly not health care for the baby. It has nearly 100% mortality rate, and the reason I say merely because some abortions are botched, and the babies are born alive. And we discussed that in other bills and other legislation, what to do with that baby. But it certainly is not health care for the baby. And when we talk about the most vulnerable human being on this planet are those babies who are in their mother's wombs. Because in many countries in the world, they can be subject to an abortion without their permission. We hear about, well, it's their own body. We shouldn't interfere with a woman because it's their own body. Well, maybe we should refer to science. What does science say about whether that baby is another body? It certainly is a separate body. It certainly is a separate life. It's immunologically protected from the mother because the mother would reject the baby if it weren't, because it is a separate being, a separate human being. I once ran into a pediatrician in my district who said, you know, I disagree with you, Dr. Harris. You should support abortion, especially for poor women, because those babies are more likely to be abused. Wow. I guess the baby doesn't get a say in that, does she? Finally, we've heard it's discriminatory, the Hyde Amendment. Well, let me tell you, ladies and gentlemen, you all know that in 1980, Harris versus McRae, the Supreme Court decided it was not discriminatory. That's 7 years after Roe v. Wade. The Supreme Court actually decided it's not discriminatory. I'm going to end by talking about the Weldon Amendment, because for me, that's very personal. Madam Chair, you said a patient's well-being should always come first. I'll just reiterate. There are two patients involved. It's the mother and the baby. And if I, because of my religious belief, not a preference, as the gentlelady from California suggested, my religious belief that that second human being deserves protection, and I cannot participate in taking that second human being's life, my religious belief should be respected, because my religious belief is not in the penumbra of the Constitution, as Roe v. Wade referred. It is actually in the First Amendment. Madam Chair, you mentioned insurance companies, you mentioned institutions, and you're right, Weldon applies to them. But my gravest concern is individuals, because we know about Kathy DiCarlo in New York, Mount Sinai Hospital, forced to participate in a second trimester abortion where she had to count the body parts, even though she had told her supervisor she has a religious objection to participation. She was forced to participate, and subsequently, because she had to file a lawsuit, Mount Sinai changed their regulations. It's not about a provider's preference, it's about a provider's religious belief. As Americans, we should respect every individual's belief. That's what Weldon does. Madam Chair, I strongly urge adoption of the gentleman from Oklahoma's amendment, and I yield back.
Ms. Torres.
Thank you, Madam Chair. I rise in strong opposition to these amendments that target women and are harmful to women. It seems that each and every markup bill, we have to re-litigate a woman's right and capability to make health decisions for herself. Women deserve to have access to critical, affordable, and quality care. And yes, that includes abortion care. Women deserve to make their own medical decisions, and each and every woman makes her medical choices based on her own and profoundly personal reasons. Politicians have no place in that decision. Living in dignity and security means being able to make your own decision about your own body. No one should be denied coverage for an abortion because they can't afford it. The Hyde Amendment and anti-abortion policies do not stop abortion. They make them dangerous and less accessible to marginalized communities. The Weldon Amendment emboldens health entities to further restrict abortion. The last 4 years showed us how harmful it can be. The Trump administration used the Weldon Amendment to attack states that try to protect citizens' access to health care, adding insult to injury. On its way out the door, the Trump administration attempted to use the Weldon Amendment to take away health care funding from California in the middle of a global pandemic because my state supports women. My state believes that women are smart enough and strong enough to make their own decisions about their own bodies. My state believes that women have a right to be independent human beings and are not an object. They are not an object that belongs to a politician to make a decision for them. When you believe that, whether you believe it or not, it's neither here or there, but when you say nothing, when a president refers to women and calls them out the way the former administration did. When he has said, grab them by the P word and disrespected women, didn't stand up and said that was morally wrong. Rape was morally wrong. Denying women justice was morally wrong. If you want to save lives, I encourage you to get vaccinated, to wear a mask, to tell your constituents, to help them save their lives and understand that the coronavirus vaccine is okay and that you should be vaccinated. If you want to save lives, then you should vote to support food assistance programs for poor women trying to raise their kids while working 2 or 3 jobs. Today, we are celebrating Child Care Tax Child Care Day. But you voted against that. So don't come here and say that you care about life, because you don't. You care only about having power over women who have the power to make their own decisions. It is 2020. It is time to believe women. It is time to support women. And it is time to stand with them, to allow them to make their own decisions. And with that, I urge my colleagues to trust women and vote against this amendment.
Mr. Adderholt.
Thank you, Madam Chair, and I just want to also voice my support for this amendment from the ranking member. And I know a lot has been discussed today, and I think it's one of those issues where there's everyone has already said what is to be said, just everyone hasn't said it. But I also want to, I think it's important, as has been said, that this is not, we just look at what politicians say. And I appreciate Dr. Harris's comment earlier, and from a physician's perspective. So Dr. Harris, thank you for your comments, and from a standpoint of, from a medical expert who knows about this. And without the long-standing Hyde Amendment, this bill is going to be too extreme to even pass the Senate. The very fact that we have this debate here this morning, maybe this afternoon, it makes it unmistakably clear that there is a faction of the party, of the majority party, that has taken power, and the president has, away from the president, who has claimed he's going to unify this country. We've come a long way from the days of Bill Clinton's proclaiming safe, legal, and rare to debating actual taxpayer funding of abortion on demand. And I think it should be noted that President Biden himself supported the Hyde Amendment. He bragged in letters to constituents of his support over 50 times, agreeing that those who do not support abortion should not be forced to pay for it. And this is the issue that we're talking about this afternoon. It's not the right to abortion, but today, as President Joe Biden, he has abandoned those concerns and the millions of Americans who don't want their taxpayers to go to paying for abortions. Most of the American people support Hyde. This committee should support the ranking member's amendment, should continue to respect the millions of Americans who represent, not forcing them to pay for aborting human lives. And with that, I urge support for this amendment, and I yield back.
Ms. Lawrence.
Thank you, Madam Chair. I just want you to know I looked high and low, and I tried to find an amendment at the desk that would restrict the reproduction health care for men. I looked high and low for a bill that will restrict a man from making a decision about whether he would be able to give the needed contribution to make life. So this is not about being pro-life. This is about being pro-choice. If we pass this amendment, women around the world will make the decision. It is not forcing any woman, and the conversation is leaning toward the Hyde Amendment is lining women up and forcing them to have abortion. It is allowing women to make the decision about their lives. Men give a contribution to birth and they go on with their lives. Women, when they have the decision to make about pregnancy, it's life-changing. Men walk away all the time. We've had this decision to make from the beginning. Men so often walk around with the arrogance. It's my body. If I choose not to have children, I'll get a snip, snip, and I won't have any. But women do not have that choice. At least you're trying to take that away from them. We have opportunities to support children in their lives. With the child tax credits, like my colleague just said, what was your vote? We have the opportunity, if we really do care, Black Lives Matter, did you support the George Floyd Justice and Policing Act? Don't be a hypocrite and just find one little narrow lane and stay there. If your belief is Black Lives Matter, if your belief is that when children are born, we should take care of them, are you supporting SNAP and the food nutrition acts that we bring forth all the time? Because once a child is born, it's not over. It's a human being, like we said, it's a separate individual. And so often my heart is broken that we have so many of my colleagues walking away from these children. You said if a woman is incapable of caring for that child, force her to have it. And then you look at that child once it's born and you walk away. This is about choice. This is about educating women, and I agree with my Republican colleagues, this should be an ongoing discussion on how we treat human beings in America. I want you to know that once again, we are confronted with who we are as a country when it comes to women. And I am often amazed of how freely the discussion can be about what a woman should do, and have yet to see a man stand up and say we should control and regulate what a man does with his body. This is something, to me, America needs to step up, because you have history, America, of discriminating, restricting women, and oppressing women in this country. And this is just the last trail that we're walking in America. I stand in opposition, and I yield back.
Judge Carter.
Thank you, Madam Chairman. I rise in recognition and support of this amendment. You know, the Hyde Amendment has saved lives of over 2 million innocent babies, and it continues to do so. You know, this was passed back in '76. That was the Democratic Congress. It was a bipartisan effort. Strong work by Mr. Hyde, who was quite capable in his arguments. And it has remained in every bill that's been passed since that time. History does matter, no matter whether you're trying to erase it or not. The real facts are, if the government pays for it, then the government makes decisions about it. And ultimately, in the largest socialist nation in the world, China, it means no female babies. You gotta mandatorily abort them because the government says so. So the real world is keeping the government out of this is the proper thing to do. It's the right thing to do looking at the history of what's gone on in this discussion. We're not arguing against abortion here today. We're arguing against government-funded abortion. And the Hyde Amendment has been approved by every Congress since 1976 up until today. And it is wrong for us to take out the Hyde Amendment. It's a great compromise that has been effective and has been effective in saving the life of a cherished unborn child in so many instances. I think if Hyde is not in this bill, I think the American people are going to be very unhappy, and I think this bill will not pass, and it risks our whole appropriations process. And just the desire to dispose of the innocent is not a good reason to dispose of our good work. Madam Chairman, I urge a yes vote on this bill because it's what the American people overwhelmingly support. The Hyde and the Weldon language be included in this bill. And I yield back.
Ms. Capter.
Thank you, Madam Chair. I hope I can be heard. I'm sorry I had to help dedicate a courthouse that we've worked on for 20 years out here in Ohio, and I couldn't be present personally. But this is a terribly important issue for all Americans, and I've been listening to the passionate and deeply held views of all of the members. I oppose the amendment and wish to state that, first of all, this issue is so important, it doesn't belong in the Appropriations Committee. In fact, this is an authorizing issue, and it belongs in the health authorizing committees of the House and the Senate. After 40 years, I think we should take a relook at this issue, and we know several things. First of all, the current Hyde Amendment is blatantly discriminatory. We know that it harms low-income women, particularly those of color, deeply. And we know that those patients generally do not have health insurance coverage for full reproductive rights. So we're hurting the least among us. It isn't our job as appropriators to determine exactly how to deal with this critical health issue for women, but it doesn't belong in the Appropriations Committee. We need an authorizing committee to step up and to meet the responsibilities that they have foregone for 40 years, whether there was a Republican majority or a Democratic majority in place. So let me just offer the view. I think many people have obviously spoken very eloquently on this issue, but I think it's high time that we move this issue, which is authorizing on an appropriations bill, out of this committee into the health committees of the Congress, and also debate fully how to assist women who face these really difficult circumstances, particularly the 2/3 who are young women who are often alone and without care. So the current Hyde Amendment is completely discriminatory toward them, and I believe that every person in this country, particularly young women, deserve full health coverage. And I oppose the gentleman's amendment and yield back.
Mr. Womack.
Thank you, Madam Chair. Not lost on me is the fact that the previous speaker talked about how she's not here today because she's dedicating a courthouse. And I thought that our provisions for proxy voting were based on concerns about the coronavirus. I think we need to reevaluate the conditions under which we're allowing people to miss their congressional duty by opting out of these in-person appearances. But that's not why I rise right now. I rise in support of the amendment from the gentleman from Oklahoma. And it's a good thing that for the last 45 years, in a bipartisan, bicameral way, we have been able to pass appropriations bills with this language. And let's remember what our duty is here today. Our duty is to fund the government, and hopefully in a timely way, although we're probably going to be a little short on that expectation. That's a whole nother story. But we're not going to fund the government, at least in this bill, without this language. It is clear to me that absent the Hyde and Weldon amendments, this bill will never become law. And I know I represent a lot of people in the 3rd District of Arkansas that do not believe that taxpayers should be forced to foot the bill for abortions. And that's why I'm in the strongest opposition to the absence of this language. This bill is supposed to include funding for programs that protect and support the health and well-being of all Americans. And as it has been said before, this is not health care for the unborn. Excluding the Hyde Amendment is a non-starter. Madam Chair, I don't think that negotiations should continue until we add this straightforward, long-standing provision that safeguards taxpayers from funding abortion and upholding the sanctity of life by protecting the unborn. We have a job to do. This is going to be in the way of us getting our job accomplished. The bill will not become law without the language. So I think it's time that we recognize that, take the appropriate steps, approve this amendment, and I yield back the balance of my time.
Ms. McCollum.
Thank you, Madam Chair. It's with a heavy heart that I'm going to speak on this. We often talk about abortion, and we put it in a black and white picture. This is going to happen, this isn't going to happen. But quite often when women are making these decisions, they're making them sometimes after they're celebrating a pregnancy, and their health becomes involved. The definition of pregnancy and when it should be terminated has been described very differently by my colleagues who are supporting the Cole Amendment. Some of you would agree with me about the health of the mother. If a doctor was to say to her, you know, I really think you're putting your health at risk, maybe it's emotional health, sometimes it's physical health. I've spoken with these women. I know these women personally who have celebrated the pregnancy only to be given possible tragic news. You could be putting your health on the line. We don't think that things are going well with the pregnancy, and this is in the first 3 months. And then you get into the gray area. Who gets to make that decision? Well, I think it should be the mother, the family, the doctor. And I know those women quite often have consulted their religious and spiritual guidance. And it's a difficult decision sometimes. And that's why I'm going to vote against the Hyde Amendment that's being offered by Mr. Cole, who I respect. I respect all of you who have your opinion when life starts. I truly do. I grew up with a Lutheran mother and a Catholic father. I was there early on for the early birth control discussions, whether or not birth control was proper. And I decided a long time ago when I first ran for public office that I was not going to judge another person's religion, and that I was not going to second guess another person's medical decision. I think everybody is where they are on this. But we too often talk about this like it's a black and white decision. This is a tragic decision that many women and their families make. They don't go into it easily. And I'll close with this. I have spoken to many mothers, many families, many women. I know them well. I know them personally, who had started picking out names, preparing for a new life to enter into their family with excitement, only to be given tragic news. And why should a woman who doesn't have access to private insurance, who has to rely on all of us collectively to support her, be denied, be criticized, feel humiliated, and feel that she has to ask permission to take care of herself and her family after consulting with her doctor and her spiritual guidance. With that, I yield back.
Mr. Fleischman.
Thank you, Madam Chair. Going rather close to the end of this discussion, in some ways has been frustrating because an awful lot has been said on both sides of this issue and both sides of this dais. So I will try to impart my views on this very difficult and emotional subject. I knew Henry Hyde. As part of my travels around the country, I went to the University of Illinois and lived in the Chicago suburbs back in the late 70s and early 80s, and I knew Henry. We campaigned together. He was my congressman for a while, and then we were down in central Illinois, and just a very genuine person, a heartfelt man, and very strong in his pro-life convictions. I won't make any bones about it. I am avowedly pro-life. I am a Roman Catholic, confirmed and still married to a Southern Baptist evangelical for 35 years. But in viewing this issue, I understand the strong, heartfelt issues and thoughts on both sides. So I'm not here today to be critical of any of my colleagues on the other side of the aisle, but I rise in strong support of Mr. Cole's amendment. I associate my remarks with Dr. Harris, who I think really touched on the crux of this issue. I will say this. A few weeks ago, we celebrated a document, the Declaration of Independence, that in 1776 really stood up then and really stands out now as a testament to inalienable rights. Those are rights that don't come from men, they don't come from governments. In my view, and in our founding fathers' view, basically came from God and do come from God, and they're inalienable. And in my ethos, in my worldview, and in my theology, I strongly believe that those rights are conferred at conception. Now, that is my worldview. Basically, in this situation today, we've seen a lot of arguments made on both sides. I'm going to say this. As a practical point, this is not a game changer, it's a game ender. I mean, this appropriation bill will not go forward. A single Republican will not vote for it. It will die in the Senate, and it will impede and stop the entire appropriation bill, some parts of which I could certainly support. But with this in there, I cannot, and neither can my colleagues. So with that, I'm going to urge strong support of the Cole Amendment. But I do want to say this. To those who talk about the issues, I was not going to talk about the fundamental crux about the Roe versus Wade issue today because we have the single issue of whether or not federal dollars should be used to pay for abortions. I think strongly no. But I do want to assure my colleagues that the pro-life position is so strong, and it is something that regardless of race, regardless of gender, and it is something that I think really upholds the sanctity of life and of women in this process. So with that, I will yield back and strong support of the gentleman's amendment. Thank you.
Ms. Meng.
Madam Chair, I rise in strong opposition to this amendment. This is about women's health, dignity, and the right to make their own decisions about their own bodies. Due to the structural inequalities in our country that link racism, sexism, and economic inequality, people of color disproportionately comprise the majority of Medicaid enrollees. When anti-abortion politicians use the Hyde Amendment to deny abortion care coverage, the harm falls hardest on people who are already marginalized by our healthcare system, including women of color, young people, transgender, and non-binary people. When insurance coverage provides for all pregnancy-related healthcare except abortion, It interferes with the private health decisions that are best left to a patient, their doctor, and their families. The Hyde Amendment is a dangerous and unfair policy that lets politicians interfere in people's personal health care decisions for themselves. Madam Chair, the key word here is personal. This is an individual's right to make the best decision for themselves and their families. I strongly oppose this amendment and I yield back.
Mr. Garcia.
Thank you, Madam Chair. I want to speak in support of the gentleman from Oklahoma's amendment to preserve the Hyde Amendment. At the beginning of your opening remarks, Madam Chair, you mentioned that this is a source of great concern for those of us on this side of the aisle, but I want to remind folks that this is a source of great concern for members of Congress from both sides of the aisle, and in fact, most Americans. As representatives of the people, we have an obligation to deliberate and debate and vote on the bills in front of us. Today, we're not discussing or voting on Roe v. Wade. We're talking about the Hyde Amendment within this bill, and an amendment that, frankly, has been a bipartisan vote for about 45 years. We're not talking about Roe v. Wade. I find the comments from the folks on the left side of the aisle here today to be, frankly, disingenuous. This is not health care. Health care does not result in the termination of a perfectly viable life with the intent to kill that life from the outset. The words from the left are disingenuous because this bill, this amendment does not deny coverage. It does not deny the abortion. It just says that the taxpayers should not be paying for the abortions. To suggest otherwise is disingenuous. It's also disingenuous to call this discriminatory. The Supreme Court, some 7 years after Roe v. Wade, determined that the Hyde Amendment is actually, in fact, not discriminatory. And frankly, I find it offensive, and in my opinion, it's discriminatory to say that the fathers don't stick around, that the only role that the fathers play is insemination, and then they leave after that. That in and of itself is a prejudiced statement.
Yeah.
I want to read a quote. In 1994, in a letter to his constituent, then Senator Joe Biden wrote, "I will continue to abide by the same principle that has guided me throughout my 21 years in the Senate. Those of us who are opposed to abortion should not be compelled to pay for them." He said, "As you may know, I have consistently and on no fewer than 50 occasions voted against federal funding of abortions. This is a bipartisan issue. I agree with a colleague from across the aisle from California when she said we need to respect women's opinions, and the simple fact is, in a poll taken just a few months ago, 59% of women in our country do not support federal taxpayers paying for abortions. That is the issue in front of us, the issue that we debate, and the issue that we will be voting on. And I want to thank Ranking Member Cole for offering this amendment to restore the Hyde Amendment, and hope my colleagues across the aisle will join us in restoring this critically important and historically bipartisan measure. I yield back.
Mr. Palazzo.
Well, thank you, Madam Chair. I rise in strong support of the Cole Amendment, and I echo my Republican colleagues' remarks regarding this amendment, and I'll add, without the long-standing Hyde Amendment, this bill is too extreme for the American people, and it will not pass the Senate. The Hyde Amendment isn't a poison pill rider. It is a limitation amendment prohibiting funds contained in a particular appropriations bill from being spent for a specified purpose. The Hyde Amendment limitation prohibits the spending of taxpayer funds within the Health and Human Services Appropriations Bill for abortions. The Hyde Amendment doesn't discriminate against women in federally funded health care, and the Supreme Court agrees. The Hyde Amendment is widely recognized as having a significant impact on the number of abortions in the United States, saving an estimated 2 million American lives since 1976. The Hyde Amendment routinely saves more than 60,000 lives a year in the United States. For decades, Republicans and Democrats agreed it was wrong and immoral to force Americans to fund abortion through their tax dollars. Most Americans, including millions of Americans who identify as pro-choice, object to the use of their tax dollars for the war on innocent human life that is abortion. None of this is new information to anyone in this room. What is new is the committee's removal of this provision that has been part of this bill for years during both Republican and Democratic majorities. Abortion is murder, not health care. Americans should not be forced to indirectly subsidize the murder of unborn children. I urge my colleagues to vote yes on this amendment, and I yield back.
Mr. Klein.
Thank you, Madam Chair. Thank the ranking member, and thank Congressman Cole for offering the amendment. I'm disheartened that the majority failed to keep these long-standing bipartisan provisions in the bill that we're marking up today, and as a member of the subcommittee, I recognize the chair's hard work on these issues. We've been in hearings on labor issues, health and human services issues, education issues, all during the year, and for the hard work to be cast aside by including this language, using taxpayer dollars to fund abortions, it throws all of that hard work aside. My colleagues and I have communicated the importance of the inclusion of the Hyde Amendment from the beginning of our conversations with the majority. We have been clear regarding this position. The inclusion of the language is not just supported by my Republican colleagues. It's a bipartisan issue. Nearly 60% of Americans agree that taxpayer dollars should not be used to pay for abortion. And further, this amendment restores the Weldon Amendment, which ensures that healthcare providers cannot be forced to provide abortion services, a protection that has been in place since 2005. We should not counterintuitively agree to fund a procedure that takes innocent lives we're tasked to protect. We should never force our healthcare workers to participate in abortion when they have taken an oath to heal and to do no harm. We're one in only 7 nations worldwide that allow for painful late-term abortions. A study from 2020 shows that children have the ability to feel pain as early as at 12 weeks of gestation, which doctors on both sides of the abortion debate agree, and people recognize the humanity of these unborn babies. I hope my colleagues would also recognize the science involved in this issue. Our nation was founded on the ideals of religious liberty, and as lawmakers, we should never allow an individual to be forced to act against their faith by funding abortion services with their tax dollars or by leaving healthcare providers without protection from being forced to participate in abortions. I'll always stand to preserve the sanctity of life and protect the freedoms of our healthcare providers. The government has a duty to protect the right to life. And that's why I wholeheartedly support this amendment. I urge my colleagues to do the same. Thank you, and I yield back.
Mr. Simpson. Yeah.
Thank you, Chairwoman DeLauro. First, before I say anything, let me say I appreciate the bill that you've put together and the bipartisanship you've worked with. Ranking Member Cole, there's some really important parts in this. Being the chairman of the TRIO caucus, I appreciate the plus-ups in the TRIO program and in NIH, and there is really some good work that you've put into this bill, and I appreciate that. But I do rise today in support of the amendment, which I feel is one of the most important amendments that we will consider today or any day in this committee. Let me say, it's been an interesting debate, one that I've been involved in, like many of you, ever since my days in the state legislature years and years ago. It seems like a never-ending debate about abortion, but that's not what this amendment is about. Nothing in this amendment, in the Hyde language or in the Weldon language, would prevent a woman from seeking an abortion. Nothing. But most of the debate has been about a woman's right to have an abortion and whether that's health care or not health care or other things. That's not the debate. The debate is who has to pay for it and whether someone that has religious objections to abortion should be required to perform one or participate in one. That's the only debate here. And it seems like there should be bipartisan support for that. There has been in the past. And as Mr. Cole pointed out when he introduced this amendment, Labor-HHS bill will not become law with this language in there. That's a fact. I think you all know that. So what we're going to revert to is the last Trump budget, if we do a CR. And if you're happy with the last Trump Trump budget, then go ahead and pursue this language and keep it in. I don't think we should do that. I think we should go along with the compromise that we've all reached in the past and try to get a labor-H bill that we can all agree on. But you know, you don't have to be a pro-life person to support this amendment. If you think more money needs to be put into abortions, if you believe in abortion rights, you have every right to donate your money, to go out and raise money from organizations and foundations to support abortions. You have every right to do that. What you don't have a moral right to do is to tell me that believes that abortion is morally wrong to forcefully take money from my pocket to fund abortions. That is morally wrong. And I've been interested in this debate today, and I've been told a lot of things that I wasn't aware of. I was told by Ms. Torres that being pro-life, we don't really care about life. I got to tell you in all honesty, you don't have a clue what I think. You don't have a clue what I care about. So you shouldn't say that. I would also say, we've been told, well, follow the science. Just follow the science. I am following the science, and the science that matters to me is, as Dr. Harris said, almost every abortion ends in one dead person. I yield back.
Mr. Calvert.
Thank you, Madam Chair. I appreciate being able to speak. Let's be clear. I just want to reiterate what the gentleman from Idaho just said. This debate today is not about a woman's right to choose. It's about American taxpayers being forced to pay for abortions. By the way, I knew Henry Hyde. I had the privilege to serve with Henry for many years. And I want to say, as people who didn't have the opportunity to know him, I remember the days when people would come down to the floor and fill the floor if Henry was going to speak, because he was such a great orator, no matter on what subject he would speak on. He wasn't just someone who spoke about abortion. He spoke about a number of issues. He was a very passionate individual. He was a great man, and so I just wanted to say that for those who didn't know him. But the Hyde Amendment has been included in this bill, as has been mentioned over and over again, for many years. And, you know, look, I'm a pragmatic individual. You know, debating this legislation, you know, at some point you got to say we're wasting time, your time, the American people's time, because we all know this language is not going to make it through conference. Just a fact. So I urge my colleagues to support the amendment. With that, thank you, and I yield back.
Mr. Reschenthaler.
Thank you, Madam Chair. Madam Chair, I strongly support the gentleman's amendment, and I want to associate myself with my good friend's remarks and also the remarks of my fellow Republican colleagues. Madam Chair, for more than 40 years, the Hyde Amendment has ensured that Americans are not forced to fund abortions with their hard-earned taxpayer dollars. In fact, one of its most vocal supporters was Joe Biden. Joe Biden told one of his constituents in the 1990s, and I quote Joe Biden, "The government should not tell those with strong convictions against abortion, such as you and I, that we must pay for them." Again, those are the words of Joe Biden. This should not be a partisan issue. I urge my colleagues across the aisle to reinstate the Hyde Amendment. With that, Madam Chair, I yield back.
Mr. Gonzalez.
Thank you, Madam Chair. Rescinding the Hyde Amendment would enforce pro-abortion policies on millions of Americans who disagree with that act. Even under the current law, states are given the option to fund abortions under Medicare. However, we've seen an overwhelming majority of states, 33 in particular, plus DC, reject state-funded abortions. I'm of Mexican-American descent. I represent a district that is 70% Hispanic. The Lord has blessed me with 6 children. I'm a reflection of my district, a district that sent me to Washington to protect the sanctity of life. Earlier this week, this committee defunded Border Patrol by $1 billion. Today, this committee presses for federal-funded abortions. As appropriators, we are tasked with responsibly delegating taxpayer funds. Today, the majority will strip the Hyde Amendment. In 2 years, the majority will reinstate the Hyde Amendment. I yield back.
Ms. Hinson.
Thank you, Madam Chair. And I'd like to thank Congressman Cole, our ranking member, for his leadership on this very, very important piece of legislation. And Ranking Member Granger as well for your leadership on this. It is a very passionate issue for so many of us. And I am proud to co-sponsor this amendment with my colleagues on the Republican side of the aisle. Madam Chair, I rise today in support of the Hyde Amendment, this very important pro-life amendment offered by my dear friend and colleague, Mr. Cole. I rise today in support of the unborn. I rise today in support of women, babies, girls yet to be born into this world who deserve every single opportunity that we in this room can give them. I rise today in support of the women who need encouragement to choose life, not coercion to end it. I rise today in support of the American taxpayer who does not want to pay for elective abortions with their hard-earned money. I rise today in support of the doctors, the nurses, and other healthcare professionals who are called to defend on life and should not be discriminated against for their beliefs, for following their conscience. I rise today in support of life, liberty, and the pursuit of happiness. And I rise today in support of the Hyde Amendment and the Hyde-Weldon Amendment, which have both enjoyed long-standing bipartisan support for decades, for longer than I have been alive when my mother chose life. I rise today in support of the 2.5 million lives that the Hyde Amendment's enactment has saved since 1976. And I rise most importantly today to be a voice for the voiceless, to defend the innocent, and that is exactly what I intend to do by adding my voice to this conversation. As my colleagues have already explained, this amendment is very simple. It's always been simple, and that's why it has enjoyed such bipartisan support. I'm not going to stand here and reiterate those points, but I think we should point out again, what we've already talked about today, is that all my colleagues on the other side of the aisle have already voted for this, supported it. I could go here state by state reminding everyone how many lives Hyde has saved in those states. In my own home state of Iowa, by the way, Hyde has saved about 40,000 lives, 40,000 babies, including 443 babies just this year. Madam Chair, it saved nearly 3,000 babies in Connecticut. And Mr. Subcommittee Ranking Member, Mr. Cole, you'll probably be interested to know it has saved about 47,000 babies in Oklahoma. I'm sure each of them is thankful for your leadership on this issue today. But this is about more than numbers. This is about the fact that Hyde does save lives. And even if we don't know the numbers, it's important to remember why we're here in the room today, which is to represent the will of the American public. And nearly 60% of Americans oppose taxpayer funding of elective abortions. The number is startling, and I know many of my colleagues have already pointed to that number today, but I think we should take a minute to break it down further. The poll was conducted just this year, so we're not talking about Americans of the past, of the 1950s, we're talking about 2021. Americans today, and 60% of them oppose using taxpayer dollars to fund abortions. So I think it's time we respect the will of Americans. These Americans are sitting around their kitchen tables right now worrying about paying their bills. They're worried about their jobs. They're worried about their loved ones, especially coming out of a devastating pandemic. They're worried about getting a spot in childcare. They're worried about putting food on the table, keeping lights on, and making ends meet. Those are the real kitchen table conversations happening in Iowa and around the country. They're working hard for their paychecks, and they hold strong convictions, much like most of us in this room. But what an absolute slap in the face to the millions of Americans who are working so hard and strongly oppose elective abortions, to tell them, hey, you know what, we know you're struggling, but we are going to fundamentally force you to do something you don't agree with. Send your taxpayer dollars here to Washington, and we're going to use them to pay for this horrible act that you oppose. That's just wrong, and it's reprehensible, and I'm frankly ashamed that we are even having this fight today. And I want to turn now to the second part of this amendment, which is common sense and foundational to our views as Americans, which is the freedom to exercise your beliefs, and that's the Hyde-Weldon Amendment. It's a classic non-discrimination provision that's been enacted every year since 2005. All it does is prevent the federal government from discriminating against health care providers because they refuse to provide abortions. And we're talking about Americans' basic rights to live out their lives and beliefs without the heavy hand or reprisal of federal government. Forcing doctors and nurses to go against their conscience is un-American. And while we're on the subject about conscience, not health care, because elective abortion is not health care, plain and simple, elective abortion is not health care, and doctors and nurses should not have their rights trampled for it. We talk a lot about civil rights here, but this place does seem really eager to throw them out the window when it comes to abortion, and I believe we are better than that. So instead, I'm going to try to appeal to your conscience today because that is what is guiding me in this fight. I can tell you, as a mother of 2 boys, Max and Jax, I cannot imagine a world without them in it. They're my boys. And I think all of us should consider the worth of our own mothers to make that decision to bring us into the world. I am grateful that our mothers all chose life and we're all in the room today together. And that's why I'm going to be voting yes on this amendment today. So again, I can get you the data, I can get you the numbers, but we have the facts, and that's what this is about. But if it's about what's right from wrong, I can't really help you with that. That's your own personal choice. That's your conscience. But I think what I can tell you is that I know life is precious. It's worth fighting for. The American taxpayer is with us on this. The American taxpayer is worth fighting for. And I'd encourage you all to respect that taxpayer. Let's honor the taxpayer's wishes. Let's not use their money for elective abortions. And let's not silence and punish our healthcare workers who are following their own conscience. The Hyde Amendment saves lives. So let's save some lives together here today. Thank you, Madam Chair.
Mr. Bishop.
I thank the gentlelady for yielding. I'd like to yield my time to the gentlelady, Ms. Torres.
Ms. Torres is recognized.
Thank you, Madam Chair. I am extremely disappointed that my colleague on the other side of the aisle called me out by name and that his comments were allowed to continue. When he said that I do not have a clue as to what he cares about. Civility in our debate is really important if we are to move America's priorities forward. I want to remind my colleagues and the gentleman that called me out that there are many Americans that also do not support war, but yet they pay their taxes, and that is not a choice that they have. And I do know what you believe in because I do see your votes. When you vote against the safety net that keeps families above from preventing them from becoming homeless, when you vote against food programs, when you vote against expanding health care, and when you vote against women being able to make their own health care decisions, I do know where you stand, and I do know what you're thinking. And I am asking that those comments be taken down.
Okay, so what's the story of that? Do we have any? I will go Ms. Torres, I am advised, and I've got the staff coming to speak with you. Apparently, the timing on asking the words to be taken down had to have occurred at the time the remarks were made, so that it is not, as I understand it, procedurally an opportunity for you to claim that right now.
Madam Chair, it is unfortunate that I was not allowed the time to do that. I am not going to speak out of order, as I believe that order and civility in this committee is important. But I do want to further state that I do understand exactly what my colleague is thinking about when he voted against the American Rescue Plan, which expanded the SNAP benefits and WIC, and of course, the child tax credit expansion. He voted against Affordable Care Act, the act that was in Congress then, which was the biggest health care expansion in decades. And he had said that someone would need to yield. You know, why does someone have to yield to me in order for me to strike those comments down?
Thanks, the gentlelady, and we will follow the procedure and rules of the that are so stated. With that, let me recognize Congressman Diaz-Balart.
Thank you very much, Madam Chairwoman, and I first want to thank you and the ranking member for the hard work in putting a very, very large and difficult bill together, and I know it takes a lot of work. On the issue on the Hyde Amendment, Madam Chairwoman, I understand that these are very deep-held beliefs. Some of us believe that protecting the lives of innocent children is paramount. And I understand that the other side has a difference of opinion, but I do also understand that both sides, for both sides, these are deeply held beliefs, which is why there has always been an understanding that, and it's been a bipartisan understanding. I'm glad that one of my colleagues read the letter by then Senator, now President Biden on this issue. So, you know, I guess people are now trying to say, oh, this is a radical point of view. Well, it wasn't radical. It's always been bipartisan. Again, even Mr. Biden believed that this point of view, the Hyde Amendment, was reasonable and respectful. And again, I understand that this is a sensitive issue, but there's always been an understanding that at least we should not force taxpayers who have very deep feelings about this to pay for abortions. This amendment doesn't change the issue of abortion. It's a discussion that we could have another day. This amendment just says that taxpayers should not be forced to pay for abortions when many believe that abortions, again, is something that's a red line because we're dealing with the life of an innocent child. And so I think it would be very unfortunate, because if there is a red line in this bill, it's this. And we all know that if this amendment does not pass, and this language, again, the elimination of the Hyde Amendment and the Weldon Amendment are not in here, this bill is not going anywhere, which is a shame because I know of all the work that has been put in it. Again, so I know that there's a lot of emotions, but this is the bottom line. Should taxpayers be forced to pay for abortions? There has been a bipartisan sentiment and agreement, and I think a national consensus on that. This bill eliminates that. This amendment solves that problem and would also allow this bill to eventually move forward. So I respectfully ask that we adhere to the reasonable compromise and agreement with the American people, bipartisan agreement that has existed, that is that taxpayers should not be forced to pay for abortions. I urge this language to be included, which again would make sure that Americans aren't forced to pay, that taxpayers aren't forced to pay for abortions. Without that, this bill is dead. Without that compromise, reasonable language that has been agreed to in a bipartisan way would not only jeopardize this bill, but I think would do lots of harm to this institution, because we have to be able to show the country that we can still work together. And it is not radical when Biden, people from the left and the right have always agreed taxpayers should not be forced to pay for abortions. That's why I urge the passage of this amendment. I yield back.
I'd like to thank the chair, and I'd like to thank the sub-chair ranking member, Chairman Cole, for providing this amendment. And it's obvious that the Republicans are united in this. I think this is the only amendment, the only conversation we'll have where I suspect that virtually every Republican is going to stand in opposition of pulling Hyde Amendment language from this appropriations bill. It used to be that the Democrats supported this. It used to be, as has been pointed out, that President Biden supported this. And I wonder what has changed? What moral revelation was received, or what change in thinking to change so many of my Democratic colleagues' minds? What changed in politics that would change so many of your minds? But I do know this, the American people haven't changed. The polling on this is very clear. The vast majority of the American people do not support compelling the American people to be forced to pay for an abortion. And to clarify as well, this isn't about abortion. This conversation isn't about race, and it's not about health care. No one should be forced to carry out an abortion. No one should be forced to assist in abortion. No one should be forced to pay for an abortion. This bill is too extreme. The American people simply don't support it. It will never pass the Senate. I will never support language that doesn't have these protections. Neither will any of my Republican colleagues. If you want to legislate, if you want to lead, then work with us on a compromise that would eliminate this incredibly poison pill. And I yield back.
Thank you, Madam Chair. I rise in support of the amendment. No American should be forced against their own beliefs to fund the endangerment of the unborn. Like so many of my constituents, I believe life begins at conception, and I recognize the value of life at every stage. As a member of Congress, it is my responsibility to give unborn children a voice and protect them from harm. Since 1976, since before I was born, the Hyde Amendment has been regularly attached to annual appropriation bills to prevent the use of federal tax dollars to promote or provide abortions. Inclusion of this amendment is critical to the faithful representation of the millions of Americans that oppose abortion and believe all life is precious. As appropriators, we are tasked with the serious and significant responsibility to evaluate our nation's spending needs. It is absolutely essential we carefully consider how federal funds are used with the consideration for the voiceless and the most vulnerable. I ask my colleagues to protect the unborn from harm, prevent American taxpayers from the violation of their beliefs, and support the inclusion of the Hyde Amendment in this bill. Thank you, Madam Chair, and I yield back.
With the microphone here. Are there any other members wishing to be heard on the amendment? Before I yield the 1 minute to close, I just would like to make a comment. I can. And they tell me I am the chair, so I can.
Yes, you can, Madam Chair.
Thank you. Yeah. Thank you. Yeah. I work every day, and as a legislator, and we're all legislators here, as a legislator in the House, I work every day to advance the respect for life and the dignity of every human being. And we believe, and I believe, that government has a moral purpose. I'm committed to making real basic principles that honestly are at the heart of my Catholic social teaching, helping the poor and disadvantaged, protecting the most vulnerable among us, and ensuring that Americans of every faith are given meaningful opportunities to share in the blessings of this great country. That commitment is fulfilled in different ways by legislators, but it includes reducing the rising rates of poverty, increasing the access to education for all, pressing for increased access to health care, and taking seriously the decision to go to war. We cannot pick and choose life issues. The Affordable Care Act is a life issue. Guaranteed health care coverage is a life issue. There are so many states that won't deal with extending Medicaid. That is a life issue. Medicaid does save lives, particularly for children, I might add. Abusing children or separating them from their families is a life issue. Not supporting gun violence prevention research is a life issue. People have mentioned food and nutrition assistance, housing, homeless assistance. These are life issues. Not supporting background checks is a life issue. We don't have that luxury to pick and choose. Everyone has spoken about the rich content of this bill, and yet at the same time has spoken about that we cannot support the top line in this bill. And all of the content of the Labor-HHS bill is a life issue. And as again, we don't have that luxury to pick and choose those that we want to single out as life issues. You know, the inability to pay for health care services, including abortion, is a matter of choice. And I want to urge my colleagues to oppose this amendment because it just, if you will, cherry picks on this one issue in terms of looking at the content of what we do and what we do every day to support life in its fullest. And we need to take a look at our decisions on these issues as to supporting life issues and not determine that there's only one issue that is protecting life. And with that, let me yield to my colleague for a minute to close.
Thank you very much, Madam Chair, and I want to thank you for the manner in which you presided over the hearing and conducted it, and your generosity with the clock. Quite frankly, it's an important subject. Every member, regardless of point of view that spoke, needed to be heard, and I appreciate what all of them had to say. You know, when we discussed this earlier in subcommittee, I actually referred to a negotiation you and I had been involved in a year ago where one of our colleagues on the other side of the rotunda, it was on a life issue, looked at me and said, Tom, you know, you can have a deal or you can have a fight, but you can't have both. You know, I think that's really where we are in this particular issue. When the decision was made by our friends on the other side to take out the Hyde Amendment, you decided to have a fight. And that's okay. That's your right to do that. You feel strongly about it. But that fight will keep us from getting to a deal. And we wouldn't be honest with you if we didn't make that crystal clear. I think my friend Mr. Simpson put it pretty well. The choice ultimately will get down, do we want a continuing resolution, which I don't think any appropriator should ever want, a continuing resolution. I value what this committee does, no matter who happens to be in the majority and the work that it does. But that's where we're headed if the Hyde language is not restored. I'd prefer to end that fight today by adopting the amendment. And I hope you'll do that. But if you don't, the fight will continue. It'll express itself in a lot of forms, and it will get in the way of us reaching a deal, which I think we can do. We've done it 6 times before, working with the chair, and I would love to do it a 7th. But I will just be crystal clear, Hyde Amendment is not in here. I don't think a deal will be forthcoming. So with that, I would urge adoption of the amendment, and I yield back, Madam Chair.
The question is on the amendment offered by the gentleman from Oklahoma. All those in favor say aye.
Aye.
All those opposed say no. 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 In the opinion of the chair, the noes have it, and the amendment is not adopted. Recorded vote has been requested. All those in favor, please raise your hand. A sufficient number being in support, a recorded vote is ordered. The clerk will call the roll.
Mr. Adderholt. Mr. Adderholt votes aye. Mr. Aguilar? No. Mr. Aguilar votes no. Mr. Amadei? Yes. Mr. Amadei votes aye. Mr. Bishop? No. Mr. Bishop votes no. Mrs. Bustos? No. Mrs. Bustos votes no. Mr. Calvert? Aye. Mr. Calvert votes aye. Mr. Carter? Aye. Mr. Carter votes aye. Mr. Cartwright? No. Mr. Cartwright votes no. Mr. Case? No. Mr. Case votes no. Ms. Clark?
No.
Ms. Clark votes no. Mr. Klein?
Aye.
Mr. Klein votes aye. Mr. Cole? Mr. Cole votes aye. Mr. Christ?
No.
Mr. Christ votes no. Mr. Cuellar? Mr. Cuellar votes aye. Ms. DeLauro?
No.
Ms. DeLauro votes no. Mr. Diaz-Balart? Mr. Diaz-Balart votes aye. Mr. Espaillat?
No.
Mr. Espaillat votes no. Mr. Fleischman?
Aye.
Mr. Fleischman votes aye. Mr. Fortenberry? Mr. Fortenberry votes aye. Ms. Frankel? No. Ms. Frankel votes no. Mr. Garcia?
Aye.
Mr. Garcia votes aye. Mr. Gonzalez? Mr. Gonzalez votes aye. Ms. Granger?
Aye.
Ms. Granger votes aye. Mr. Harder? No. Mr. Harder votes no. Dr. Harris? Dr. Harris votes aye. Ms. Herrera-Butler?
Aye.
Ms. Herrera-Butler votes aye. Mrs. Hinson? Mrs. Hinson votes aye. Mr. Joyce? Mr. Joyce votes aye. Ms. Capter?
No.
Ms. Capter votes no. Mr. Kilmer? Mr. Kilmer votes no. Mrs. Kirkpatrick?
No.
Mrs. Kirkpatrick votes no. Mrs. Lawrence?
No.
Mrs. Lawrence votes no. Ms. Lee of California? Ms. Lee of California votes no. Mrs. Lee of Nevada? Mrs. Lee of Nevada votes no. Ms. McCollum? Ms. Meng?
No.
Ms. Meng votes no. Mr. Molinar? Mr. Molinar votes aye. Mr. Newhouse? Mr. Newhouse votes aye. Mr. Palazzo? Mr. Palazzo votes aye. Ms. Pingree? Ms. Pingree votes no. Mr. Pocan? Mr. Pocan votes no. Mr. Price? Mr. Price votes no. Mr. Quigley? Mr. Quigley votes no. Mr. Rushenthaler? Mr. Rushenthaler votes aye. Mr. Rogers? Mr. Rogers votes aye. Ms. Roybal-Allard? Ms. Roybal-Allard votes no. Mr. Ruppersberger? Mr. Ruppersberger votes no. Mr. Rutherford? Mr. Rutherford votes aye. Mr. Ryan?
No.
Mr. Ryan votes no. Mr. Simpson? Mr. Simpson votes aye. Mr. Stewart? Mr. Stewart votes aye. Mrs. Torres? Mrs. Torres votes no. Mr. Trone?
No.
Mr. Trone votes no. Ms. Underwood? Ms. Underwood votes no. Mr. Valadeo? Mr. Valadeo votes aye. Ms. Wasserman Schultz? Mrs. Watson-Coleman?
No.
Mrs. Watson-Coleman votes no. Ms. Wexton? Ms. Wexton votes no. Mr. Womack? Mr. Womack votes aye.
Not recorded.
Ms. Wasserman Schultz votes no.
Is there any member who wishes to record their vote or change their vote? Ms. McCollum?
Madam Chair,
Yes?
when it's convenient for you, this is McCollum, and I'd like to record my vote as a yes.
It's
Excuse me,
convenient.
as a no. This is on the
it's
amendment. I'm ready for
convenient.
final passage. It's such a good bill. No on the amendment.
Ms. McCollum votes no.
Thank you. Does any member wish to record or change their vote? The clerk will tally. All right, let me go do my shtick there. Do you want to call for the final vote? Yes, of course, yeah, of course. On this vote, the yeas are 27 and the nays are 32. The amendment is not adopted.
Are there any other further amendments? Mr. Klein? For what purpose does the gentleman from Virginia rise?
Thank you, Madam Chair. I have an amendment at the desk, and I ask unanimous consent to be considered as read.
Without objection, the reading of the amendment is dispensed with. The gentleman from Virginia is recognized for 5 minutes on the amendment.
Thank you, Madam Chair. I'll be brief. This amendment ensures that no funds are used to rescind or revise the final rule titled Equal Participation of Faith-Based Organizations in the Federal Agency's Programs and Activities. Final rule set last year establishes that faith-based organizations participating in federal finance assistance programs and activities are not discriminated against in the application process. As then President George Bush said in an executive order on this issue all the way back in 2001, private and charitable groups, including religious ones, should have the fullest opportunity to compete for federal funds, and that statement stands true today. That particular policy was maintained through through subsequent administrations from both parties for the last 20 years. This committee should set forth their intentions in protecting these organizations from facing discrimination in this process. The Constitution guarantees that every American should be afforded opportunities regardless of their personally held religious beliefs of themselves or this organization. I urge my fellow committee members to join me in voting for this amendment that bolsters important non-discrimination protections. I yield back.
Are there any other members wishing to be heard on the amendment? If there's no further debate, the gentleman from Virginia is recognized on the amendment for 1 minute to close.
I would just ask my colleagues to support the amendment.
The question is on the amendment offered by the gentleman from Virginia. All those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, the noes have it, and the amendment is not adopted. Are there any further amendments? For what purpose does the gentleman from Maryland rise?
Thank you, Madam Chair. I have an amendment at desk, Harris number 1.
The clerk will read the amendment.
Harris number 1, strike sections 116, 117, and 118.
The gentleman from Maryland is recognized for 5 minutes on the amendment.
Thank you, Madam Chair. The amendment is very simple. Sections 116, 117, and 118 all deal with changes to the H-2B program. You know, last, when we did the DHS bill, you know, we passed an amendment that basically kept the H-2B program where it is now. It's a program that, you know, many of us believe actually probably needs more temporary foreign workers, but the committee decided a few days ago to keep that where it is. But sections 116, 117, and 118 in this bill would alter the rules in such a way to make it basically a program that probably couldn't process anyone for next year because it put vast new restrictions. Now, a lot of people do believe that we should take a second look at the H-2B program. Unfortunately, it's been tied to comprehensive immigration and a comprehensive immigration proposal, but I think at this time it would be unwise to make the changes suggested in 116, 117, and 118 in this bill because, again, it would make a program that could not, basically could almost process no temporary foreign workers for next year. We still have the need. The economy is hot. We have falling unemployment, and this is an important program. Yes, I agree. We do need to look at the program. We do need to see if some changes to be made, but I don't think this is the right place to do it. So I would move the amendment. I yield back the time.
Are there any other members wishing to be heard on the amendment? Mr. Pocan.
Thank you, Madam Chair. I rise in opposition to the amendment. The gentleman from Maryland gave some rather vague generalities. Let me give you a little more specifics about what his amendment actually does. Section 116 would ban H-2B visas for construction. Right now, our construction halls, the construction unions have hiring halls, and the employers and the unions together through the building trades have apprenticeship programs, over 1,900 training and education facilities across the United States that produce the safest, most highly trained and productive skilled craft workers found anywhere in the world. Currently, 640,000 of those construction workers are unemployed. So there's really no need to import construction workers into the United States under the H-2B program. In places like Wisconsin, what happens is where those unemployed construction workers are, firms generally from the South have a lot of these workers. They underbid the projects, come up to Wisconsin, take away jobs from people who are in my state who are unemployed, and that doesn't do any favors to the people who actually live in our districts where these folks are unemployed. Section 117 would require contractors to pay actual prevailing wages to these workers. Data shows that currently the H-2B workers are paid wages well under state and national averages. Just in one occupation area alone, landscape and groundskeeping, Employers pay workers on average between $2.59 and $3.37 less per hour by hiring an H-2B worker instead of a worker already in the U.S. earning the national average wage. And in construction, it's about 20% difference. So again, you're shortchanging, lowering the wages for your constituents by doing this. Section 118 perhaps is the most interesting choice of the gentleman. Rather than using a scalpel from our good doctor, he used a sledgehammer. This one specifically says that law-breaking employers can get H-2B visas. Now, if you look at this, this is people who've had wage theft violations, health and safety violations, H-2B program violations, even human trafficking. This is an amendment to allow human traffickers to be able to get H-2B visas. Let me just explain a few of these companies. There's a company, I won't say names, but let me just go through the examples. They've had between 2016 and 2019, almost 10,000 H-2B visas. They've been ordered to pay $4.77 million to workers in violation of the Fair Labor Standards Act. They've been charged for hiring discrimination against U.S. citizens over these foreign workers. They've had serious OSHA violations. Another company that had almost 5,000 H-2B visas during that same time period has had OSHA violations. Another company had a 16-year-old was killed on one of their job sites by a skid loader. They were forced by the Department of Labor to pay $180,000 for violations of the Fair Labor Standards Act, involving 132 workers. They were fined by OSHA for serious safety violations. They've had, the IRS has had to file federal tax liens against this company, so tax cheats were helping as well. Another company that had thousands of visas during this time period was found that the company used misleading tactics to prevent or deter U.S. workers from applying to over 450 job vacancies across 5 states. So they intentionally go around hiring U.S. workers in order to use these visas under that 118 section. There's another company that discriminated against females and non-Hispanic applicants in a labor group that had over 1,800 H-2B visas during that time. Another company was fined $1.8 million for willfully exposing workers to remove asbestos without safety gear. Now, clearly, I'm sure the good doctor knows that's not a good idea, being a good doctor. The owner has threatened to fire them if they spoke to investigators, and they failed to train these employees how to deal with asbestos. So let's give them some more H-2B visas, because clearly that would be a great idea. There's companies that have had fraudulent contracts. There's on, and of course our favorite, the company that illegally trafficked foreign workers. They are still going to be eligible under this gentleman's amendment to get H-2B visas. So I think, you know, there are many reasons why in places like Wisconsin, we don't want to hurt those who are still unemployed in construction, and we want to get them jobs. But certainly, I find it amazing that anyone would think a human trafficking company or a company with these serious violations should still be able to do this. So I just strongly believe that this is an amendment that is misguided. I think there could have been more surgical application if there were things that we truly wanted to fix, rather than just taking out these sections entirely and leaving this kind of abuse to continue. So with that, Madam Chair, I'll yield back.
Mr. Rutherford.
Thank you, Madam Chair. I rise in support of this amendment. The H-2B program is of critical importance to various industries, including the forestry industry, which my district heavily relies on. This amendment would strike the 3 sections in the bill given the detrimental harm that they would cause to small and seasonal businesses participating in the H-2B program. Sections 116, 117, and 118 in this bill would impose onerous wage requirements on employers, provide overarching authority to big unions, and require further rulemaking to implement these changes, wasting time and money. Madam Chair, all the cases that we just heard about from our colleague across the aisle they came to light. They were exposed. There were crimes that may have been committed that were, in fact, prosecuted. I would say that the system is holding people accountable at this point. This will exacerbate that. Instead of creating an environment of great cost and confusion, we should seek out ways to support our small and seasonal businesses who have been greatly affected by this pandemic. I urge support of this amendment, and I yield back.
Mr. Cuellar.
Thank you, Madam Chair. I rise in support of this amendment. When you look at the Immigration Nationality Act, there is a section there, Section 101, that provides the means for United States employers to find temporary workers for jobs that unemployed U.S. workers were unable or unwilling to do. Unable or unwilling to do. So you first go to the American worker, and if that American worker doesn't want to do that job, then you have to fill that need to make sure our economy keeps growing. So I emphasize you go first. Second of all, we are under the Biden administration, where the Biden administration did appoint a nominee or person to the Department of Labor. So if there are any concerns about some of the particular situations that were mentioned, then I feel confident that the Secretary of Labor will be able to address that, or even the judicial system, administrative system can address that. This provision, Section 116, 117, 118, will greatly harm small and seasonal businesses, including their American workers. And I would ask you to please support this amendment by Dr. Harris. I yield back.
Mr. Stewart.
Yes, I rise in support of the amendment and yield my time to my good friend, Dr. Harris.
Thank you very much. I appreciate that from the gentleman from Utah. I was trying to save time, but I guess I'm not going to be able to, because the gentleman from Wisconsin somehow suggested I don't care about health, I don't care about workers. Madam Chair, that's nonsense. Maybe the gentleman wasn't paying attention. The problem here is that this can't be implemented in time to deal with the need for temporary workers. But I'll go through it section by section. 116. I applaud the gentleman. Let's not use foreign workers for construction. Oh, but wait a minute. Section B of 116 says, oh, but if they're union workers, C says, but if they're union workers, we can take foreign workers. Well, I'd ask the gentleman from Wisconsin, what is it? No foreign workers? Or only foreign workers if they belong to a union? It also says that you have to have an unemployment rate in that sector less than 10% for an entire year. Ladies and gentlemen, we're coming out of COVID-19. That means virtually no sector can have an H-2B employee when these are applied for at the end of this calendar year. That's the problem with this bill. Let's go into Section 117. 117 isn't even drafted correctly because it suggests that the state and minimum wage is taken into account somehow when the prevailing wage determination is made, and that's not true. The law says it has to be the higher of the prevailing wage or the state and minimum wage. Now, it's not even drafted correctly. Let's go into 118. The problem is that there is no way for this certification process to occur. It's not in rules and regulations, and therefore, 118, although well-meaning, certainly we don't want human traffickers involved in bringing H-2B people into this country. That's not the problem is, how do we determine who's human trafficking, how is it certified, and how the Department of Labor and the departments authorized to implement the H-2B program actually do this. Madam Chair, we should enter into a discussion about the H-2B program, whether improvements need to be made, but this is not the time to do it because it is critical in an economy that's warming up that we not do things like say, well, no foreign workers in construction, oops, unless you belong to a union. That we not say, well, it's 10% unemployment rate has to be less than 10%, Oops, but we don't take into account that we're coming off of COVID. And, oh, by the way, it's actually hard to determine exactly which sectors of the economy are meet that 10% threshold for Section 116. Madam Chair, my point was, these discussions need to be, we need to decide, how to go forward in the H-2B program. Probably best left to an authorizing committee, I'll agree. We can certainly do it here. Now is not the time. I would ask that we, again, adopt the amendment, and that we take this up at a future time with an adequate time frame, because if we adopt this and it's in place October 1st, we will not have temporary foreign workers in time here for the next spring and summer season, and that would be devastating to a lot of economies, I'm sure in Wisconsin, and certainly in my district in Maryland. And I yield back to the gentleman from Utah.
Ms. Frankel.
Madam Chair, I yield to Mr. Pocan.
Mr. Pocan is recognized, and I believe, Ms. Frankel, you need to stand while Mr. Pocan is.
I will make it quick. I don't want to make my good neighbor have to stand too long. I will take you at your word, gentlemen, that you don't want human traffickers to get these. So would you be open to getting rid of that section that for people who are involved with wage theft and OSHA violations and not training workers for asbestos? Would you be willing to take that out of your amendment so at least we can protect those companies that clearly are on an ongoing basis breaking the law and getting H-2B visas? I'll take you at your word, but can we just take that section out? Because surely no one in this room would want us to give H-2B visas to a company that's involved with human trafficking. And so would you be open, I'll yield to you, if you'd be open to take out that striking of Section 118?
I thank the gentleman from Wisconsin for yielding. The problem is there is no means to implement this in time.
Okay, so I'll take that time back. Thank you. So the answer is no. That's the problem is, the industry talking point, clearly they want companies to, no matter what their records are, to continue to get H-2B visas. And that's exactly why we had this language in the bill. We're not here to protect bad companies, and yet clearly there are certain industries that are just fine with it, hence the heavy lobbying we've had in the last several days. So I still am strongly against this amendment, and I will yield back my time to Ms. Frankel.
If the lady from California would yield 30 seconds?
Florida.
Florida, I'm sorry. I'm sorry, that's right, Florida. They're both warm. Thank you very much. Well done. I would be open to putting an implementation date a year from now for Section 118. It's just an implementation date of October 1st is too soon. And I yield back to the gentlelady from Florida.
Mr. Reschenthaler.
I yield back, Madam Chair. Excuse me. I thought my friend needed more time.
Mr. Ruppersberger is recognized.
That was bipartisanship at its best. I thank you for that. I am a Democrat. I voted union most of on the votes that I've had to take. But when it comes to my constituents, I'm going to do what I think is best. In Maryland, we have a large crab industry. The majority is in Congressman Harris's district, but some in my district also. And when the crab industry came to me years ago, and they said, look, we can't get workers. We've had workers who come to our state and pick crabs from other countries, and they're the ones that know how to do it. And if they don't come, our crab industry is going to have real problems. And we don't want that to go out of business. And anyone who's had a back fin crab cake in Maryland would not want that either. I agree with most of the things that you said, Mr. Buchanan, and I'm glad you're trying to find a way. There's an easy way to deal with this. And to have Andy Harris working in a bipartisan way, that's something that we can get together and work out. Because what we're talking about are jobs that nobody wants. You know, jobs that people have been taking in a certain way. And by the way, when they come in with these jobs, they're highly regulated. At least they are in the crab industry. They are very highly regulated, including all of the requirements that most people would have in this country. So from our point of view, and I know Shelley Pingree the same way from Maine, she has issues with lobsters, as we do with crabs. And this is a big industry in our state. So I think if we can get you two together and we will work together with Shelley and I, we can, with our administration who will have an open mind, the Biden administration, I think we can resolve this issue on the jobs where people don't want. And there are many jobs out there that we need people from other countries and nobody can take it. And it's going to hurt our economy. And if there's something we want to do now, as much as anything, is keep our economy going. So I'm in favor of this bill, but I don't like a lot of parts of it. I agree with a lot of the things you said, and you did good research. But I think those can be resolved very easily. You're back.
Is there any other member who wishes to be heard?
Inquiry of the chair. We have I think, proposal to alter that last part, which I think would be good. Since he's offered, I think we should go ahead and take advantage of changing that date, because I do think no one in this room wants human traffickers to get H-2B visas. And if it's merely a matter of a dateline of October 1st being too abrupt, I want to take the gentleman to his good faith offering of doing that. So I don't know what it would take to do that right now, Madam Chair, but I think that's a good idea.
I'm advised that in order to do that, it has to be written down and it has to be proposed as an amendment.
So, can somebody yield to me?
I'll recognize the gentleman. Yes.
Thank you, Madam Chair. Look, given that since it's a limitation amendment, it's a little difficult because you'd have to limit the use of funds after a certain date. So you could pick July 1st of next year, for instance. That's one possibility. I would suggest that as we go forward in the discussion, this bill doesn't end here. Obviously, it's going to go to conference. I think that that's something that could easily be considered, is to say, look, pick a much later date, implementation date in the fiscal year for Section 118. But again, since it's a limitation amendment, that's not simply done, not as simple as this, if this were authorizing language. And with that, I don't know, Madam Chair, if you want me to close, just.
No, because I want to say something, okay?
And I certainly yield to the chair.
Thank you very, very much. And it looks like we have a path forward here. But I, too, want to rise in opposition to the amendment. The general provisions in the underlying bill would improve the H-2B program and increase protection for American workers. But Section 116 of the underlying bill prevents the H-2B program from being used in industries that face high unemployment. In just 6 of the top H-2B occupations, there were more than 3.8 million unemployed workers in June of 2021, compared to pre-pandemic rate of 2.8 million. That means that there are still more than 1 million people looking for work in just those 6 occupations than there were the previous year. Overall, our economy still has 6.8 million fewer jobs than it did in February of 2020. In addition, as I understand it, Section 116 would ban any H-2B visas for construction, and each year building trade unions and signatory contractors invest almost $2 billion to fund and to operate over 1,900 apprenticeship training and education facilities across North America that produce highly trained and productive skilled craft workers. Currently, over 640,000 construction workers are unemployed. No need to import construction workers into the U.S. under the H-2B program. Ending H-2B visas for construction also frees up visas for legitimate employers in other industries who can show a legitimate need for H-2B foreign workers. Section 117 would ensure that seasonal workers are paid fairly. In 2019, the average hourly wage certified for H-2B workers was lower than the average hourly wage for all such workers nationwide in 14 out of 15 of the top H-2B occupations. It may have been mentioned while I was out of the room, but in landscaping and groundskeeping, employers pay workers on average between $2.59 and $3.37 less per hour by hiring an H-2B worker instead of a worker already in the U.S., earning the national average wage for the occupation. In construction, H-2B workers are paid more than 20% less than construction workers already in the U.S. This provision would create a true wage floor in the program and require that employees offer and pay the higher of the local or national prevailing wage and stop accepting private wage surveys, which are consistently used to allow employers to pay H-2B workers less than the local average wage. These provisions promote national-level recruitment efforts, help to ensure family-sustaining wages for work that our nation determined was essential throughout the pandemic. Section 218 protects workers by denying visas to employers who have violated workers' rights or labor laws. Common sense. We do have employers who have committed wage theft, health and safety violations, other related violations, and still have access to the program. It's already been mentioned, but I have here in hand a list of H-2B employers and the number of violations committed, and I'm happy to share it. And employers who have been found to have broken the law and harmed workers, and we've had this kind of a discussion, should not be allowed to participate in the H-2B visa program. So the underlying bill would deny labor certifications for any employer that has violated labor and employment laws in the past 3 years. And this helps to perpetuate a cycle of worker exploitation and make sure that there are sufficient visas available for employers who do operate with fair labor practices. So I urge my colleagues to join me in opposing this amendment. Are there any other members who wish to be heard on this amendment? If there is no further debate, the gentleman from Maryland is recognized for 1 minute.
Thank you, Madam Chair. I'll just ask my colleagues to adopt the amendment as it is, and I'll be more than happy to work with the gentleman from Wisconsin before we go to the floor if we can resolve the issue about Section 118 and how it can be implemented. I'd be happy to do that, but I would again urge adoption of the amendment. Yield back.
The question is on the amendment offered by the gentleman from Maryland. All those in favor say aye. Aye. All those opposed say no.
No.
In the opinion of the chair, the ayes have it, and the amendment is adopted. All right. Are there further amendments? Congressman Harris?
Thank you, Madam Chair. I have amendment number 2 at the desk.
The clerk will read the amendment.
Harris Amendment number 2 on page 109, line 11, increase the dollar amount by $939,300,000.
Without objection.
Thank you very much, Madam Chair. I'll be very, very brief. What this does is, the issue of the strategic national stockpile is obviously a very important issue brought to light, the importance of which was brought to light by the COVID-19 pandemic. The committee last year directed the stockpile to produce what's called a professional judgment budget to accompany this year's budget request. It did. It actually found that we probably should be funding the strategic and national stockpile. And keep in mind, this is without COVID. This is without anything related to COVID, of $1.844 billion. Now, my amendment, which I'm going to offer and withdraw, is with unanimous consent, would increase the dollar amount of our SNS by $939 million, because we have to realize that's the amount we are underfunding the strategic national stockpile in the professional judgment that found that we would need actually $1.844 billion. And the two largest items would be anthrax and smallpox protections and prevention and therapeutics. And if we think COVID is bad, anthrax and smallpox are much worse, and yet we do not have adequate supplies in the strategic national stockpile, according to the professional judgment, to take care of that. So, Madam Chair, again, I want to bring this to the committee's attention, and with unanimous consent, I would offer to withdraw the amendment.
I thank the gentleman. I just want to make one comment about I appreciate thanks the gentleman for withdrawing. But with regard to the strategic national stockpile, I think it's important to note here that what we did, this is the, first of all, there was no offset here, but with regard to the stockpile, last year through COVID and the emergency supplementals, we provided $16 billion in the CARES Act for the Strategic National Stockpile. And then in addition, $3.2 billion in the December emergency supplemental. And I'll be very clear and honest with you. I asked over and over again for an accounting of what was in the stockpile and how much we had, what was left, and nada, zip, nothing, no response at all. So that I just, you know, we have provided a serious amount of money for the stockpile. I appreciate the gentleman withdrawing, but let me ask my colleague from Oklahoma if he wishes to comment.
Just quickly, we have done quite a bit there, and under your leadership, Madam Chair, people should know, I think we've actually increased funding for the strategic stockpile by about 35% in the last 6 years, plus that's in addition to what you're talking about. And I share the gentleman's concerns. I think this is actually something I hope we can have a hearing about. I don't think we have been as well informed about this by not just this administration, but the last administration. We just have not dug into it with the depth that perhaps we should have, particularly given what happened. So I look forward to working with the gentleman. I think it's an important point to make, but we probably do need to do the education of the committee and continue to work on this, because my friend is exactly right when he makes the point about you know, what would happen if Ebola, or, you know, there are a lot more deadly diseases than the one we just dealt with. And we could get caught very short, and it would be catastrophic. So, again, excellent point. Look forward to working with the chair and with my good friend from Maryland to see what we can do to make sure our country's in the right place.
Happy to work with you and happy to do a hearing, because I think it could be very productive. And with that, the amendment is withdrawn. Are there further amendments? Any further amendments or discussion? Seeing none, I recognize the gentlewoman from Ohio who is on the screen. Looked over here. Seeing none, I recognize the gentlewoman from Ohio for a motion, and I ask for your support on the bill.
Madam Chair, I move to favorably report the Labor, Health, Human Services, and Education Appropriations Act 2022 to the House.
The question is on the motion. All those in favor say aye. Aye.
Aye.
Those opposed? No. The opinion of the chair, the
No.
ayes. The opinion of the chair, the ayes have it. A recorded vote has been requested. All those in favor, raise your hand. A sufficient number has raised their hands, and so a vote is ordered. The clerk will call the roll.
Mr. Adderholt. Mr. Adderholt votes no. Mr. Aguilar. Aye. Mr. Aguilar votes aye. Mr. Amodei. Mr. Bishop. Mr. Bishop votes aye. Mrs. Bustos. Mrs. Bustos votes aye. Mr. Calvert. Mr. Calvert votes no. Mr. Carter.
No.
Mr. Carter votes no. Mr. Cartwright. Mr. Cartwright votes aye. Mr. Case. Mr. Case votes aye. Ms. Clark.
Aye.
Ms. Clark votes aye. Mr. Klein.
No.
Mr. Klein votes no. Mr. Cole. Mr. Cole votes no. Mr. Christ.
Aye.
Mr. Christ votes aye. Mr. Cuellar. Mr. Cuellar votes aye. Ms. DeLauro.
Aye.
Ms. DeLauro votes aye. Mr. Diaz-Balart. Mr. Diaz-Balart votes no. Mr. Espaillat. Mr. Fleischman.
No.
Mr. Fleischman votes no. Mr. Fortenberry. Mr. Fortenberry votes no. Ms. Frankel. Ms. Frankel votes aye. Mr. Garcia.
No.
Mr. Garcia votes no. Mr. Gonzalez. Mr. Gonzalez votes no. Ms. Granger.
No.
Ms. Granger votes no. Mr. Harder. Aye. Mr. Harder votes aye. Dr. Harris. Dr. Harris votes no. Ms. Herrera-Butler.
No.
Ms. Herrera-Butler votes no. Mrs. Hinson. Mrs. Hinson votes no. Mr. Joyce. Ms. Capter.
Aye.
Ms. Capter votes aye. Mr. Kilmer. Mr. Kilmer votes aye. Mrs. Kirkpatrick.
Aye.
Mrs. Kirkpatrick votes aye. Mrs. Lawrence.
Yes.
Mrs. Lawrence votes aye. Ms. Lee of California. Ms. Lee of California votes aye. Mrs. Lee of Nevada. Mrs. Lee of Nevada votes aye. Ms. McCollum.
As I said before, yes, I'm ready to vote for this bill, yes.
Ms. McCollum votes aye. Ms. Meng.
Aye.
Ms. Meng votes aye. Mr. Molinar.
No.
Mr. Molinar votes no. Mr. Newhouse. Mr. Newhouse votes no. Mr. Palazzo. Mr. Palazzo votes no. Ms. Pingree. Ms. Pingree votes aye. Mr. Pocan. Mr. Pocan votes aye. Mr. Price. Mr. Price votes aye. Mr. Quigley. Mr. Quigley votes aye. Mr. Reschenthaler. Mr. Reschenthaler votes no. Mr. Rogers. Mr. Rogers votes no. Ms. Roybal-Allard. Ms. Roybal-Allard votes aye. Mr. Ruppersberger. Mr. Ruppersberger votes aye. Mr. Rutherford.
No.
Mr. Rutherford votes no. Mr. Ryan.
Aye.
Mr. Ryan votes aye. Mr. Simpson. Mr. Simpson votes no. Mr. Stewart. Mrs. Torres. Mrs. Torres votes aye. Mr. Trone.
Aye.
Mr. Trone votes aye. Ms. Underwood. Ms. Underwood votes aye. Mr. Valadeo. Mr. Valadeo votes no. Ms. Wasserman Schultz. Ms. Wasserman Schultz votes aye. Mrs. Watson Coleman.
Yes.
Mrs. Watson Coleman votes aye. Ms. Wexton. Ms. Wexton votes aye. Mr. Womack. Mr. Womack votes no.
Does any member wish to record their vote or change their vote? Mr. Espaillat?
I vote aye.
Mr. Espaillat votes aye.
Mr. Joyce?
Mr. Joyce votes no.
Mr. Garcia? You voted already. You were standing. I thought you wanted. I'm sorry. Okay. Any member wish to record their vote or change their vote? Mr. Stewart?
Mr. Stewart votes no.
The clerk will tally. On this vote, the yeas are 33 and the nays are 25, and the motion is agreed to. I ask unanimous consent that the staff be permitted to make technical and conforming changes to the bill and report just approved. Seeing no objection, so ordered. 3 days. Okay. 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 The hearing on the Labor, Health, Education, Human Services Subcommittee is adjourned, and we will now move forward with Commerce, Justice, State. Yeah, okay. What's sweet? Right, listen, I love you. Committee will come to order. Our second order of business today is consideration of the Commerce, Justice, Science Appropriations Bill for fiscal year 2022. I will now recognize Mr. Cartwright to present the bill. No, wait a minute. Here you go. Hold on, babe. That's right. It's over down there.
Okay. Thank you very much, Chair DeLauro, for your leadership of this committee, especially during this very busy week. And thank you, Ranking Member Granger, as well. I also want to thank again my colleague, Ranking Member Mr. Adderholt, for all of his hard work and his collaboration on this bill. I know that Ranking Member Adderholt and I do not agree on everything, but I am heartened by the number of matters where we were able to see eye to eye, and I do appreciate his cooperation and partnership in helping to produce this bill. His input is certainly reflected throughout this bill. I also want to thank both the majority and minority staff who have put thousands and thousands of hours into crafting this bill, including about the last 30 straight hours. I'd like to recognize in particular the immense contributions of CJS Clerk Bob Bonner, Jeff Ashford, Faye Cobb, T.J. Loudermilk, Shannon McCulley, Jamie Wise, and Nora Fay. Also my personal staff, Chief Hunter Ridgway, Deputy Chief Jeremy Marcus, Rachel Cohen, Stephen Coffey, Cassie Steiner, Stephanie Hauser. Also the minority staff, Stephanie Gadboys, Kristen Clarkson, Darren Benjamin. I have learned so much from each of you during my first year as CJS chair, and I can't thank you enough. The Commerce, Justice, and Science Appropriations Bill we have put forward for the fiscal year 2022 is going to help us build a more prosperous, safe, and competitive United States of America. The CJS Appropriations Bill for fiscal year 2022 includes a net discretionary spending total of $81.3 billion. This is an increase of just over $10 billion, or 14% above fiscal year 2021, in order to fund the wide array of federal programs and activities that fall under this subcommittee's jurisdiction. From economic development and support for manufacturers to weather forecasting, climate research, resilient efforts, space exploration, scientific research, fighting crime, protecting civil rights, improving policing and the criminal justice system. This CJS Appropriations Bill impacts every American and is a force for good in so many ways. And I'd like to touch upon some of the many highlights of this very important bill. First, this bill helps preserve and create American jobs in distressed areas throughout this country by providing strong funding increases for a number of related programs and agencies. This includes Economic Development Assistance Grants, the Minority Business Development Agency, the Manufacturing Extension Partnership Program, which assists small and medium-sized U.S. manufacturing concerns. The bill further helps create jobs by expanding United States exports and fighting unfair trade practices of other countries, including through increases for the International Trade Administration and the International Trade Commission. We also provide solid funding levels for federal law enforcement, including funding for enhanced civil rights enforcement, counterterrorism initiatives, efforts to combat cyber criminals, enhanced environmental law enforcement, efforts to fight gun violence, among other initiatives. Strong funding is also provided for state and local law enforcement, including the COPS hiring program and Burn Justice Assistant Grant Formula Program. At the same time, this bill takes very seriously our obligation not only to help fight crime, but also to ensure that our systems of policing and criminal justice work effectively for all Americans This bill places strong conditions on the awarding of law enforcement grant funds, especially under the COPS and Burn JAG programs. Before receiving these funds, jurisdictions will be required to have an array of laws in place to ensure their police practices are just and humane as they serve and protect everyone in their communities. The bill also provides $100 million in new grant funding for investigations into law enforcement patterns and practices, as well as $42 million for improved police training. The bill also funds civilian review boards, a national police misconduct registry, and a national task force on law enforcement oversight. The bill provides strong funding levels for community-based violence intervention initiatives, and for youth mentoring grants, as well as for the First Step Act and Second Chance Act to help formerly incarcerated people transition back into society. These are only a few examples of the ways in which this bill will help institute real reform of our systems of policing and criminal justice. I am very proud to tell you this bill helps fight the growing problem of hate crimes in our society by providing $100 million in funding, $70 million under the Matthew Shepard and James Byrd Jr. Hate Crimes Prevention Act. This will help state and local law enforcement conduct educational outreach and training on hate crimes and to investigate and prosecute them. And an additional $30 million is also provided for community organizations for their efforts to prevent hate crimes. We provide substantial resources in this bill to address the opioid epidemic plaguing our society. Strong increases are provided for grant programs under the Comprehensive Addiction and Recovery Act, including for our amazing drug courts and veterans treatment courts as well. The bill also includes a huge increase for programs under the Violence Against Women Act, including more than double the fiscal year 2021 amount for sexual assault victim services. A strong funding increase is also provided for grants to help reduce the appalling backlog of unprocessed rape kits in this country. This bill provides full funding for the ongoing work of the National Weather Service to help accurately predict extreme heat and other forms of severe weather. I'm proud that this bill makes major investments in our ability better to understand and mitigate the very real and tangible impacts of climate change, including strong increases for the important climate work being conducted by NOAA, the National Science Foundation, and NASA's Earth Science Division. This bill helps strengthen American know-how. It helps strengthen American technological and scientific competitiveness by providing a 13.5% increase for the National Science Foundation. This includes increases for both scientific research and for efforts to broaden participation in STEM education and STEM careers among underrepresented populations. This subcommittee's commitment to American leadership in the world in space science, space exploration, and aeronautics research continues in this bill, which includes $25 billion for NASA, a substantial increase of more than $1.7 billion above fiscal year 2021. And finally, Madam Chair, this legislation provides a record high funding level of $600 million for the Legal Services Corporation in order to help greatly expand legal services for low-income Americans. In closing, I want to say I believe we should all be enormously proud of this bill. It's legislation which will do a substantial amount of good for the American people, and I urge my fellow members of this committee to support it. Thank you. I yield back.
I would now like to recognize the subcommittee ranking member, Mr. Adderholt.
Thank you, Madam Chair, and good afternoon. Chairwoman Doraro, Chairman Cartwright, thanks for bringing this bill to the floor this afternoon that deals with the FY22 Commerce, Justice, Science, and Related Agencies Appropriations Bill. Chairman Cartwright, let me say it's been a pleasure to work beside you over the last several months under your leadership as the subcommittee chair. And thank you for your hard work, for your commitment to fairness, and also for the work that you've done to try to rise above partisan politics. And I know you have really tried in the process to do that, and I sincerely appreciate it. I appreciate your openness, your honesty and communication, and through all the many virtual hearings that we had. But it is certainly good to be here in person today with so many of you that could be here for this long-awaited markup. Let me say first and foremost, there's a lot of things in this bill that we can't agree on, as I think you already mentioned. For example, NASA, I'm grateful that you provided $2.64 billion for the Space Launch System. That includes $579 million for the Block 1B development. Also, thanks for including the $110 million for nuclear thermal propulsion. That is a level necessary to work toward the design of a flight demonstration by 2024. We will need this technology to outcompete China as both countries continue deep space exploration. The bill that we're going to discuss this afternoon also addresses issues impacting all of our communities. It increases funding for drug court programs and other initiatives that address the opioid epidemic, as well as programs that are helping to eliminate the sexual assault kit backlog that you mentioned in your opening remarks, and to solve a lot of these cold cases. And I'm pleased that you were able to work with me to establish the funding for a new Forensic Nursing Center of Excellence. Increasing the number of sexual assault nurse examiners is critical to ensuring that survivors can access appropriate care and that nurse examiners are equipped to serve as expert witnesses to help bring the offenders to justice. In addition, I'm pleased that you have included strong funding for the aluminum imports monitoring system, which was created under the Trump administration. This bill also advances investments in science that are critical to our economic and national security, including quantum computing, artificial intelligence, 5G research, and advanced manufacturing. Also, I want to mention the Vortex Southeast, which was included in this bill. It does critical work to better understand the environmental factors and improve the weather forecast communications in my home region, and not only in the state of Alabama, but also in the southeastern part of the United States. Regardless of what state you're in, the southeastern part of the United States is very vulnerable to tornadoes, and helping us understand that is very important. But unfortunately, there are some areas in this bill that I feel falls short. The bill unnecessarily politicizes the state and local enforcement assistance portfolio. That includes the Burn JAG program, and that leaves many of us with a lot of unanswered questions. For example, when did it become controversial to support mental health programs or active shooter training for our nation's police officers? And why is the majority restricting access to programs that support policing reform efforts at the state and the local level? The millions of dollars for these programs in this bill are actually meaningless if states and localities can't meet the partisan standards that the majority has tied to these funds. And I know that, Mr. Chairman, that you have a lot of interest to balance in this bill. But to many people, this is exactly what defunding the police looks like. The bill also eliminates several long-standing Second Amendment protections that have enjoyed a long historical bipartisan support. It also eliminates the prohibition on the Department of Justice paying for abortions. This was even a step that was a bit too far for President Biden, as this long-standing prohibition on taxpayer funds to pay for abortion was included in the President's own FY22 budget request. Finally, despite locking up over $1.1 billion in law enforcement funding with unattainable preconditions, this bill simply spends way too much money. With a top-line increase of over $10 billion and double-digit increases across many of the agencies in this bill, The spending is simply irresponsible in the absence of a broader, physically responsible federal budget. However, that being said, as this process moves forward, I look forward to having an opportunity to improve this bill as we work together. I want to thank you again for your commitment and your hard work, Mr. Chairman, but also the staff that you have assembled: Bob Bonner, Jeff Ashford, Faye Cobb, Dora Fay, TJ Loudermilk, Shannon McCulley, and Jamie Wise. For all of your efforts, I pledge to work with you to resolve the differences that we have in these bills. And on my staff, the minority staff, I want to thank Stephanie Gadbos and Darren Benjamin and Kristen Clarkson for all their hard work and the many hours they put in. My personal staff, my Chief of Staff, Carrie Knott, my Legislative Director, Mark Dawson, Assistant Legislative Director, Megan Medley, and all of my legislative staff, Will Palmer. There's so many. Everybody in my office, I think, had a hand in this bill in one form or fashion. So I say thanks to all of them as well. So thank you, Mr. Chairman, for letting me make these comments this afternoon, and I look forward as we move through this process and as we look at the amendments today. Now yield back.
Thank you. I would now like to recognize myself for opening remarks. Thank you to Chairman Cartwright, to Ranking Member Adderholt, and to the subcommittee, the front office, and the personal office staffs for your work during this process. As we begin a new chapter in our nation's history following the devastation of the COVID-19 pandemic, I'm proud of the work you've all done to produce a bill that invests in the American people and builds that architecture we need for the future. The Commerce, Justice, Science, and Related Agencies bill before us meets this moment for the families and communities we represent. For far too long, the American economy has left the vulnerable, middle class, and small businesses behind, and the economic impacts of the COVID-19 pandemic have left many hardworking Americans struggling to get by. That is why I am proud that this bill supports small businesses, including manufacturers, and creates good-paying jobs. As we work to stimulate our economy and create jobs, we must also ensure that our communities are safe, with strong funding for local law enforcement. This bill demonstrates our respect for police officers who are facing a challenging environment by giving them the resources they need, and it fosters confidence in our law enforcement, building bridges with the communities they serve by providing better training and independent investigations for police misconduct. No matter how much we support our law enforcement, we cannot fully ensure their safety or our community's safety without addressing the deadly epidemic of gun violence. I am proud that this bill takes big steps forward in the fight against gun violence by providing strong funding for background checks and other enforcement tools. With this funding, we are working to stop the carnage that is happening far too often in every corner of our nation. And as we work toward keeping our streets safe, this bill helps ensure the safety of vulnerable individuals who are suffering behind closed doors. With strong increases for Violence Against Women Act prevention and prosecution programs, this bill addresses the scourge of gender-based violence, and it funds a national effort to ensure justice for sexual assault survivors by reducing the backlog of unprocessed rape kits. Along with these investments to address gender-based violence, this bill provides funding for civil rights enforcement, hate crimes investigations, and efforts to address domestic violent extremism. These investments honor our commitment to the vulnerable and to those individuals and communities, and helps to ensure that all Americans are treated with the dignity and the respect that they deserve. Finally, as we work to protect our citizens and keep violence and hate out of our communities, we must also work to protect our environment and keep the threat of climate change at bay. By providing robust funding for climate resilience and research at NASA, the National Oceanic and Atmospheric Administration, and the National Science Foundation, this legislation reflects our commitment to building a brighter, cleaner future for all. And with that, I would once again like to thank Chairman Cartwright and Ranking Member Adderholt, and I urge my colleagues to support this bill. I would now like to recognize Ranking Member Granger for her opening remarks.
Oh, but we don't have these things next week, though. Thank you, Madam Chair, for yielding. Chairman Cartwright and Ranking Member Adderholt, thank you for your work on this Commerce, Justice, and Science Appropriations Bill. I know both of you have worked together to address priorities of members on both sides of the aisle. Unfortunately, this year's bill is overshadowed by partisan politics and unbalanced spending priorities. The difference of opinion on both issues could slow down our appropriations process this year, leaving us vulnerable at a time when we know our nation is facing increasing threats. Instead of prioritizing these security challenges, this bill focuses on funding new, overlapping, and potentially duplicative programs that may not even be useful for our local communities. State and local grant programs are increased by an astounding $1.6 billion, with much of this funding conditioned on policies far outside the control of our local law enforcement officers. This is unacceptable, and it will keep our local officials from pursuing their own police reform agendas. Even worse, funds that might otherwise be available for body cameras, bulletproof vests, investigations, and overtime will be withheld indefinitely. There are several other items that concern me as well. This bill does not include a long-standing pro-life provision regarding the use of Justice Department funds. In addition, the language carried for many years to protect Second Amendment rights is stripped from the bill. Still, I'm encouraged that the bill includes strong funding for NASA. It is essential that the United States maintains our path toward renewed space dominance. This committee must develop appropriate bills with bipartisan support that can be signed into law. The Support Congress Justice Science Bill supports agencies that combat criminal threats, ensure compliance with our trade laws, and enable us to effectively counter China. We can't allow that to be delayed. Time, I believe, is of the essence. I urge my colleagues to consider the amendments our side will offer today. In closing, I'd like to thank all of the subcommittee members and all the staff for their hard work on this bill, specifically our military clerk, Stephanie Godboys, and our majority clerk, Bob Bonner. Thank you, Madam Chair. I yield back.
Are there any other members wishing to speak on this bill? Ms. Wasserman Schultz.
Thank you, Madam Chair. First of all, congratulations to Chairman Cartwright on presenting his first bill as a cardinal, and I commend him and Ranking Member Adderholt, who's a dear friend, on putting forth an FY22 Commerce, Justice, Science Appropriations Bill that spurs economic development, makes our communities safer, and confronts the climate crisis. I also want to thank Chairman Cartwright for working with me at the last moment to include an additional $22 million for the National Institute of Standards and Technology, or NIST, in response to the tragic building collapse in my district just 3 weeks ago. Dozens of families have lost their loved ones and their homes, and the death toll keeps rising. This additional funding will allow NIST to conduct a full technical investigation of the collapse to understand the causal factors and determine recommendations for improving building standards to prevent similar tragedies from occurring in the future. And I thank him deeply and his staff for helping make this possible. I'm also glad this legislation reinforces the reforms within the George Floyd Justice and Policing Act by funding pattern and practice investigations, enforcement of consent decrees, a police misconduct registry, body-worn cameras, and other measures that are designed to address rampant abuse in police departments and promote racial justice. It also includes language from my Police Accountability and Community Engagement Act, aimed at building more productive relationships between police officers and the communities they serve. The bill takes historic action to address the sharp rise in hate crimes in the United States. When one community is targeted by a hate crime, no one is safe. The federal government's leadership is indispensable in reversing this growing problem. That's why I'm so glad that this bill provides an unprecedented $70 million for Matthew Shepard and James Byrd Jr. hate crimes prevention and prosecution grants, a $65 million increase above FY21, reflective of the precipitous rise in hate crimes. Until last year, these grants that help states and local governments conduct educational outreach and training on hate crimes and investigate and prosecute these crimes were authorized, but never funded. I thank the chairman for working with me to tackle hate crimes in such a serious way. I'm also proud that the bill includes language for the first time ever that will direct the Department of Justice to develop a comprehensive strategy to counter growing gender-related hate crimes. The bill also tackles the crisis of online child exploitation, which was exacerbated by the COVID-19 pandemic by increasing funding for for missing and exploited children programs and carving out the full $60 million that are authorized under the Protect Our Children Act for the Internet Crimes Against Children task forces. ICAC officers are drowning in leads and are desperate for additional resources which will allow them to conduct proactive investigations that have the potential to rescue children. I'm so glad this bill commits to funding these task forces at the full authorized level. And I'm also pleased by what this bill does for marine conservation and ecosystem protection. The bill includes $38 million for the Coral Reef Program and $28 million for competitive external research to boost funding and partnerships with academic institutions to stop coral bleaching. And I'm glad the bill also includes $15 million in dedicated funding for harmful algal bloom research to further develop ways to prevent, mitigate, and control harmful algal blooms, which can wreak havoc on Florida's marine ecosystems and coastal economies. Thank you for your work on this excellent bill, Mr. Chair, and your commitment to making sure that we can protect Americans all across this country. I look forward to working with you to pass this bill. I yield back.
Mr. Rutherford.
Thank you, Madam Chair, and thank you, Ranking Member Cartwright and Adderholt and staff for the great work on this bill. I want to raise two issues that I have great concern with on this bill, though, and it appears that we've plussed up the budget for JAG grants and for COPS grants, but in reality, because we've put so many hoops in the way that agencies have to jump through to be able to qualify for this money. In fact, I fear what's going to happen is we're actually going to defund these agencies who are receiving a lot of these grants as we speak. The second thing is that it appears that we're trying to implement many of the elements in H.R. 1280, the Justice Policing Act, that passed the House but is still stuck in the Senate. I would hope that we could come together on those things that we could agree on. But this is a backdoor funding of elements in that bill that have not been authorized. And so I fear that this becomes more of an authorization bill than an appropriation bill. And so with that, I'm going to vote against this bill. I do have an amendment that I think will fix this, and I'll talk about that later. But, Madam Chair, I just wish that I could support this bill because it looks good, but I'm afraid that it's a facade. I yield back.
Mr. Ruppersberger.
Yes, thank you, Madam Chair. First, I want to congratulate Chairman Cartwright and Ranking Member Adderholt for assembling what I think is a great appropriations bill that tackles some of our most pressing and serious problems, from climate change to law enforcement, to addressing hate crimes, to protecting us from cyber attacks, to maintaining our competitive edge in science and space. I want to thank the Chair for helping me with my crime intervention projects, for helping me with funding for the Digital Coast Act, and funding for Baltimore City crime issues. Specifically, I appreciate the $7.2 million to help cities address recommendations and changes in their consent decrees. Baltimore City has a consent decree to address some of the issues surrounding the death of Freddie Gray. Gun violence has been on the rise in many cities, and this bill helps our states and localities address problems from ghost guns to straw man purchases, and to help states with gun buyback and red flag laws. On the national security front, I appreciate the inclusion of the full amount requested by the administration to help with counterterrorism, especially with the increase in funds to address domestic terrorism. It's on the rise and it needs to stop. In terms of cybersecurity, SolarWinds was a massive attack on the U.S. government, and this bill helps us address these attacks by increasing funds to the FBI to help increase coordination between government agencies and also government partners like academic institutions and the energy sector. Space, the final frontier, funding for NASA is one of the most important missions that we fund in all of our government. The $25.04 billion from NASA is $1.77 billion above the FY 2021 enacted level and goes a long way to help the U.S. be a leader in space exploration, science, and STEM. Also, we cannot let China or Russia get ahead of us in space. Again, thank you to the chairman and ranking member for drafting a great appropriations bill under the fiscal circumstances, and I yield back.
Mr. Cole. Mr. Cole is recognized.
Thank you very much, Madam Chair. I want to also congratulate Chairman Cartwright and Ranking Member Adderholt for their hard work. I particularly appreciate the increased funding for the National Oceanic and Atmospheric Administration, NOAA, an increase of $1.03 billion above the $6.46 billion. National Severe Storm Laboratory is actually in my district at the University of Oklahoma, and I can assure you we'll put our share of those funds to good use. Also appreciate the strong funding for the anti-opioid programs that are part of the Comprehensive Addiction and Recovery Act. We saw a substantial increase. The National Aeronautics and Space Agency, NASA, again, a sizable increase. And finally, the National Science Foundation, which came in at $9.63 billion, 1.15. I think it's absolutely critical to keep funding of research at the cutting edge, and I think our chairman and ranking member did that. I want to particularly thank the subcommittee for paying attention, as I discussed recently, to the consequences of the McGirt versus Oklahoma Supreme Court decision. The administration president requested an additional $70 million because of the fallout from that decision. The federal government now has enhanced responsibilities for law enforcement over about 40% of the state of Oklahoma, and it requested and received $70 million additional dollars to beef up U.S. attorneys' offices, help with additional FBI, and field additional federal marshals into the area. Again, we're having ongoing discussions with Chairman Pingree and her people, and we hope that we can also work there and get some additional resources for tribal law enforcement. But this is a very important first step. Again, we appreciate the President asking for the additional money, and very much appreciate the subcommittee for providing those funds, and look forward to continuing to work on that issue as we go forward. Thank you, Madam Chair.
Mr. Cuellar.
Thank you, Madam Chair, and I also want to thank Chairman Cartwright on the work that he's done, and certainly want to thank also the ranking member, Mr. Elderholt. Both of them have worked together. We do understand there's a few differences, but overall the bill is something that I think we can work on to get it done past the finish line. I want to emphasize a couple of things I've been working on for many years, and that is the immigration judges. This bill provides $891 million, which is, it grants the $106 million increase for 300 positions within the EOIR, including adding an additional 100 immigration judges, bringing the total of immigration judges to 734 once we hired the judges that we also authorized, or should I say funded, back in December for 2021, and of course for this FY22. I also would emphasize working with Chairman Quigley also. We also provide funding so the immigration judges currently, as you know, they have 493 courtrooms, should have an additional 30 more by the end of the FY, which will bring a total of 523. And we are estimating by adding another 94 courtrooms by the end of FY22, we will have a total of 617 courtrooms by the end of FY2022. The reason I say that is because we've had more judges than courtrooms, and we got to make sure that we coordinate that together. In addition, there are some additions, and I want to thank Mr. Cartwright, Chairman Cartwright, because there is an increase of $55 million to increase the support of the efficiencies to reduce the over 1.3 million cases that are in backlog. And that includes money for increased funding to transcribe audio recordings for cases on appeal, and scanning existing paper records into an electronic format. The judges still deal with paperwork, and we got to make sure that they get into the electronic format. In addition, as I mentioned, another $50 million to increase courtroom space required so they can support additional staff. I want to thank the chairman for the police reform. We do not defund the police. We reform the police, and Chairman Cartwright did a very good job along with the other members to make sure that we do that. Finally, the last thing is a couple things. I want to thank the chairman, the ranking members for the $110 million for the drug courts, the $14 million for the court-appointed special advocates program, which is the CASA program. Those are children that need assistance, and these are volunteers that get them in the courtrooms. So, Mr. Chairman, ranking member, I want to thank you and your staff for the great work on this particular bill. Thank you so much. I yield back.
Mr. Garcia.
Thank you, Madam Chairwoman. I want to first of all thank Chairman Cartwright and Ranking Member Adderholt for this bill. And frankly, as a member of the CJAS subcommittee, very pleased to see the culture that these two leaders have developed within the subcommittee, a culture of cooperation and actually working to solve problems. Very impressive. I'm pleased with the bill in many regards. Pleased to see the language in about $15 million for NOAA to increase the utilization of satellite and artificial intelligence assets in wildfire detection efforts, which benefit the West significantly. I'm also happy to see fire weather funding added in the manager's amendment that will go towards strengthening CAL FIRE's information website, which is a critical tool for firefighters on the ground. I also want to personally thank Chairman Cartwright for including my amendment to ensure that Congress can execute its constitutional responsibility of oversight duties over federal agency. I do appreciate that, sir. I think overall, from a science perspective, we're doing a good job within this bill. The support for SLS, nuclear thermal propulsion, increased funding on the justice side for fighting violence against women, and increasing funding to help fight this opioid crisis, absolutely critical and necessary. And so what we're looking at right now, I think, is what looks like to be a very solid and attractive-looking three-legged stool. One that I would want to support, except for the fact that one of those legs is actually made out of balsa wood, and that's the justice side of this. We are increasing funding for grants, but at the same time imposing onerous conditions for those grants that will actually make some of these grant opportunities untenable or unaffordable for local law enforcement agencies. I know that will be the topic of discussion here as we move through this. But effectively anchoring a lot of the provisions and conditions for grants to H.R. 1280, which is not a settled bill and not going to get through the Senate and become law, is a very onerous proposition for most local law enforcement agencies. The net aggregate and the net effect of these conditions is effectively defunding the police. There is no other way to say that. And for that reason, I think we have a significant poison pill in this otherwise beautiful three-legged stool that hopefully we can remedy before final passage. I yield back, Madam Chair.
Ms. Lee of California.
Thank you very much. First of all, I'd like to thank Chairwoman DeLauro, our Ranking Member Granger, Subcommittee Chair Mr. Cartwright, and Ranking Member Adderholt for their really bipartisan leadership in putting this bill together. And also, again, to the staff, I just want to commend and thank them for their work and their dedication to these issues. Now, the mistreatment, and I have to say this bill, Mr. Cartwright, is really a major step in the right direction because I personally know, like many know, that the mistreatment of Black Americans and other people of color at the hands of some police officers in communities throughout this nation is a result of systemic racism. In the wake of the one-year anniversary of Mr. George Floyd's murder and the sentencing of Derek Chauvin, the nation demands transformational change in our policing institutions and criminal justice system. These inherently systemic issues require us to reinvest in programs that will keep our communities safe, that's all of our communities safe, and help them thrive, and I believe that this bill is a step in that direction. This is really what we mean when we say that we must reimagine policing so that it's so that it's fair and so that it's just for everyone, Black Lives Matter also. It mandates accountability by creating restrictions on federal funds to state and local governments that do not attempt to address racial profiling and police misconduct. To promote transparency, it also provides funding to implement a national registry for police misconduct and resources to conduct independent investigations of police use of excessive force. And I have long been a champion of providing resources directly to community-based organizations because they often know best how to serve their own communities. That's why I'm so pleased, Mr. Cartwright, to see the $25 million in grants to these organizations to study and create programs that provide community and problem-solving strategies for law enforcement agencies. And yes, we must be steadfast in addressing racial profiling, implicit bias, and the use of force within law enforcement agencies. This pivotal point in our history has continued to highlight the need for substantial change to racist policing practices. As the co-chair now of the Bipartisan Cannabis Caucus, I also want to thank you, Mr. Chairman, for including important language that would prohibit the Department of Justice from interfering in access to medical marijuana in states, the District of Columbia, and territories where it is legal. This language is critical to ensuring that the federal government doesn't preempt what states are doing in terms of full legalization or the legalization of medical marijuana. First, I want to thank the chair for including $500,000 for the National Institute of Criminal Justice Reform in my district. This funding will help expand the collaborative efforts of community-based organizations to prevent violent crime and provide victim services, including support for those residents most vulnerable to gun violence in Oakland. And I am in strong support of this bill. I look forward to bringing this bill to the floor. Thank you again, Mr. Chairman, for this, because once again, I finally believe that in this bill we can say that Black lives do matter. Thank you.
Ms. Watson-Coleman.
Thank you, Madam Chairwoman. First of all, I'd like to thank Chairman Cartwright and Ranking Member Adderholt for their leadership on the CJS Subcommittee. I'd like to acknowledge the hard work that went into drafting this year's bill and the inclusion of many of my priorities. I'm also pleased to see that the FY22 bill provides a 14% increase over the FY21 levels, making meaningful investments in criminal justice reform, the Violence Against Women Act, reentry programs, reducing recidivism, and investing in minority businesses. It also includes reforms that are addressed in the George Floyd Justice and Policing Act, and it proposes to tackle the horrific increase in hate crimes. When it comes to investing in the nation's economy, this bill provides much needed funds as we come out of the pandemic, including support for minority-owned businesses. Some programs that I'd like to highlight that will benefit the people of my district, and indeed those across the country, include the $70 million in the Minority Business Development Agency, which will help create jobs and expand growth opportunities among minority-owned companies. The $1.5 million to continue the Minority Serving Institutions entrepreneurship, a pilot program that supports entrepreneurship for undergraduate students at minority serving institutions, and the $433 million for the EDA, which will help improve our nation's infrastructure, boost economically recovering communities, and launch innovative community development efforts. But that's just not all that's good about this bill. I am very pleased to see this bill not only invest in the Department of Justice, but works to refocus the energy of the department to address the real threats our nation is facing while moving toward a more restorative justice path that will support many communities of color who have been victimized by our justice system. This includes language that I submitted in my request letter that would have the Department of Justice ensure that grants that are made under the National Criminal History Improvement Program are made available for supporting the implementation of record systems that will allow for the efficient expungement and sealing of criminal history records. Sealing and expunging records will allow people with past convictions to access employment, housing, and make it easier for them to be fully re-entered into society. This is on top of seeing that grants provided under the Second Chance Act have been funded at $125 million, an increase of $25 million above the FY 2021 year. These grants will expand the develop opportunities for individuals to gain access to jobs, housing, and other support needed to enjoy a normal life, all the while reducing recidivism. The bill also includes language that works to reduce the prison rate through programs such as a new initiative to fund states to close and repurpose youth prisons. Providing an alternative to youth incarceration will have a down-the-road effect that will help reduce our overpopulated prison system. Programs like this and others in this bill that address our overpopulated prisons will greatly benefit Black and Brown communities who disproportionately make a large percentage of that population. This bill also focuses the DOJ's energy on addressing the threat that domestic terrorism has had in our country, specifically address white extremists. Over the last few years, we have seen an increase of attacks from white supremacists and other far-right groups in the United States, including the January 6th insurrection. Last year, the FBI and other federal agencies expressed that white extremists were the biggest risk to our country, despite the previous administrations not wanting to address or even acknowledge it. So it gives me hope that this bill provides funding and direction for DOJ to tackle this issue, since it is the biggest domestic terrorist threat in our country today. I thank the chair and the ranking member for working with me to get my priorities into the bill. I thank all the hardworking staff. And Madam Chair, I thank you for your leadership on this committee. And with that, I thank you and I yield back.
Ms. Lawrence.
Thank you, Madam Chair. And I really want to recognize my chairperson, the ranking member, Chairman Cartwright, who is doing an amazing job. You're my hero, sir. And Ranking Member Elderhawk, and the entire staff. I'm thrilled to see the bill provides robust funding for several programs that's critical to the United States, my district, and the state of Michigan. As mentioned before, the Economic Development Administration, the Minority Business Development, the Manufacturing Extension Partnership Program, Gun Violence Reduction Grants, NASA Space Exploration. I'm so excited that its efforts to land the first woman and the first person of color on the moon. I'm just really excited about that. One of the areas I have as one of my priorities is artificial intelligence. Artificial intelligence has integrated itself in so many areas of our society and has become very mainstream. However, we as a government have not been keeping pace. It is essential that we invest in the research so that we can have ethical guidelines. We're using artificial intelligence in many ways, and some of us as members of Congress are just not aware, but having the funding for the research is critical. I also want to highlight the Violence Against Women Act programs being funded, and that is something that we have been very supportive of. Lastly, I want to commend the subcommittee for including language and resources to combat rising surge of hate crimes, including funding for the Matthew Shepard and the James Byrd Jr. Hate Crimes Prevention Act. This will give us resources as across this country we're seeing an uptick in hate crimes in America. I also want to thank the community for providing so many of the community project funding requests. One I would like to highlight is Ceasefire Detroit. My city of Detroit has seen its explosion of crimes related to gun violence. And so this program is a cornerstone of a layered approach to gun violence reduction. It expands its efforts to assist individuals arrested on gun-related charges. And we are looking for it to be a model that has proven success at addressing gang and group-related violence. And I really am proud of the investment in our local communities. Again, I congratulate my chair and thank him for his leadership, recognizing the ranking member and staff for their work on this bill. I urge my colleagues to support, and I yield back. Thank you so much.
Mr. Case.
Thank you, Madam Chair. As a proud member of our Commerce, Justice, Science Subcommittee, I rise in very strong support of this measure, which makes major investments in climate change mitigation, marine conservation, economic development, scientific advancement, and law enforcement for our country at a critical time in our nation's history. First, like several of my colleagues already, which is gratifying, I want to recognize the over $1 billion increase this bill provides to our National Oceanic and Atmospheric Administration, a tremendous agency that has been really underfunded and marginalized in recent years, but is now coming back. And we have made a tremendous investment in one of our nation's leading science agencies on the front lines of the battle for our oceans, land, and air against climate change. NOAA's programs span the entire country and provide critical services that protect our coasts, conserve our oceans and marine species, and prepare us for unpredictable, severe weather patterns that threaten our heartlands and beyond. I'm especially grateful for the funding provided by this bill for the repair and maintenance of our atmospheric baseline observatories, including the Mauna Loa Observatory in my state of Hawaii. Mauna Loa is where the world-renowned Keeling curve was developed that proves beyond doubt the alarming increase in carbon dioxide in our atmosphere over just decades. These funds for maintenance and repair will ensure that these invaluable observatories will continue to provide the critical data and science we need to effectively combat climate change. Like my colleague, Ms. Wasserman-Schultz, I note that the $5 million increase in NOAA's Coral Reef Conservation Program is especially critical to Hawaii, Florida, and the U.S. territories that have the coral reefs of our country. Climate change, pollution, and other harmful human activities are killing our coral reefs nationwide and globally at an alarming rate. And the funding in this relatively small program goes a long way in supporting our efforts to conserve and protect our nation's and world's coral reefs. I want to also recognize the historic investments this bill makes in economic development and scientific advancement. While our national economy is on a path to recovery and millions of new jobs have been added in the past few months, we cannot lose that momentum. This bill keeps it going with significant increases to the Minority Business Development Agency, the Economic Development Agency, the Manufacturing Extension Partnerships Program, and much more. The major funding in this bill to our National Science Foundation and the National Institute of Standards and Technology will also go a long way in supporting U.S. innovation and scientific leadership at a time when both our partners and competitors are forging ahead in areas like artificial intelligence, quantum computing, and more. I also want to acknowledge our increased investments in STEM education, including through the $10 million increase in NASA's Minority University Research and Education Program. Lastly, I note, as many of my colleagues, that this bill provides significant increases to the Burn Justice Assistance Grants and Community-Oriented Policing Services programs that are critical to our local and state law enforcement agencies nationwide. At the same time, I believe this bill establishes reasonable and fair conditions on those funds aimed at implementing meaningful reform where warranted. I appreciate the leadership of our chair and ranking member and the partnership with all of our subcommittee colleagues in producing a measure that meets the challenges of these times. Thank you.
Ms. Capter?
Thank you, Madam Chair. Chairman Cartwright and Ranking Member Adderholt, congratulations on completing your first bill. Your inaugural product is a bill that delivers for our nation, invests in our science institutions, promotes American competitiveness during a time of national transition. Americans are demanding accountability and an end to economic and social inequality. And this bill provides for robust economic development platforms necessary for national growth, cognizant of unique region-by-region challenges. Our country is a vast country with very different challenges in the respective areas that we represent. On the justice front, the bill connects the dots. It strongly supports burn grants, but also calls for justice, provides critical resources for frontline police officers and community policing needs, and supports a plan to level an unfair playing field for millions of Americans. This bill provides historic funding for the Civil Rights Division and creates a safety net for policing programs and provides important increases for the United States Civil Rights Commission. The programmatic support for mental health and police training is transformational for officers responding to the national mental health crisis, which we all know is very serious and severe. This bill also makes commitments to the science agencies at NOAA and the National Science Foundation that advance American scientific innovation. At NASA, the bill meets the moment by providing $935 million for the aeronautics program, a critical element to promoting a next-generation airline industry that can seed the future for domestic manufacturing to maintain America's preeminence in flight. And in space exploration, the budget supports critical programs that will empower deep space exploration with $40 million for solar electric propulsion and groundbreaking support for nuclear electric propulsion and nuclear thermal propulsion. The bill provides strong support for the Department of Commerce with key investments in the Census Bureau, the International Trade Administration, and domestic manufacturing, and certainly for the Economic Development Administration as a key instrumentality for building back better with an understanding of various regional challenges that are quite different depending on which part of the country you live in. Chairman Cartwright and Ranking Member Adderholt, I look forward to our continued partnership and the shared stewardship for our nation and the institutions supported by this bill, and I yield back and urge its support.
Ms. Mang. Ms. Mang. Ms. Mang? Are there any other members wishing to make general comments on the bill? Seeing no other member wishing to make opening remarks, I'd like to recognize Mr. Cartwright to offer a manager's amendment.
Madam Chair, I have an amendment at the desk, the manager's amendment.
The clerk will read the amendment.
I ask unanimous consent to waive the reading of the amendment.
Mr. Cartwright is recognized.
Thank you, Madam Chair. Madam Chair, this is a standard manager's amendment. We have followed and adhered to the convention here on the Appropriations Committee that we follow of offering managers' amendments that contain merely technical and clerical changes, but also non-controversial and bipartisan substantive changes. That is all that is in there, and I urge its adoption. I yield back.
Mr. Adderholt is recognized.
Thank you, Madam Chair, for yielding, and I want to thank Chairman Cartwright for working with us on this and all my committee and these committee members to address the non-controversial bipartisan improvements that's in this bill and in this report. I especially just want to reach out to Chairman Cartwright for his willingness to work together on the NASA language to bolster competition and redundancy in the human space landing program to improve the U.S.'s prospects of landing astronauts on the moon in 2024. So with that, I support the amendment and I urge its adoption, and I yield back.
Are there any other members who wish to be heard on the amendment? I recognize Mr. Cartwright for 1 minute. Oh, Ms. Hinson, I'm sorry.
Thank you, Madam Chair. I rise in support of the manager's amendment today. This amendment includes my provision to recognize the importance of flood mapping technology and the incredible tools that those technologies provide to support disaster mitigation, which we are very familiar with in Iowa. Last night we just had a bout of some severe weather that went through, but have a lot of experience with that, and I know many of my colleagues in this room have had similar experiences as well, or represent a district that has suffered like mine has. It was during my time as a journalist in 2008 in Cedar Rapids covering the flood. We called it the epic surge because it was an epic surge. It caused incredible damage to our community and incredible heartbreak to our community. It was coined as Iowa's Katrina at the time, and it was some of the worst flooding that my home community and my home state of Iowa had ever seen. The Cedar River crested to its highest level in Cedar Rapids history, 31.12 feet, and so I did some digging on some context just to make that relatable, and the U.S. House chamber is 36 feet high, so that would basically almost fill the entire chamber, just to give you a perspective of how high that water was. The previous record had only been 20 feet, so well above that, and the damage was not only just, it was insane to see, but it was extremely costly as well. The damages caused by the 2008 flooding and the related disasters are considered the 6th largest FEMA disaster ever. Financial losses from floods are serious. Estimates are around $13.5 billion in direct flood-related property losses from 1998 to 2015 in Iowa alone. And in the wake of the devastating 2008 flood, some good came out of that, and the Iowa Flood Center was born. The Iowa Flood Center has been at the forefront of watching the increasing river levels in the state since its inception. This gives Iowans access to the latest in technology and the resources to help our communities and our businesses prepare for floods in the future and become more resilient to their effects as well. The center does incredible work, such as providing innovative science-based flood mapping technologies to help our communities and, again, help mitigate flood-related disasters. Real-time information on soil moisture, watersheds, precipitation, stream level gauges, which allows those susceptible to respond before disasters occur and then again help mitigate. Through support and funding from NOAA, the IFC has made Iowa a role model for the nation, and I know their work is just getting started, and this definitely helps that work. Many other projects are currently underway to help Iowans be more flood resilient and to be better prepared, and the center is working to share this information with neighboring states and other river communities who may experience similar disasters. So investing in and supporting flood mapping technologies is not only a smart investment, as we've seen, it's absolutely a critical investment. And by analyzing the data that comes from this, we can reduce the overall cost of flooding disasters in the future for local communities, and most importantly, that's taxpayers who foot that bill. So I can assure you that flood control and mitigation are much less expensive than the incredible economic loss, the cleanup, the damage, and then rebuilding of lives after a devastating flood. Again, this amendment emphasizes the importance of those flood mapping technologies and the help that they provide to flood-susceptible communities. It encourages NOAA through the JTTI to continue supporting innovative weather and flood technologies. So again, we should aim to make flood mitigation a part of recovery, give centers like the Iowa Flood Center the tools that they need to be part of the solution. We need to help them so they can help others. Definitely a simple ask, but I thank you for supporting this really important, crucial piece of the legislation, and I urge everybody to support the amendment. Thank you. I yield back.
Are there any more members who wish to be heard on the amendment? I recognize Mr. Cartwright for 1 minute to close.
Thank you, Madam Chair, and thank you for the kind comments of our ranking member and Representative Hinson as well. Representative Hinson's words remind us that it is really not just the coastal communities that have to worry about the changing climate. The inland, places like Iowa, places like Pennsylvania, when we have the recurring instances of the 100-year flood that require the changing of the flood maps, it is climate change that is the culprit, and it's something we all ought to work together on. So I'm gratified for the kind comments of my colleagues on the manager's amendment, and I urge its adoption. I yield back.
The question is on the amendment. All those in favor say aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it, and the amendment is adopted. Are there further amendments? For what purpose does the gentleman rise?
I have an amendment at the desk, and I move that it be considered as read.
Okay. The gentleman is recognized for 5 minutes on the amendment.
Thank you, Madam Chair. This is Klein, number 2. I would explain the amendment. I want to thank the Chair and thank the Chairman Cartwright and Ranking Member Adderholt for their help as well. This amendment will align the FY22 nuclear thermal propulsion appropriations funding included in the bill with the direction of our FY21 and FY20 bills. The nuclear thermal propulsion will dramatically decrease travel time to and from Mars while increasing payload size due to lighter aircraft. Compared to its chemical counterpart, a nuclear thermal rocket possesses twice the propulsion efficiency due to its high thrust engine and ability to accelerate propellant at high speeds. Given NTP's advantages over traditional chemical propulsion systems, NASA estimates the technology will reduce transit to Mars by 2 months, from 6 months down to 4. I hope it be the pleasure of the committee to adopt the amendment, and I yield back.
Gentleman is recognized. Cartwright.
Thank you, Madam Chair. This amendment is not opposed. And we thank the gentleman for Virginia not only for proposing the amendment, but also for serving on our fine subcommittee. Yield back.
Mr. Adderholt, do you want to say anything?
Yeah, just, Madam Chair, I rise in support of the gentleman's amendment, and I think serious initiatives are needed to address this violent crime problem in the U.S., and so we support it, and I yield back.
The amendment is accepted. All those in favor say aye.
Aye.
Aye. The amendment is adopted. Are there further amendments? Oh, I'm sorry.
Yeah, I've got one.
All those opposed, no. In the opinion of the chair, the ayes have it, and the amendment is adopted. Score one for you, Mr. Klein. Are there further amendments? Ms. Hinson?
Thank you, Madam Chair. I have an amendment at the desk, Hinson Amendment 1, and I would ask unanimous consent that it be considered as read.
The gentlewoman is recognized for 5 minutes on the amendment.
Thank you, Madam Chair. This amendment, pretty simply, would address $50 million that is in the budget in the bill for a pilot program providing lawyers for illegal immigrants to important bipartisan programs that provide justice for all Americans. In this bill is a $50 million pilot program that provides taxpayer-funded lawyers to immigrants seeking asylum and, quote, other forms of legal protection. I think there are some significant problems here. The pilot program is not only duplicative and an insult to taxpayers in this regard, but it also jeopardizes the safety and security of Iowa families and American families as a result. Under the Immigration and Nationality Act, immigrants seeking asylum claims are granted access to counsel, but at no expense to the American taxpayer, and that's really what the issue is here. The Department of Health and Human Services already has a similar program for children, provides legal representation for immigrant children who are seeking asylum, obviously cannot represent themselves in the process. You can debate the merits of it, but that's not what this is about specifically today. The key difference between these programs is what this is about. This one applies to adult illegal immigrants seeking other forms of legal protection. So when you look at who that would include and who would fall into that category, that is where the concern is. Those without the credible fear claims and those who have criminal backgrounds. So again, this program is taxpayer-funded lawyers for that subset of people. I think this is concerning. What are we doing here when we're doing this? Why is this program operating through the Department of Justice, not Homeland Security? The Homeland Security markup was just a few days ago, and I don't recall, obviously, this coming up in that discussion. I think that's where that provision should be. But again, this bill provides $50 million for the pilot program, for a program that's never been authorized by Congress. And I think that's also a problem. That's also a whopping $35 million more than President Biden requested. It's a horrible way for Congress to be exercising the power of the purse. So we should put that through the authorizing committees, debate that on the House floor. But I think this comes down to bringing Iowa common sense to how Congress should be operating, especially when it comes to this money. But there's a lot of things that we could do with the $50 million, and I have some ideas that I'd like to run through, and that's what this amendment does. There are other programs that we could support that are within this bill, programs with merit that we have as a body supported for years, and that provide security and justice to all Americans. So it redistributes in this amendment $50 million to bipartisan programs under the Department of Justice. $5 million goes to the Debbie Smith DNA Backlog Grant Program to help states seek justice for rape victims by dealing with the rape kit backlog. I'm sure that's an issue that affects many of our states and our districts. $9 million would go to the Human Trafficking Prosecution Unit to hire at least 10 additional attorneys to prosecute human traffickers, sex traffickers, and help those trapped in forced labor. $10 million would go to the Sexual Assault Forensic Exam Grant Program, providing training, assistance, and education to professionals involved in treating victims of sexual assault. $10 million would go to the Edward Byrne Memorial Justice Assistance Grant Program to help law enforcement, crime victims, and tribal communities in seeking justice. And then finally, $16 million would go to the State Criminal Alien Assistance Program, which is designed, as you all know, to reimburse states for the apprehension of the illegal immigrants on criminal charges. So again, the most dangerous in our communities, it helps them apprehend and hold them. So these programs are shining examples of what the Department of Justice should be doing. They reflect the priorities of not only Iowans, but of Americans everywhere, again, by using American tax dollars to support justice and protect the vulnerable at the same time. That's what the Department of Justice is for, so I would urge you to support this amendment, my amendment, and prioritize justice for Americans today. Those are my opening remarks, and I yield back. Thank you, Madam Chair.
Mr. Cartwright.
Thank you, Madam Chair. I rise in opposition to the gentlelady's amendment. This amendment seeks to strike funding for a pilot program that provides grants to nonprofit organizations to provide legal representation for children and families claiming asylum or other legal forms of protection in the United States. While the amendment would transfer funds to several programs supported heavily by my Democratic colleagues, many of the programs proposed have already received healthy increases in this bill. In fact, they were notably absent in the moving representatives' requests to our subcommittee. The pilot is focused on providing basic legal services to a small margin of the most vulnerable populations coming to our country who have exercised their legal right to claim asylum. With the current immigration case backlog totaling over 1.3 million persons, which has already been mentioned here in this room today, providing resources to nonprofit organizations who can ensure legal representation for the most vulnerable populations seeking a better life in our country is more important than ever. The ability to pay is an obstacle for many who seek legal representation. While we know some pro bono or reduced fee services are available, they are not nearly sufficient to meet the demand. You can't move 1.3 million people through a justice system efficiently if you don't have lawyers who know how to do it involved. You know, one of the most cherished aspects of American justice, one of the things that makes us all proud to be American citizens, is our American justice's concept of due process. And legal representation is a critical component of due process. U.S. immigration law, which is extremely complex, places the burden on the immigrant to meet the standard of proof that he or she qualifies for asylum. Without an attorney that understands immigration law and procedure, meeting that burden of proof is well nigh impossible, regardless of how meritorious the asylum claim may be. And so the system fails there. It fails to provide our American due process. Further, immigrants with access to legal representation are far more likely to show up to court than those who lack representation and consequently decrease court costs, ultimately saving U.S. taxpayer dollars. I urge a no vote on this amendment. Yield back.
Mr. Adderholt.
I just want to rise in support of this amendment. This bill undermines current law by funding this new legal aid pilot program for legal representation of aliens. And current immigration law under Section 292 of Immigration Nationality Act affirms an alien's right to counsel, but only at no expense to U.S. government. So I feel like that this is a good amendment, and I urge a yes vote on the amendment and yield back.
Are there other members who wish to be heard on the amendment? Ms. Roy Ballard.
Thank you, Madam Chair, and I oppose this amendment. Whether an individual has legal counsel is one of the most decisive factors in determining whether they will be able to obtain legal relief in their removal proceedings. The grant program this amendment would eliminate is a very small step toward correcting the long-standing disparity in people who have the ability to obtain counsel and those who do not. And I thank the chairman for this subcommittee for making this important investment. Access to counsel is incredibly important to ensure immigrants receive a fair hearing by having their due process rights protected and ensuring their ability to navigate the incredibly complex immigration systems we have. It is also important to note that studies have shown that those who have legal representation are more likely to comply with their legal obligations, including their appearance rates in courts. For those in detention, this representation is even more important. I also want to point out that legal representation programs can dramatically reduce the government's costs for detention, enforcement operations, and court proceedings, in part because having legal representation reduces the requests for continuances, which further strains an already backlogged immigration court system and increases burdens on our taxpayers. For all these reasons, I urge my opposition of the amendment, and I yield back the balance of my time.
Mr. Aguilar.
Thank you, Madam Chair. I wanted to speak in opposition to this amendment. When immigrants make the dangerous journey to our country, they do so in search of a better life, which is what Chair Roy Ballard was talking about. They're seeking freedom and the opportunity and the promise of equal treatment under the law, which is exactly what Chairman Cartwright was mentioning. Those values are the reason why our country has served as a beacon of democracy around the world. And I oppose this amendment because this is an affront to those values. By providing legal representation to asylum seekers who arrive at our borders because they're escaping unspeakable, dangerous circumstances in their communities. You know, we're doing so by creating this pilot program that will help expedite the broken immigration process where justice is denied. And in doing so, by creating this program, we're also ensuring, because the statistics show, is the Homeland Security Chair mentioned, an individual shows up to their hearing nearly 100% of the time when they have representation. And so let's treat this with the seriousness that the chairman has outlined in this proposal. And because this is a program that will honor those values, but also help our system and ensure that justice is given. So I urge my colleagues to defeat this amendment. Let's move forward with this program. I want to thank the chairman for putting this in the bill, and I look forward to working through these issues and ensuring that individuals are given the opportunity to make their case in court, which is exactly what the asylum process was meant to do. Yield back, Madam Chair.
Mr. Quigley.
We should be embracing this provision, not striking it, as this amendment would do. Immigrants that come to the United States deserve basic due process if they go through immigration court. Today, 41% of all in immigration court are unable to obtain a lawyer. That means nearly half the immigrants in immigration court face the prospect of deportation alone opposite a federally funded ICE prosecutor and before a federally funded immigration judge. The imbalance is stark, and the deck is stacked against immigrants who, if deported, may be permanently separated from their family. For asylum seekers, deportation could mean being returned to the harm at the hands of the persecutors they were fleeing from. If these reasons were not enough, it's also clear that allowing immigrants to have appointed counsel is smart policy. As my colleagues have said, studies have shown ensuring access to legal information and counsel is the best, most effective way to get people to show up at rates approaching 100%. Look, we have to ensure basic due process for immigrants in our country, and that's what these important funds seek to do. I urge opposition.
Ms. Torres.
Thank you, Madam Chair, and I rise in opposition to this amendment. I strongly support the legal representation pilot program, one we have long fought for, and that is direly needed. Earlier this year, I wrote a letter to the chairman along with 47 of my colleagues who understand the huge impact of this relatively small program. Let me be clear, asylum seekers are here legally, and it is not just moral, but it is our legal obligation to fairly process them. Asylum seekers fled conflict, natural disasters, and political persecution. Many of these same situations my colleagues have spoken out against. Many of those in our system are Central Americans fleeing violence and authoritative regimes. Our laws allowed many of these individuals to make claims in immigration court that would allow them to stay, but too often, individuals without counsel don't understand their rights under our very complicated system. This is not just about doing the right thing, though. Frankly, legal representation strengthens our immigration system as a whole. Right now, the backlog in processing immigration court cases, including asylum claims, keeps many lingering in detention. And not only is that cruel, it is costly to the U.S. taxpayer. If the argument that this is the right thing to do does not sway you, remember, this is also smart fiscal policy. We know that immigrants are more likely to show up to immigration court if they have legal representation, and we know that cases will move faster. We know that immigration attorneys and judges are shouldering far too much work. Asylum appeal attorneys see far too many cases that reach them because of lack of initial due process. They need to focus on details in the cases that should show up before them. Judges too often go beyond their role and spend significant time explaining the law in our immigration court process. This is not the right use of their time. All of these processes add cost and unnecessary delays to cases. This is not how our immigration system is supposed to operate, and one of the core tenets as a democracy is our fair, independent judicial system. We call it due process, and that must extend to immigration court as well. If we truly want to address the urgent needs of our immigration system, this program is a huge step in the right direction. Thank you again. I urge my colleagues to vote against this amendment, and I yield back.
Mr. Rutherford.
Thank you, Madam Chair. I rise in strong support of this amendment. Listen, I hear those across the aisle talk about due process and cutting costs. And look, as a law enforcement officer myself, I absolutely always wanted people to have their due process rights. But they are provided in these situations. These administrative hearings before immigration judges is their due process. What they don't have a right to is American taxpayers hiring them an attorney to drag out that process. You think it's going to speed up the process by hiring them an attorney? Absolutely not. You will see more continuances than you can shake a stick at. Due process will be slowed down, which means these individuals will simply be retained in the United States longer. So the due process, they have due process. They have it now. And the idea that we're going to save cost by hiring an attorney and that will increase their appearance in court, I think the evidence will show otherwise. There are those that have attorneys now that don't show up in court. Madam Chair, I fully support this amendment. I think we are putting the taxpayer on the hook for an amazing amount of money, and for no reason. So I yield back.
Mr. Gonzalez.
I rise in support of this amendment. You know, America is a special place, and, you know, we're built on immigrants, and we're also a nation of laws, and we can't forget that. And what we're talking about here is we're talking about illegal immigration. This week alone, you've seen, the American public has seen open border policy unfold before us, right? From $1 billion defunding of Border Patrol to pushing for funding for legal representation for illegal aliens. That is an issue. That is an issue that undermines our rule of law. We should absolutely be focused on attracting those that want to come to America to live the American dream the legal way, right? By funding illegal immigration, all that does is encourage more illegal immigration. I want to remind this committee that 88% of those seeking asylum are denied their claim, 88%. So the American taxpayer will flush 88 cents out of every dollar down the drain in this motion here, and it's just unfair all the way around. I also remind everybody, I have over 42% of the southern border, and as that happens, this isn't, my constituents see this every single day. This isn't in a book. This isn't talking points. The American people deserve to know that this committee has defunded Border Patrol by $1 billion and is putting that funds towards representation for illegal immigration, and that is wrong. I yield back.
Are there any other members wishing to be heard on this amendment? If there's no further debate, the gentleman is recognized on the amendment for 1 minute to close.
Thank you, Madam Chair. I just really quickly, right off the bat here, did want to correct the record a little bit on my request to the committee, because it is mentioned in this amendment. Obviously, I believe that we should redirect dollars to rape kit backlogs, but it was my #1 request to the Debbie Smith DNA Backlog Grant Program for $122 million. So this is a priority for me. And another priority that I also listed in my letter to you, Mr. Chair, was the Edward Byrne Memorial Justice Grant Assistance Program. So I was not silent on these issues. I've been supportive of these issues, and I want to make sure the record reflects that. Duplication is disrespectful to taxpayers, and I think that's what's at stake here. Again, it's not about offering representation, it's about who is actually paying for that representation. And I do appreciate that, again, there are varying viewpoints on this issue within this committee. And I'm disappointed that there's opposition to this amendment, because I do think that in this case, it's how narrowly crafted this is. Other forms of legal representation opens us up to abuse, and I believe then we'll see, again, a country that's less safe and secure for not only Iowa families, but for American families. So again, let's respect the taxpayers, redirect this money to priorities that I know we all share, and I would ask for a yes vote on my amendment. Thank you, Madam Chair. I yield back.
The question is on the amendment offered by the gentlewoman from Iowa. All those in favor say aye. Aye. All those opposed say no. 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 In the opinion of the chair, the noes have it, and the amendment is not adopted. Are there further amendments? Mr. Oh.
Madam Chair.
What purpose does the gentleman rise?
I ask for consideration of my amendment, Adderholt number 1.
The clerk will read the amendment.
Adderholt Amendment Number 1, page 83, insert after line 2 the following and
I
redesignate.
request we dispense the reading.
Okay. Then the gentleman is recognized for 5 minutes on the amendment.
Madam Chair, I rise this afternoon to offer this amendment with the intention of reinstating the Department of Justice Hyde-like language, known officially as the Helms-Armstrong Amendment. As this amendment clearly states in the language, it's very short, it's very simple. It merely bans federal funds for elective abortions under DOJ, except for 2 years in the 1990s. This bipartisan language has been the law since FY 1987. The removal of this long-standing bipartisan language is another step that is too far for my colleagues, by my colleagues on the other side of the aisle. It was even a step too far, as I mentioned earlier, by President Biden, given that this prohibition on taxpayer funds to pay for abortions within DOJ was maintained in his own FY22 budget request. In light of this morning's debate on the Hyde Amendment, I think it's appropriate to recall the restrictions on abortion funding in the various appropriation bills that were all a result of the foundation that Henry Hyde laid when he helped Congress understand the gravity of abortion. The Hyde Amendment and the related amendments across the fabric of the appropriation bills have been stitched together over the years in order to protect the lives of the most vulnerable and the most powerless among us. But we need to be clear about this one thing. This is not about the right to have an abortion. It's about taxpayer dollars being used for abortions. This is the real issue that we're debating this afternoon, not the right to have an abortion. The majority's efforts to remove Hyde-like protections from CJS bill is an attack on those vulnerable children and their mothers, as well as the taxpayers of the United States. So I would urge the support for this amendment, and in respect of time, I yield back, and I appreciate the Chairwoman for letting me speak to this amendment.
Mr. Cartwright.
Thank you, Madam Chair. I rise in opposition to the gentleman's amendment. The CJS bill includes no prohibition against funding abortions because this is a matter of equity, because reproductive decisions should be a matter between a woman and her doctor, and particularly because the exceptional reproductive circumstances that this bill addresses means it is also a matter of inmate health. To quote David Skaggs of Colorado, a distinguished former member of this committee, who told the House while debating this provision, quote, "It is particularly cruel to force a woman to carry an unwanted pregnancy behind bars. The forced delivery is only the tragic prelude to the mandatory relinquishment of the child that immediately follows." I urge a no vote on this amendment. Yield back.
Are there members who wish to speak on the amendment? Ms. Frankel?
Thank you, Madam Chair. I rise in opposition to this amendment, which would deny abortion coverage to individuals in the criminal justice system. And I really hope that this is the last time I have to say, my, here we go again. Seriously, you want to lock up women and then force them to become parents against their will? I mean, this amendment is really cruel, and with all due respect, I ask the sponsor, does the amendment come with quality prenatal care in a daycare center? Probably not. The sad fact is, Madam Chair, that women are the fastest growing population in the U.S. prison and jails. There's approximately 231,000 women and girls behind bars, including 16,000 in federal prisons. And of course, prisons are often designed without incarcerated women or pregnant people in mind. They're poorly equipped to handle medical needs, including prenatal and postpartum care. So I applaud and thank my colleagues for introducing this appropriations bill without an abortion coverage ban for people in federal prisons, because no one should be denied access to abortion just because they are incarcerated. Keeping in mind, members, that prisons have the legal responsibility to provide medical care to incarcerated people, and the courts have consistently recognized that people do not lose the constitutional right to an abortion when they're incarcerated. And pregnant people who seek an abortion while in federal custody face unique obstacles that can make it difficult, if not impossible, to obtain an abortion. Obviously, it's pretty hard to get a decent paying job when you're locked up. And in addition, prisons must navigate a variety of other barriers to abortion access depending on where the prisons are located. Some state laws require multiple medically unnecessary trips, which are even more costly and difficult. And again, these coverage bans hurt those who already face significant barriers to health care, particularly low-income women who are disproportionately women of color. Ending this coverage ban ensures that people are able to make their own decisions about their lives and future dignity. And, you know, you should realize, I mean, we've heard this over and over and over. All these amendments that ban funding for abortions are aimed at poor women. And I just say, pick on someone your own size. Anyway, enough is enough is enough. I urge my colleagues to vote no on this amendment, and I yield back.
Are there any other members who wish to be heard on this? Mr. Harris.
Thank you, Madam Chair. I support the amendment from the gentleman from Alabama. Clearly, we shouldn't be funding a death penalty for that baby. That baby was innocent. That baby's not going to prison for a crime. And what the gentleman is just saying, we just shouldn't fund the death penalty for that baby. That's all. I think it's perfectly reasonable amendment. I think the American citizens overwhelmingly don't want taxpayer dollars paying for abortion. I support the amendment. I yield back.
Are there any? Ms. Underwood.
Thank you, Madam Chair. I strongly oppose this amendment, and I urge my colleagues to do the same. Abortion restrictions like this amendment create dangerous and discriminatory barriers for people who access health care through programs involving the federal government. Paying out of pocket for health care is a barrier to access for far too many Americans, and that barrier is even higher for incarcerated people. But this amendment would force many to do so. That's on top of other hurdles like navigating anti-choice state laws requiring medically unnecessary procedures, adding more trips and more expenses. In practice, we know this means some pregnant people in prison are being denied abortion care due to their inability to pay in violation of their fundamental rights. As a nurse, I'm also familiar with racial disparities in health outcomes, particularly in reproductive health care. So I would be remiss not to mention that these barriers fall disproportionately on people of color who are incarcerated at far higher rates. Collectively, these barriers to health care access pose a serious risk to the reproductive health of incarcerated Black women and other pregnant people in federal custody. A no vote on this amendment affirms the fundamental importance of access to care. It's about quality health outcomes, economic and educational opportunities, and it's also about dignity. For the safety, the lives, and the dignity of incarcerated pregnant people, I vehemently oppose restrictions that deny people their reproductive rights, and I urge my colleagues to reject this amendment. I yield back.
Ms. Lee. Oh, I'm sorry, I apologize. Mr. Rutherford.
Thank you, Madam Chair. I rise in strong support of the gentleman from Alabama's amendment. Madam Chair, I respect the sanctity of life. Even if it's an inmate's child, it is still a life. Now, the question was raised, but, you know, what's going to happen with the baby if you go to term? I can tell you, I think most taxpayers would much rather we put that money into HHS to take care of that child than put that money into killing that child through abortion. That's always been the majority position of the American public. We would rather take care of a life than destroy one. And for those reasons, Madam Chair, I support this amendment.
Ms. Lee of California.
Thank you very much, Madam Chair. I rise in strong opposition to this amendment to restore the Hyde rider in the CJS bill. As I mentioned earlier today during the Labor, Health, and Human Services markup, it's not our place to decide for someone whether they should get an abortion. That is a deeply personal decision. We have a responsibility to finally end discriminatory abortion riders from all of our federal funding bills. We cannot turn our backs and abandon the more than 200,000 women who are currently incarcerated in the United States and their needs. This discriminatory restriction will only create dangerous and unnecessary barriers to abortion care for people. Women are the fastest growing population in the United States prisons and jails, and more than 10,500 women are imprisoned in federal prisons. 2/3 of incarcerated women are women of color, and 40% of women in prison are Black. Retaining the Hyde language in this bill will have a disproportionate impact on Black and brown women who are disproportionately targeted, criminalized, and incarcerated for minor offenses. As we know, this is, yes, it's a racial and reproductive justice issue. Incarcerated people deserve to have access to comprehensive health care, including abortion care. Additionally, they do not lose their constitutional right to abortion when they are incarcerated. Under the 8th Amendment, individuals are able to be treated for serious medical needs, which includes abortion and other pregnancy-related care. Many women do not even know that they are pregnant when they are incarcerated, and once they are, they face unique obstacles and barriers to care. We know that access to abortion care is largely based on where an individual is imprisoned, and most states require incarcerated women to cover the entire cost themselves. No one should be forced to remain pregnant against their will, regardless of whether or not they are incarcerated. Lifting this restriction will help remove one of the many barriers that women in prison face to access the health care that they need. Incarceration does not impose a mandatory sentence to continue an unwanted pregnancy. And once again, members of Congress should not be interfering in a woman's decision in terms of her own body. I urge my colleagues to join me in voting no against this amendment.
Ms. McCollum.
Madam Chair, would the author of the amendment yield for a question?
Yes.
I just have a question. So I honor the people who work in the federal prison system, but we all know that sometimes, unfortunately, people don't live up to the code that we expect them to. My question to the author is, if a woman is been incarcerated, and now finds herself pregnant because of rape, are you prohibiting that as well?
No. May I respond?
Yes, please.
Oh, yes. The language of the bill says that this is does not include the case of rape or incest. It is accepted.
I thank Mr. Aderholt for that answer. Well, going back to what Ms. Lee said, sometimes women don't even know that they're expecting at the time that they go into a prison system, and sometimes they've also been the victims of rape. And so, how would the gentleman address that?
Well, if it is a case of rape or incest, my understanding, the way this is written, regardless, it would be accepted.
But would the woman have to pay for it herself? She wouldn't have any income coming in, and at that point, she would be in custody.
Oh, that is current law. This would be an exemption. So, there's a prison funds that are restricted under the conditions that are in this bill. So that's under current law already.
So if I understand you correctly, then if a woman finds herself legally within the first 3 months, she's incarcerated, she has been a victim of rape, maybe reported or not reported, and we don't know all the circumstances as to how this individual found themselves in the criminal justice system, she would have no recourse to terminate her pregnancy should she choose to do so?
If it was rape, the government will pay.
Thank you. I yield back.
Are there other members wishing to speak on the amendment? I recognize myself. I rise in strong opposition to the gentleman's amendment. As has been stated, women are the fastest growing population in U.S. prisons and jails, and more than 10,500 women are imprisoned in federal prisons. Retaining Hyde in the CJS bill will have a disproportionate impact on black and brown women who are disproportionately targeted, criminalized, and incarcerated for minor offenses. 2/3 of incarcerated women are women of color, and again has been stated, 40% of women in prison are black. The sexual abuse to prison pipeline is real. Incarcerated women are often survivors of childhood sexual trauma, sexual assault, and intimate partner violence. 86% experience sexual violence in their lifetime, 77% experienced intimate partner violence, and 60% experience caregiver violence. Incarcerated people have a constitutional right under the 8th Amendment to be treated for, quote, serious medical needs, end quote, which includes abortion and other pregnancy-related care. Despite the fact that it is unconstitutional to deprive an incarcerated individual of care due to their inability to pay, we know that access to abortion care is largely based on where an individual is imprisoned. As has been stated, as the chairman has stated, abortion in DOJ detention is very rare. I strongly urge a no vote on this amendment. Are there any other members wishing to be heard on the amendment? There's no further debate. The gentleman is recognized to close for 1 minute.
Thank you, Madam Chair. And I just want to reiterate that the majority of the American people support these Hyde-like protections. And Ms. McCollum raises a very, issue that I think we need to address up front. The Hyde language exempts rape and incest. So it doesn't matter whether it was occurred before or after. If it's rape or incest, the Hyde Amendment does not apply. So I think that needs to be clear. And this committee should support the amendment, continue to respect millions of Americans who we shouldn't be forced to pay for abortions. The only thing it doesn't cover is for rape and incest. So I urge passage of this amendment, and I yield back.
The question is on the amendment offered by the gentleman from Alabama, and all those in favor say aye.
Aye.
All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not adopted. A recorded vote has been requested. All those in favor of a recorded vote, raise your hand. Sufficient number being in support, a recorded vote is ordered. The clerk will call the roll.
Mr. Adderholt. Aye. Mr. Adderholt votes aye. Mr. Aguilar. Mr. Aguilar votes no. Mr. Amadei. Mr. Bishop. Mr. Bishop votes no. Mrs. Bustos. No. Mrs. Bustos votes no. Mr. Calvert. Mr. Calvert votes aye. Mr. Carter.
Yeah, I needed that. It was good.
Mr. Cartwright.
No.
Mr. Cartwright votes no. Mr.
Really?
Case.
I cannot hear it.
Ms. Clark.
No.
Ms. Clark votes no. Mr. Klein.
Aye.
Mr. Klein votes aye. Mr. Cole. Mr. Cole votes aye. Mr. Christ.
No.
Mr. Christ votes no. Mr. Cuellar. Mr. Cuellar votes aye. Ms. DeLauro.
No.
Ms. DeLauro votes no. Mr. Diaz-Balart. Mr. Diaz-Balart votes aye. Mr. Espaillat. No. Mr. Espaillat votes no. Mr. Fleischman. Mr. Fleischman votes aye. Mr. Fortenberry. Mr. Fortenberry votes aye. Ms. Frankel. Ms. Frankel votes no. Mr. Garcia.
Aye.
Mr. Garcia votes aye. Mr. Gonzalez. Mr. Gonzalez votes aye. Ms. Granger.
Aye.
Ms. Granger votes aye. Mr. Harder. Mr. Harder votes no. Dr. Harris. Ms. Herrera Butler.
Aye. Ms. Hera Butler votes aye. Mrs. Hinson. Mrs. Hinson votes aye. Mr. Joyce. Mr. Joyce votes aye. Ms. Capter.
No.
Ms. Capter votes no. Mr. Kilmer. Mr. Kilmer votes no. Mrs. Kirkpatrick.
No.
Mrs. Kirkpatrick votes no. Mrs. Lawrence. Mrs. Lawrence votes no. Ms. Lee of California. Ms. Lee of California votes no. Mrs. Lee of Nevada. Mrs. Lee of Nevada votes no. Ms. McCollum.
No.
Ms. McCollum votes no. Ms. Meng.
No.
Ms. Meng votes no. Mr. Molinar.
Aye.
Mr. Molinar votes aye. Mr. Newhouse. Mr. Newhouse votes aye. Mr. Palazzo. Mr. Palazzo votes aye. Ms. Pingree. Ms. Pingree votes no. Mr. Pocan. Mr. Pocan votes no. Mr. Price. Mr. Price votes no. Mr. Quigley. Mr. Quigley votes no. Mr. Reschenthaler. Mr. Reschenthaler votes aye. Mr. Rogers. Mr. Rogers votes aye. Ms. Roybal Allard. Ms. Roybal Allard votes no. Mr. Rupersberger.
No.
Mr. Rupersberger votes no. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Ryan.
No.
Mr. Ryan votes no. Mr. Simpson. Mr. Simpson votes aye. Mr. Stewart. Mr. Stewart votes aye. Mrs. Torres. Mrs. Torres votes no. Mr. Trone.
No.
Mr. Trone votes no. Ms. Underwood. Ms. Underwood votes no. Mr. Valadeo. Mr. Valadeo votes aye. Ms. Wasserman Schultz. Ms. Wasserman Schultz votes no. Mrs. Watson Coleman.
No.
Mrs. Watson Coleman votes no. Ms. Wexton. Ms. Wexton votes no. Mr. Womack. Mr. Womack votes aye.
Does any member wish to record their vote or change their vote? Mr. Harris votes no.
Dr. Harris votes no. Dr. Harris votes aye.
Is there any member who wish to record their vote or change their vote?
Oh, sorry.
Did Mr. Case vote? Mr. Case?
Mr. Case votes no.
Mr. Harder, have you voted? You're standing, and you voted. Thank you. Okay. The clerk will tally. Here. No, this is right. I didn't want to give it to you while you were talking. Please pass it. Yeah. All right. What do we know? Did you tell them? On this vote, the yeas are 25, the nays are 32, and the amendment is not adopted. Are there further amendments? Mr. Calvert?
Thank you, Madam Chair. I have an amendment at the desk.
The clerk will read the amendment.
I'd ask unanimous consent that the amendment be considered as read.
The gentleman is recognized for 5 minutes on the amendment.
Thank you, Chairwoman DeLauro, Ranking Member Granger, Chairman Cartwright, and Ranking Member Anderholt. I appreciate the opportunity to offer my amendment, which would prohibit the Office of the U.S. Trade Representative to use any funds to facilitate or support a trade-related aspects of intellectual property, or otherwise known as TRIPS waiver. The Biden administration's support of this waiver, which would strip American innovators of their intellectual property protections, would do irreparable harm to American businesses and innovators. It undermines the value of U.S. patents, harms American innovators, deters future innovation, and will only cause more problems in the global vaccine rollout. The United States is the leader in medical and pharmaceutical innovation. Because our intellectual property protections are the gold standard, undermining these standards, even just once, weakens the value of all future patents and encourages entrepreneurs to take their innovations elsewhere, where their protections will be honored. When the COVID-19 pandemic hit, the private sector answered the call and developed viable, effective vaccines in record time. Historic turnaround. The companies invested substantial resources in this effort. Both Pfizer and Moderna vaccines, for example, are the result of messenger RNA technology, which took billions and billions of dollars and decades to develop. The federal government should be rewarding this investment with every tool at our disposal, so American innovators have every incentive to respond to the next public health crisis. Likewise, I'm concerned that a TRIPS waiver would hand technology to countries like China and Russia, who regularly try to steal U.S. intellectual property. I don't disagree that the United States has a role to play in helping vaccinate the world. It is our best interest to bring this pandemic to an end, once and for all. However, a TRIPS waiver will not solve that problem. Any issues with global vaccine rollout are due in large part to supply chain bottlenecks. A TRIPS waiver would cause demand for scarce vaccine inputs to skyrocket and impede the ability of any manufacturers to produce an effective vaccine. Production in the United States will grind to a halt as well. A TRIPS waiver simply diverts attention from the root issues with global vaccine distribution and harms American innovators along the way. The United States has a strong history of intellectual property protections. It's made America a world leader in new innovations that benefit the world. Wavering from this standard harms those American innovators who pulled us in from the depths of the COVID-19 pandemic, removes all incentives to keep them to answer the call in the future, because there will be a future pandemic, and jeopardizes our role as a world leader in innovation. I urge my colleagues to support my amendment, and I yield back the balance of my time.
Mr. Cartwright.
Thank you, Madam Chair. I rise in opposition to the gentleman's amendment. I want to start this debate on a solemn note. As of today, July 15, the World Health Organization reports over 188 million COVID-19 cases and over 4 million lives lost worldwide due to the COVID-19 pandemic. We have seen that this virus's ability to traverse countries' borders makes its risks to developed and developing nations far greater than anything we have seen in our lifetime. COVID-19 doesn't respect borders or oceans or distances. It doesn't. The TRIPS waiver proposed by India and South Africa in October 2020 would temporarily lift certain intellectual property barriers and allow countries to locally manufacture COVID-19 treatments and vaccines, thereby increasing timely global access. This waiver is not somebody's fringe idea. It's not just supported by this country or that country. This waiver is supported by more than 100 nations across the globe. International demand for the COVID-19 vaccine far exceeds supply. This provides the U.S. the opportunity to regain its familiar position in the world as a world leader for human rights. In this instance, to save lives around the globe by providing equitable access to this critical treatment. You know, as the current U.S. Trade Representative has stated, this is a global health crisis, and the extraordinary circumstances of the COVID-19 pandemic call for extraordinary measures. I couldn't agree more. Americans have a moral obligation to do what is right for the health of our fellow global citizens and to be world leaders in ethics and morality. But expanding vaccine access to developing nations is not just a moral obligation, it is also smart economics. It's economically effective. Allowing the virus to spread only increases the chances that new and dangerous variants will emerge. We've already seen variants that are far more transmissible emerge in countries with poor access to vaccines. One variant, the Delta variant, is suspected of being responsible for more than 50% of current COVID outbreaks in this country. And the possibility of variants emerging further that will evade our vaccines goes up substantially if we don't help the rest of the world get vaccinated and get in control of this pandemic. In addition to that, recent data show that nationalistic vaccine policies will cost the world an estimated $1.2 trillion per year. It doesn't make economic sense, this amendment. Moreover, as countries worldwide compete for limited supplies, developing nations will have to pay monopoly prices for access, as we saw with reports of South Africa paying more than double the price paid by the European Union for AstraZeneca vaccine. The current flexibilities included in TRIPS are ill-suited to address an urgent global crisis, and that's why we need a waiver. It's been reported that some countries may not have access to widespread COVID-19 vaccination, wait till you hear this, until late 2024 without large increases in production. Come on. This waiver is vital to ensuring sufficient and equitable access to COVID-19 vaccines and therapeutics around the world. The faster we can bring this emergency to an end, the more lives we will save, including American lives, the safer we will all be, and the faster industries such as travel and tourism can recover. This TRIPS waiver is the key to that end and the beginning of a strong national American recovery. I urge a no vote, and I yield back.
Mr. Adderholt.
Madam Chair, I rise in support of the amendment, and I too share my colleagues' concern with this announcement and support that is the amendment to stop this waiver. Waiving IP rights will not put more vaccine in people's arms. It will ultimately undermine American innovation and manufacturing. Although I do support the goal of improving vaccine access, I think it's very important. Eroding medical intellectual property rights will not realistically accelerate global vaccination efforts. Unfortunately, this waiver would do nothing to address the significant barriers to manufacturing and the distribution of COVID-19 vaccines across the globe. Vaccine manufacturing is a sophisticated process. It requires access to specialized equipment, inputs, storage facilities, and labor. A waiver could also reduce the global availability of vaccines. Strong intellectual property rights have helped the U.S. lead the world in medical technology innovation, and for these reasons, I support the gentleman's amendment. I appreciate him bringing it forward, and I encourage its adoption. I yield back.
Is there anyone who wishes to speak to any member wishing to be heard on the amendment? Mr. Klein.
Thank you, Madam Chair. I support the gentleman's amendment to protect U.S. intellectual property. In May, I joined my colleagues in writing to President Biden to express my concern with the administration's support for waiving IP protections related to COVID-19 vaccines under the World Trade Organization's agreement on trade-related aspects of intellectual property rights. While we remain committed to working together to address the global needs of vaccine distribution, weakening IP rules will not solve critical challenges in fighting the pandemic, which include tackling major logistical and health care delivery hurdles. Instead, this proposal undermines our competitiveness by allowing countries like China to profit from our innovation. IP protections have strengthened our economy by creating millions of good-paying jobs and fostered life-saving biomedical innovation. I hope my colleagues will join me in supporting this amendment, and I yield back.
I recognize myself to be heard on this issue. I rise in opposition of the amendment put forward by our colleague, Congressman Calvert. This amendment would prohibit funding to support a temporary waiver. Let me repeat, a temporary waiver to the World Trade Organization, trade-related aspects of intellectual property rights for COVID-19 related intellectual property, a temporary waiver. These are extraordinary times. They demand extraordinary measures. That is why I oppose this amendment before us, and I support the Biden administration's work at the World Trade Organization to temporarily waive some of the world's intellectual property rules to increase the global supply for coronavirus vaccines. I was pleased that USTR Ambassador Tai and President Biden announced support for this effort at the WTO meeting this May, following a letter from myself, Representative Schakowsky, Representative Blumenauer, and over 100 of my colleagues. Just this week, President Biden is meeting with German Chancellor Merkel during her visit to the United States to discuss the importance of this issue and global vaccine equity. I've long believed that the United States has a moral responsibility to step up, to lead, to share what we have learned, to do everything we can to alleviate suffering around the world and end this pandemic. Because everyone, everywhere, deserves access to these life-saving vaccines. This is about life-saving. We had a discussion just a few hours ago about life-saving. You cannot pick and choose life issues. These efforts will help expand the global supply of vaccines, deliver them to the people who need them the most, bringing us closer to ending this pandemic once and for all. I agree with Dr. Fauci when he said, and I quote, "You cannot have people throughout the world dying because they do not have access to a product that rich people have access to." This is one of the moral questions of our times. And I firmly believe that we must be on the right side of history. And that means prioritizing people over pharmaceutical profits, ensuring that vaccine is a global common good. The pharmaceutical companies are not struggling. In addition to which, they've had the benefit of the federal largesse through the National Institutes of Health. And we know that that basic research that we provided money for has helped them move forward to be able to get the vaccine developed sooner and as quickly as it has been. So rather than block life-saving vaccines for those who need it the most, let us commit to sharing what we have learned in the service of ending this pandemic and provide as many safe and effective vaccines to as many people around the world as possible. And if you cannot focus on the humanity of this issue, then I tell you, think about our national security. We are not safe if millions of people around the world cannot get vaccinated and not get the help that they need, not to die. There is no time for the United States to shrink from the world stage, and it is time for bold leadership, and it is the right thing to do. The TRIPS waiver is key to ending the pandemic and the beginning of a strong global recovery. And with that, I urge my colleagues to oppose this amendment. Mr. Simpson.
I thank the Chair Lady for recognizing me. I'm perplexed by this debate, frankly. I don't think anybody is opposed to getting the vaccine out to the rest of the world, to developing countries and others. I would just as soon subsidize it, have American manufacturers, and give it to them for nothing. But get the vaccine out to them. We care every bit as much about stopping this pandemic as anyone else does. What this is about is giving away the intellectual property. And what I don't understand is everybody says this is a temporary suspension of TRIP. It's just temporary. But when you've given away the intellectual property, there's nothing temporary about it. It's gone. They have it. We need to protect American innovators. That's the problem I have with the language that the Biden administration is attempting to do. I want to stop this pandemic as much as anybody does. As I said, I'm willing to subsidize it and give it to the rest of the world for free. But we ought to be producing it and protecting our intellectual property of our companies. Yield back.
I just might say, and probably violating some rule here, but it was the Canadian government went to Johnson & Johnson to get relief. Johnson & Johnson said no. And I know this because I spent a lot of time on this issue. Johnson & Johnson said no. And I'll be very frank with you. From my view, had I been the President of the United States, I would have picked up the phone and demanded that Johnson & Johnson provide this effort to the Canadians or to anyone else. And maybe we ought to move into the Defense Production Act again so that we can demand that we increase the production so that we can do what we need to do around the world, not just to save the world, but quite frankly, to save ourselves. Thank you, Mr. Simpson. Thank you. Is there anyone else who wants to be heard on this issue? Hearing that there is none, the gentleman is recognized for a minute to close.
I agree with the gentleman. We're better off to give that technology to other countries, give the vaccine to other countries, rather than give up our intellectual property rights. In closing, Article 1, Section 8, Clause 8 of the Constitution grants Congress the authority to promote the progress of science, useful arts by securing for limited times to authors and inventors the exclusive right to their writings and discoveries. By supporting this waiver, the body is abdicating its enumerated power to intellectual property. We must support American innovation, encourage the administration to reject this TRIPS waiver. This waiver would be a slap in the face of the very people who worked around the clock to produce a vaccine in record time that has saved countless lives. I urge my colleagues to support this amendment, and I yield back.
The question is on the amendment offered by the gentleman from California. All those in favor say aye.
Aye.
All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not adopted.
Roll call.
Recorded vote has been requested. All those in favor, raise your hand. A sufficient number being support. Recorded vote is ordered. The clerk will call the roll.
Mr. Adderholt.
Aye.
Mr. Adderholt votes aye. Mr. Aguilar. Mr. Aguilar votes no. Mr. Amadei. Mr. Bishop. Mr. Bishop votes no. Mrs. Bustos. Mrs. Bustos votes no. Mr. Calvert.
Aye.
Mr. Calvert votes aye. Mr. Carter. Mr. Cartwright.
No.
Mr. Cartwright votes no. Mr. Case. Mr. Case votes no. Ms. Clark.
No.
Ms. Clark votes no. Mr. Klein. Mr. Klein votes aye. Mr. Cole. Mr. Cole votes aye. Mr. Christ.
No.
Mr. Christ votes no. Mr. Cuellar. Mr. Cuellar votes no. Ms. DeLauro.
No.
Ms. DeLauro votes no. Mr. Diaz-Balart. Mr. Espaillat.
No.
Mr. Espaillat votes no. Mr. Fleischman. Mr. Fleischman votes aye. Mr. Fortenberry. Mr. Fortenberry votes aye. Ms. Frankel. Ms. Frankel votes no. Mr. Garcia.
Aye.
Mr. Garcia votes aye. Mr. Gonzalez. Mr. Gonzalez votes aye. Ms. Granger.
Aye.
Ms. Granger votes aye. Mr. Harder. No. Mr. Harder votes no. Dr. Harris. Dr. Harris votes aye. Ms. Herrera-Butler.
Aye.
Ms. Herrera-Butler votes aye. Mrs. Hinson. Mrs. Hinson votes aye. Mr. Joyce. Mr. Joyce votes aye. Ms. Capter.
No.
Ms. Capter votes no. Mr. Kilmer. Mr. Kilmer votes no. Mrs. Kirkpatrick.
No.
Mrs. Kirkpatrick votes no. Mrs. Lawrence. Mrs. Lawrence votes no. Ms. Lee of California. Ms. Lee of California votes no. Mrs. Lee of Nevada.
Oh, can you hold on 1 second?
Mrs. Lee of Nevada. Mrs. Lee of Nevada votes no. Ms. McCullum.
No.
Ms. McCullum votes no. Ms. Meng.
No.
Ms. Meng votes no. Mr. Molinar.
Aye.
Mr. Molinar votes aye. And Mr. Newhouse. Mr. Newhouse votes aye. Mr. Palazzo. Mr. Palazzo votes aye. Ms. Pingree. Ms. Pingree votes no. Mr. Pocan. Mr. Pocan votes no. Mr. Price. Mr. Price votes no. Mr. Quigley. Mr. Quigley votes no. Mr. Reschenthaler. Mr. Reschenthaler votes aye. Mr. Rogers. Mr. Rogers votes aye. Ms. Roybal-Allard. Ms. Roybal-Allard votes no. Mr. Ruppersberger. Mr. Ruppersberger votes no. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Ryan.
No.
Mr. Ryan votes no. Mr. Simpson. Mr. Simpson votes aye. Mr. Stewart. Mr. Stewart votes aye. Mrs. Torres. Mrs. Torres votes no. Mr. Trone.
No.
Mr. Trone votes no. Ms. Underwood? Ms. Underwood votes no. Mr. Valadeo? Mr. Valadeo votes aye. Ms. Wasserman Schultz? Ms. Wasserman Schultz votes no. Mrs. Watson Coleman?
No.
Mrs. Watson Coleman votes no. Ms. Wexton? Ms. Wexton votes no. Mr. Womack? Mr. Womack votes aye.
Does any member wish to record their vote or change their vote? Mr. Amadei?
Mr. Amadei votes aye.
Mr. Diaz-Balart?
Mr. Diaz-Balart votes aye.
Is there any member who wishes to change their vote or record their vote? Mr. Rogers? Yeah, Mr. Okay. The clerk will tally. On this vote, the yeas are 25, the nays are 33. The amendment is not adopted. Are there any further amendments? Mr. Garcia? Oh, I'm sorry. Mr. Garcia, Mr. Diaz-Balart. Yes. For what purpose does the gentleman rise? Yeah, but
Thank you. I have an amendment on the desk, and I ask unanimous consent that the amendment be considered as read.
the gentleman is recognized for 5 minutes on the amendment.
Madam Chairwoman, thank you. To paraphrase my dear friend, Congresswoman Frankel, here I go again. We're going to talk about Guantanamo for a second. Madam Chair, it is, again, a simple amendment, but I think very important. It seeks to restore two longstanding Commerce Justice Science provisions which prohibit the transfer or release of Guantanamo Bay detainees into the United States. These provisions represent a strong and an enduring consensus in Congress that Guantanamo should remain open and that detainees should not be transferred to the United States of America. Now, in 2002, that detention center in Guantanamo, since then, it's played a critical role in U.S. counterterrorism operations. Today, as I mentioned before, today only 40 very dangerous individuals remain, including Khalid Sheikh Mohammed, the key architect of the September 11th, 2001, and other enemy combatants who have, frankly, either planned or carried out attacks against our country, terrorist attacks. So as everyone is aware here, several detainees who have been released from Guantanamo have gone back to fight and to kill. So, yes, I know that the President's budget request proposed to remove the prohibition on transferring detainees at Guantanamo Bay to the United States. But I seriously think that is a very unwise decision. So the remaining 40 detainees are at high risk, and they should continue to be housed in Guantanamo. Again, we've had this debate on other bills, but again, any proposal that results in these detainees being sent to the United States, I think, is simply bad policy. Therefore, Madam Chairwoman, I would urge the adoption of the amendment, and I yield back.
Mr. Cartwright.
Thank you, Madam Chair. I rise in opposition to the gentleman's amendment. As long as we continue to hold prisoners in Guantanamo Bay, we will continue to spend $10 million a year for each of the remaining 40 men out of about 780 held there originally over the past 19 years. But while most prisoners will likely never come to the United States, there's no credible security or cost argument against transfers or on the use or preparation of U.S. facilities to detain or imprison them if necessary. You know, I want to say this. Don't sell our U.S. Marshals short. Don't sell our intrepid correctional officers in the U.S. Bureau of Prisons short. We know how to contain dangerous criminals. The U.S. Marshals, the Bureau of Prisons, working with our federal courts, have been able to transport and house exceptionally dangerous prisoners. Ramzi Youssef is spending the rest of his life at a cost of $78,000 a year at the Supermax prison in Colorado. Similarly, the federal system has managed safely to detain Timothy McVeigh, Eric Rudolph, and El Chapo Guzman. There's no reason to keep these symbolic and unnecessary restrictions in place. While few, if any, Guantanamo detainees may ever come to the United States, surely our constitutional and prison systems are strong enough to handle such cases if justice would best be served by bringing them here. I do note that not only President Biden, but also his predecessor proposed dropping these riders as well. I urge a no vote on this amendment. I yield back.
Mr. Adderholt.
Oh, yes, Madam Chair, I rise in support of the amendment. This amendment would maintain the prohibition in current law. Since FY12, this bill has carried language prohibiting the transfer or the release of U.S. of Khalid Sheikh Mohammed or any other individual detained in the Naval Station Guantanamo Bay. It also prohibits the use of funds to construct, acquire, or modify any facility in the U.S. to house such individuals. I think ensuring this long-standing provision is the right course of action, and I would urge a yes vote on this amendment.
Are there any other members who wish to be heard on this amendment? There's no further debate. The gentleman is recognized for 1 minute to close.
Thank you, Madam Chairwoman. By the way, it's really interesting because we've talked about this in different bills. I keep hearing a different number as far as how much we're spending to keep folks at Gitmo. But here's the bottom line. These are very dangerous individuals. This is a facility that works. It's a facility that we have. It's a facility that was designed to do exactly what it's doing. And this has been bipartisan language that's been in these bills for a number of years, and so I would urge you voting for the amendment, and I yield back.
The amendments on the amendment offered by the gentleman from Florida. All those in favor say aye. Aye. All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not adopted. Are there any further amendments? Mr. Rutherford.
Thank you, Madam Chair. I have an amendment at the desk, and I request unanimous consent that the reading be dispensed with.
The gentleman is recognized for 5 minutes on his amendment.
Madam Chair, with this bill, I'm afraid my colleagues on the other side of the aisle, either intentionally or unintentionally, are essentially going to strip vital federal funding and resources away from local law enforcement. While this bill includes more funding for burn, JAG, and COPS programs, which are great programs. We heard about them earlier. The community problem solving, the Stop School Violence Act, the mental health and drug treatment programs. All these are great programs that we should be funding. But, Madam Chair, this bill includes so many limitations on the agencies that are going to apply that this money becomes inaccessible. Section 219, 220, and 221 of this bill throws so many roadblocks in the way of agencies that will try to put these programs, great programs, into place in their community. Now, my amendment simply strips out Section 219, 220, and 221, which is all of these roadblocks that are being put up that will preclude agencies from being able to obtain these grants. Now, half of those requirements, Madam Chair, half of those requirements demand extensive training and retraining of every police officer and correctional officer and the creation of a very expensive and extensive data collection system. Now, I can tell you in my own agency where I had over 2,400 police and corrections, it took 1.5 years to do one cycle of training for my officers. 1.5 years. So that means next year, if this is in place, no one's going to qualify. Madam Chair, all these dollars that we're putting in there, and I thank the committee for putting all these extra dollars into JAG and into COPS. It's great. But just know this, that money's going to be there at the end of this funding cycle because none of these agencies are going to be able to access it. 1.5 years to get your training done. And then the other half of these roadblocks, Madam Chair, the other half are requirements that are completely out of the control of the law enforcement agency. Here's what's going to happen. It requires laws to be passed. Laws that, many people in this body, many of my colleagues who have served on city councils and county commissions and in state legislatures, you know the time that it takes to pass laws. And I have to tell you, that's more time than these agencies are going to have since their application windows for these grants is often very short. So my amendment, again, simply strikes these ridiculous requirements on these essential federal dollars because the current provisions in this bill will effectively defund our state and local law enforcement agencies. I know that's not the intent. They're putting more money in, but I'm telling you, they're not going to be able to access it. And as a former sheriff, I know how important training and good policies are to have good relationships with your community. You'll find no stronger advocate for accreditation than myself. When I was sheriff, my agency was accredited by all 3 major national accrediting bodies, all 3. We have the triple crown of accreditation. But I also know how expensive and time-consuming that process is. And to put this roadblock in front of these agencies is not the way to go, Madam Chair. This bill creates a catch-22 for the thousands of agencies that currently receive these grants but are not accredited. In this bill, they're expected to retrain all their officers, implement programs, and collect data, and do it all without any of the federal dollars that are in this bill. We're actually putting the cart before the horse. If we really want to help these agencies get accredited, make sure that their officers are receiving the best training, and implement robust data collection systems, we need to make sure that that money to help do that is on the front end, not on the back end, as this bill will do. Unfortunately, it's not going to work the way it's laid out. As violent crime spikes across the country, we want to be able to point to the funding in this bill as saying that we're supporting law enforcement. But I have to tell you, the way it's proposed, it's a facade. This is not what it is. This is not pro-law enforcement. In fact, it's quite the contrary. It's quite the contrary because, again, no one has been able to access this money. Let's have a serious conversation about how to use the programs in this bill to support our local law enforcement and help them build better relationships within their communities. The stakes are high, and as cities continue to slash their law enforcement budgets, these federal dollars become even more important. But because this is what happens when leaders actively work to demoralize, delegitimize, and defund the police. These federal grants are needed now more than ever. And I know the committee understands that because they put extra dollars in there, a lot of extra dollars. But for all these reasons, I urge my colleagues to support this amendment, show that we truly support law enforcement and we have their backs, and join with me in removing these roadblocks that are listed in section 219, 220, and 221. And let's not defund our federal dollars from law enforcement unintentionally. With that, Madam Chair, I yield back.
Mr. Cartwright.
Thank you, Madam Chair. I rise in opposition to the gentleman's amendment, and I want to emphasize the word gentleman. Mr. Rutherford and I are pretty good friends. And Mr. Rutherford and I are pretty good friends, and I want to address that. One of the things I like about Mr. Rutherford is that I know he shares my values about having just and humane practices in law enforcement. You can see him, let the record reflect the gentleman is nodding and smiling. I know that when he was the sheriff of Jacksonville, he followed just and humane practices. I just know he's that kind of a gentleman. But we also know that that's not uniform across our land. There have been instances where justice and humanity did not prevail in law enforcement, and there's nobody in this room who would deny that either. Certainly the jury that convicted the killer of George Floyd wouldn't deny that. That's why we called that act the George Floyd Justice and Policing Act, not to address the good places, the places that understand community policing, like my own district in northeastern Pennsylvania. The cops there understand community policing. They understand going around and getting to know the families. And if there's one of the young man in trouble or going down the wrong path, they're more likely to put an arm around him and get him involved in an athletic league, something like that. That's community policing, and it is well understood in a lot of places in this land, but there are some places where it is not. And that's what the George Floyd Justice and Policing Act is all about. Just and humane policies uniformly throughout this land. Now, the CJS funding bill addresses the urgent need for change in policing practices and accountability by ensuring that federal funds are not used to support places that engage in discriminatory and harmful behavior, places where justice and humanity are not as evident in other places. That act was voted on and passed by this House on March 3rd of this year, a little more than 4 months ago. It contained limitations on the eligibility for burn grant programs and COPS grant programs to assure that states are taking the necessary steps that we all want them to do to promote justice and humanity and to reduce discriminatory and harmful behavior. Now, that's a point that I did want to emphasize, and I do appreciate Mr. Rutherford's fair treatment of this argument that nobody means to defund the police. That, in fact, that's not the intent. And thank you for acknowledging that there are a lot of extra dollars for police forces in this CJS bill. That was the intent. But this is about grant programs, and I do want to make that point. This is not a stream of constant mandatory funding. These are grants that you have to apply for, and you don't get them every year. You know that as a sheriff. Sometimes you get them, sometimes you don't. It's not a constant stream of federal money. And so to say that there is a defunding going on, that's a misnomer. You can't say that. And certainly to plus up dollars going to police forces at a time when we are asking them to do a little more in terms of training and education and how to de-escalate, in terms of how to be a good community police force, that's all appropriate, and that's all we're up to. So I want to thank the gentleman for acknowledging that something nefarious was not the intent here. And that there are an awful lot of extra dollars going to police forces under this bill. But I say this is an amendment that does seek to eliminate the provisions in this bill which mirror the accountability measures in the George Floyd Justice and Policing Act. So if you voted yes for the George Floyd Justice and Policing Act, I encourage you to vote no on this amendment. I yield back.
Mr. Adderholt.
Thank you, Madam Chair. I rise in support of the gentleman's amendment, and by imposing these new unauthorized conditions on the law enforcement programs and also on our community projects, the majority has chosen to effectively halt funding for many unauthorized programs with strong bipartisan support. I believe it's very short-sighted and counterproductive to condition state and local law enforcement assistance on legislative activities far outside the control of our police and sheriff's departments. One program impacted by this amendment is the Law Enforcement Mental Health and Wellness Act, which provides critical mental health services for officers and helps to reduce rates of officer deaths by suicide. The officers who protect us must also be protected against mental and emotional health problems, as well as against the hazards of their job. These conditions will interfere with the jurisdictions already pursuing their own police reform agendas and potentially derail those efforts. The gentleman's amendment that is being brought up today simply makes common sense changes to this bill to reduce the harm that could result from the majority's burdensome conditions on law enforcement grants. So I urge a yes on this amendment, and I yield back.
Are there any other members who wish to speak on this amendment? Ms. Watson-Coleman.
Thank you, Madam Chairwoman. First of all, let me say that I have tremendous respect for Mr. Rutherford as well. And I too support law enforcement, but I expect those law enforcement agencies to utilize just, humane, and fair practices. And I know that that doesn't happen everywhere. In fact, it's the death of George Floyd by the hands of law enforcement that is actually the catalyst for the latest calls for police reform. But of course, George Floyd is not the first to die by the hands of police. Breonna Taylor, Philando Castro, Tamir Rice, Michael Brown, Eric Gardner, Trayvon Martin, and literally thousands more over the years have lost their lives simply because officers felt threatened due to the color of their skin. These sections are vital to help make small but yet meaningful changes to policing. Simply put, all that is asked in order to receive federal funds is to have officers complete racial bias training, de-escalation training, work to use less lethal force, ban chokeholds and no-knock warrants, and other common sense measures. Our budget reflects our values, and I value the lives of our Black and brown communities in this country that live in fear every day of being pulled over for a broken taillight or just because they're walking on their way home. So I urge a no vote on this amendment, and I yield back.
Ms. Lee of California. Well,
Thank you very much, Madam Chair. I rise in strong opposition to this amendment, which removes restrictions on the Burn JAG Assistance and Cops Hiring Program funding that would ensure safe and equitable policing for communities of color. This bill mandates that state and local units of government must comply with 9 preconditions aimed at improving police practices before receiving any fiscal year 2022 COPS or Burn JAG funds. These conditions are absolutely necessary guardrails on federal funding to law enforcement agencies. We have witnessed the flagrant abuse of authority by law enforcement policing our communities. The violence, brutality, and murder of people, specifically Black and brown people by police, has gone on for far too long, and it remained unchecked by our institutions. Eliminating racial profiling and implicit bias, eliminating sexual contact between police and persons in their custody, and eliminating excessive force should not be contentious. We should all want to ensure that our communities are safe from this violent behavior. The reason why we must require these reforms is because we have seen too many examples of this in the news, on social media, and yes, in our families and our communities. We cannot bury our heads in the sand. We must insist that our police departments be better and more representative of the communities that they serve. I urge my colleagues to oppose this amendment and yield back the balance of my time.
Mr. Harris.
Thank you very much, Madam Chair. I rise in support of the amendment from the gentleman from Florida. You know, one of the nice things about Congress is you have people with all kinds of different backgrounds here, people who understand what these problems are. The gentleman from Florida clearly has an understanding of the implications of passing this bill without this amendment. When I go to my district, the number one complaint from law enforcement is they can't recruit enough members, enough recruits, men and women, to cover the streets, to actually be on the other end of that phone when someone dials 911. And anything we do sends a message to them that they are not appreciated. When we treat all police officers as people who aren't doing the right thing, when we know 99% are, we send a bad message. We send a message that discourages recruits, that leads to increases in crime. And as the gentleman has pointed out, when you have to spend training dollars in departments that don't need the training, that don't have the problem, you are essentially defunding the police. I get it. There are people who want to defund the police. They publicly say they want to defund the police. This is dangerous. We have a record murder rate in Baltimore this year because we sent a signal to our police, including the ones that are doing the right job, that they are guilty. Shame on us for the crime wave we're having in the United States right now. We can't send signals like this. I urge my colleagues to adopt the amendment from the person on this committee who probably has the most experience dealing with law enforcement, the gentleman from Florida. I yield back.
Are there any other members wishing to be heard on the amendment? If there is no further debate, the gentleman from Florida is recognized on the amendment for 1 minute to close.
Thank you, Madam Chair. First, let me say I appreciate the comments about our friendship, and I take that to heart. But let me say this, in all sincerity, this is not going to achieve what you're trying to achieve, and you're going to hurt a lot of good agencies if all these roadblocks stay in there. I'm telling you, because they're not going to be able to meet these roadblocks, and you are, in fact, going to defund because their federal dollars are going to go down, and good agencies are going to suffer. Now, if we're trying to change police behavior, there's other ways that we're going to have to do that. This is not the way. These dollars will be reduced, and what's going to happen is all of these programs, these great programs that help my constituents back home and your constituents back home, they are not going to have those programs because the federal dollars are going to go away because these agencies are not going to meet all these standards overnight. That's a fact. So I thank the gentleman for what you're trying to do. The committee, I understand, but I'm telling you, we are going to have tremendous unintended consequences. I yield back.
Questions on the amendment offered by the gentleman from Florida. All those in favor say aye. Aye. All those opposed say no. 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 In the opinion of the chair, the noes have it, and the amendment is not adopted. Recorded vote has been requested. All those in favor, raise your hand. Sufficient number being in support of the recorded vote, the clerk will call the roll.
Mr. Adderholt. Aye. Mr. Adderholt votes aye. Mr. Aguilar. No. Mr. Aguilar votes no. Mr. Amedee. Yes. Mr. Amedee votes aye. Mr. Bishop. No. Mr. Bishop votes no. Mrs. Bustos. No. Mrs. Bustos votes no. Mr. Calvert. Aye. Mr. Calvert votes aye. Mr. Carter. Mr. Cartwright. No. Mr. Cartwright votes no. Mr. Case. Mr. Case votes no. Ms. Clark.
No.
Ms. Clark votes no. Mr. Klein. Mr. Klein votes aye. Mr. Cole. Mr. Cole votes aye. Mr. Christ.
No.
Mr. Christ votes no. Mr. Cuellar.
No.
Mr. Cuellar votes no. Ms. DeLauro?
No.
Ms. DeLauro votes no. Mr. Diaz-Balart? Mr. Diaz-Balart votes aye. Mr. Espaillat? Mr. Espaillat votes no. Mr. Fleischman? Mr. Fleischman votes aye. Mr. Fortenberry? Mr. Fortenberry votes aye. Ms. Frankel? Ms. Frankel votes no. Mr. Garcia?
Aye.
Mr. Garcia votes aye. Mr. Gonzalez? Mr. Gonzalez votes aye. Ms. Granger?
Aye.
Ms. Granger votes aye. Mr. Harder? Mr. Harder votes no. Dr. Harris? Dr. Harris votes aye. Ms. Herrera-Butler?
Aye.
Ms. Herrera-Butler votes aye. Mrs. Hinson? Mrs. Hinson votes aye. Mr. Joyce? Mr. Joyce votes aye. Ms. Capter?
No.
Ms. Capter votes no. Mr. Kilmer? Mr. Kilmer votes no. Mrs. Kirkpatrick?
No.
Mrs. Kirkpatrick votes no. Mrs. Lawrence? Mrs. Lawrence votes no. Ms. Lee of California? Ms. Lee of California votes no. Mrs. Lee of Nevada? Mrs. Lee of Nevada votes no. Ms. McCullum?
No.
Ms. McCullum votes no. Ms. Meng?
No.
Ms. Meng votes no. Mr. Molinar? Mr. Molinar votes aye. Mr. Newhouse? Mr. Newhouse votes aye. Mr. Palazzo? Mr. Palazzo votes aye. Ms. Pingree? Ms. Pingree votes no. Mr. Pocan? Mr. Pocan votes no. Mr. Price? Mr. Price votes no. Mr. Quigley? Mr. Quigley votes no. Mr. Reschenthaler? Mr. Reschenthaler votes aye. Mr. Rogers? Mr. Rogers votes aye. Ms. Roybal-Allard? Ms. Roybal-Allard votes no. Mr. Ruppersberger? Mr. Ruppersberger votes no. Mr. Rutherford? Mr. Rutherford votes aye. Mr. Ryan?
No.
Mr. Ryan votes no. Mr. Simpson? Mr. Simpson votes aye. Mr. Stewart? Mr. Stewart votes aye. Mrs. Torres? Mrs. Torres votes no. Mr. Trone?
No.
Mr. Trone votes no. Ms. Underwood? Ms. Underwood votes no. Mr. Valadeo? Mr. Valadeo votes aye. Ms. Wasserman-Schultz? Ms. Wasserman-Schultz votes no. Mrs. Watson-Coleman? Ms. Wexton? Ms. Wexton?
No.
Watson-Coleman voted no.
Mrs. Watson-Coleman votes no. Ms. Wexton? Ms. Wexton votes no. Mr. Womack? Mr. Womack votes aye.
Does any member wish to record their vote or change their vote? Is anybody? Okay. The clerk will tally. Mr. Trone, I just will say it's good to see you on the screen.
Thank you.
On this vote, the yeas are 25, the nays are 33. The amendment is not adopted. Are there any further amendments?
Madam Chair,
Mr. Klein.
an amendment at the desk and move that it be considered as read.
The gentleman is recognized for 5 minutes on the amendment.
Thank you, Madam Chair. This amendment would eliminate the ineffective and deeply troubling government gun buyback program funded in the bill and move the funds to DOJ prosecutions of human trafficking crimes. I was sent to Washington by my constituents to protect their constitutional rights, including their Second Amendment right to defend themselves, their families, and their property. I won't stand by and allow taxpayer dollars to be used in a liberal effort to limit their ability to defend themselves, no matter how voluntary. Our founding fathers wrote the Constitution to protect our rights from the government intrusion of those rights and gave individuals the Second Amendment to protect that right to self-defense. And Americans are doing just that. Over the last year, the number of firearms purchased has risen to the highest level in half a century, and 40% of those sales were to first-time gun owners, many of whom are looking to defend themselves and their families after dramatic increases in crime and civil unrest across society. I won't go into the impact that defund the police rhetoric and policies have had on the ability of local law enforcement departments to recruit and retain officers and keep officers on the street protecting our communities. Rather than a do-nothing photo op initiative that wastes time and taxpayer dollars, we should be dedicating resources to efforts that will bring dangerous criminals to justice. And that's why my amendment will move those funds to the Human Trafficking Prosecution Unit at the Department of Justice. This unit plays a key role in enforcing laws against human trafficking, including both sex trafficking and forced labor. We see on our border today rising crime, rising rates of drug trafficking, sex trafficking, and human trafficking, often small children. Ensuring justice for victims of crime is what this bill should be funding, not backdoor gun control. I urge the committee to adopt this amendment and uphold our Constitution because American civil rights are not for sale. I yield back.
Mr. Cartwright.
Thank you, Madam Chair. I rise in opposition to the gentleman's amendment. It's an amendment that seeks to strike funding for a pilot program that provides grants to promote the development, adoption, and use of state gun buyback and relinquishment programs. The pilot would be a voluntary program. I believe I heard the gentleman say that. A voluntary program means the free will of the person giving back the gun is evident. A voluntary program in this case would allow those who seek to relinquish their unwanted or unused firearms out of homes and thereby limit opportunities for gun-related accidents and deaths. This is not the government taking away your guns or your Second Amendment rights. It is simply providing an opportunity for those choosing to participate to ensure that firearms don't end up in the wrong hands. It is just one of the reasonable actions proposed in our bill aimed at better addressing the gun violence epidemic in our country. I urge a no vote on this amendment.
Mr. Adderholt.
Madam Chair, I rise to support the gentleman from Virginia's amendment. Serious initiatives are needed to address violent crime that plagues many of our U.S. cities, but the so-called gun buyback programs typically have less than impressive results. Quite honestly, they have mostly they are effective at removing what some police call garbage guns. They're rusty, old, neglected revolvers that barely function or they're non-functional, and they're not even used for crime and not even favored by criminals. So to truly make a difference, we need tough, nonsense enforcement to remove not just guns, but the shooters from the streets once and for all. So given the known ineffectiveness of this program, shifting $10 million to an account where the funds will actually make a difference, I think this is a yes, and I would urge my colleagues to vote yes and yield back.
Are there any other members wishing to be heard on the amendment? Ms. Wasserman-Schultz.
Thank you, Madam Chair. I rise in opposition to this counterproductive amendment. Human trafficking is a serious problem, especially in my home state of Florida. In fact, I've focused on combating human trafficking throughout my legislative career. But the bill before us today takes important steps to seriously tackle the scourge of human trafficking and allegations that are otherwise untrue. We are increasing funding for DOJ's Civil Rights Division to enforce laws against human trafficking and allocating $95 million in state and local justice assistance to prevent trafficking and provide services to victims. There's no need to sacrifice an innovative new gun violence prevention program. According to a 2018 survey, the United States has more than 390 million guns in circulation. That is more civilian-owned firearms than people who reside in the United States. Gun sales spiked during the pandemic, and preliminary research data indicates that about a fifth of all Americans who bought guns last year were first-time gun owners. We've seen the sad yet predictable results of a country that is overrun with firearms without adequate laws in place to ensure responsible ownership. Nearly 40,000 people died from guns in 2020. More than 100,000 others were wounded in the crossfire, and hundreds of thousands more were traumatized by harm and loss. Earlier this year, my community commemorated the day that 17 lives were taken when a shooter using an AR-15, opened fire at Marjorie Stoneman Douglas High School in Parkland, Florida. The pain of that day remains fresh in our minds and our hearts, and every day there are new families and communities suffering the same sorrow and pain that will last a lifetime. Unless we innovate and work to prevent gun violence, we're doomed to experience more preventable tragedies. Too many people have access to dangerous weapons. Now is not the time to strip a provision from this bill that will provide funding to state, local, and tribal governments to operate voluntary gun buyback programs. We should be giving gun owners, especially those who own assault-style weapons, the opportunity to voluntarily relinquish their weapons. That will make undoubtedly our communities safer. I urge a no vote, and I yield back the balance of my time.
Ms. Watson-Coleman.
Thank you, Madam Chairwoman. I rise to strongly oppose this amendment. According to Giffords, Americans own an estimated 393 million firearms. That's more than one gun per every man, woman, and child in the U.S. And despite making up only 4% of the world's population, we account for nearly 40% of all guns in the world. Simply put, it is there are just too many guns in America. According to Gun Violence Archives, as of yesterday, the U.S. has experienced 354 mass shootings this year. This program is voluntary, it is small, it is a small step, and no one is forcing anyone to give up their guns. But given our history here, given our experience, and given the ridiculousness of our so many firearms in the hands of our families, we need to do whatever we can to reduce guns in this country. And this small step is worthy of it. So I therefore urge a no vote to this amendment, and I yield back.
Mr. Gonzalez.
I rise in support of this amendment. I'm from the great state of Texas. We only buy guns. We don't give guns back. So this gun buy program will not reach my constituents, and I urge all my colleagues to support this amendment.
Mr. Rutherford.
Thank you, Madam Chair. I rise in strong support of this amendment. I can tell you, having conducted several gun buyback programs within my community, the one reason that I supported the gun buyback program was because it created a certain amount of knowledge about gun crime in the community. And that community communication was very important to making people understand their responsibilities surrounding gun ownership in general. It also gave folks that wanted to get rid of guns, husbands may have passed and widows now want to get rid of their gun, or so it gave them a way to legally and safely dispose of those guns. So I support gun buybacks for that reason, but I think, Madam Chair, if we raise this to a situation where we have the federal government providing funding for that program, you're gonna kill what is most important in that program, and that is the community involvement, the community communications that goes on in going out and raising those private dollars, hosting those public local events where you raise the dollars to buy guns back. We did that, and it was very successful. But I can tell you, if we're talking about gun buybacks versus human trafficking, clearly, human trafficking is a much more efficacious use of federal resources. And for that reason, I support the gentleman's amendment. I yield back.
Are there any other members wishing to be heard on the amendment? If there's no further debate, the gentleman is recognized for 1 minute to close.
Thank you, Madam Chair. I'll be brief. I just want to point out that in reading the text of the bill, we're talking about, on page 71, $400 million for law enforcement accountability grants, of which $10 million is for a pilot program for gun buyback and relinquishment. First of all, it doesn't say local programs. It says a national program. No matter how much it's a pilot program, it's still a nationally run program. And second of all, the word voluntary is nowhere in this section of the bill. So no matter the intent of the chairman, I would say we need to be more clear because I don't see voluntary written anywhere. So I would urge my colleagues to take this $10 million and move it over to human trafficking prosecution, and I yield back.
Question is on the amendment offered by the gentleman. All those in favor say aye. Aye. All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not adopted. Recorded vote has been requested. All those in favor, please raise your hand. Sufficient number having raised their hand. Recorded vote is ordered. The clerk will call the roll.
Mr. Adderholt. Mr. Adderholt votes aye. Mr. Aguilar. Mr. Aguilar votes no. Mr. Amadei. Mr. Amadei votes aye. Mr. Bishop. Mr. Bishop votes no. Mrs. Bustos. Mrs. Bustos votes no. Mr. Calvert. Mr. Calvert votes aye. Mr. Carter. Mr. Cartwright.
No.
Mr. Cartwright votes no. Mr. Case. Mr. Case votes no. Ms. Clark.
No.
Ms. Clark votes no. Mr. Klein. Mr. Klein votes aye. Mr. Cole. Mr. Cole votes aye. Mr. Christ.
No.
Mr. Christ votes no. Mr. Cuellar. Mr. Cuellar votes no. Ms. DeLauro.
No.
Ms. DeLauro votes no. Mr. Diaz-Balart. Mr. Diaz-Balart votes aye. Mr. Espaillat.
No.
Mr. Espaillat votes no. Mr. Fleischman. Mr. Fleischman votes aye. Mr. Fortenberry. Mr. Fortenberry votes aye. Ms. Frankel. Ms. Frankel votes no. Mr. Garcia. Mr. Garcia votes aye. Mr. Gonzalez. Mr. Gonzalez votes aye. Ms. Granger.
Yes.
Ms. Granger votes aye. Mr. Harder. Mr. Harder votes no. Dr. Harris. Dr. Harris votes aye. Ms. Herrera-Butler.
Aye.
Ms. Herrera-Butler votes aye. Mrs. Hinson. Mrs. Hinson votes aye. Mr. Joyce. Mr. Joyce votes aye. Ms. Capter.
No.
Ms. Capter votes no. Mr. Kilmer. Mr. Kilmer votes no. Mrs. Kirkpatrick.
No.
Mrs. Kirkpatrick votes no. Mrs. Lawrence. Mrs. Lawrence votes no. Ms. Lee of California. Ms. Lee of California votes no. Mrs. Lee of Nevada. Mrs. Lee of Nevada votes no. Ms. McCullum.
No.
Ms. McCullum votes no. Ms. Meng.
No.
Ms. Meng votes no. Mr. Molinar. Mr. Molinar votes aye. Mr. Newhouse. Mr. Newhouse votes aye. Mr. Palazzo. Mr. Palazzo votes aye. Ms. Pingree. Ms. Pingree votes no. Mr. Pocan. Mr. Pocan votes no. Mr. Price. Mr. Price votes no. Mr. Quigley. Mr. Quigley votes no. Mr. Reschenthaler. Mr. Reschenthaler votes aye. Mr. Rogers. Mr. Rogers votes aye. Ms. Roybal-Allard. Ms. Roybal-Allard votes no. Mr. Ruppersberger. Mr. Ruppersberger votes no. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Ryan.
No.
Mr. Ryan votes no. Mr. Simpson. Mr. Simpson votes aye. Mr. Stewart. Mr. Stewart votes aye. Mrs. Torres. Mrs. Torres votes no. Mr. Trone.
No.
Mr. Trone votes no. Ms. Underwood. Ms. Underwood votes no. Mr. Valadeo. Mr. Valadeo votes aye. Ms. Wasserman Schultz. Ms. Wasserman Schultz votes no. Mrs. Watson Coleman.
No.
Mrs. Watson Coleman votes no. Ms. Wexton. Ms. Wexton votes no. Mr. Womack. Mr. Womack votes aye.
Does any member wish to record their vote or change their vote? The clerk will tally.
Hey, if you wrap it up at 6:35, I'll give you half the bottle.
On this vote, the yeas are 25 and the nays are 33. The amendment is not adopted. I would like to recognize Mr. Aguilar for an announcement, please. Mr. Aguilar is recognized.
Thank you, Madam Chair. And with the Chair's indulgence, I'd just like to engage in a brief colloquy with my colleague from California, Congressman Calvert, for some unfortunate news. Mr. Calvert.
Our colleague, Jerry Lewis, passed away earlier today. It's kind of hitting me pretty hard. Jerry spent 4 decades in the House, most of it on this committee.
Can we have...
And ultimately served as the chairman of this committee. Jerry was from a different time. The country was less polarized, the Congress was less polarized. He loved San Bernardino County. He loved his country. He loved this committee, and he loved his country. May God bless him. Thank you. I yield back.
Thank you, Mr. Calvert, and my condolences to all our colleagues who served with him. Congressman Lewis was he called me his mayor, and we always had a very good relationship, but I know he respected and admired Mr. Calvert a great deal, and so my condolences for the loss of everyone who knew the chairman. And with that, Madam Chair, I yield back. Thank you.
Thank you, and just a note, I too knew the chairman, and when I was first elected to this body, I had to testify on behalf of my constituents who were working at the Army engine plant in Stratford, Connecticut, and he was on the Defense Subcommittee, and I went to testify before him, and I was very nervous, and I was very scared. It was the first time of really testifying about the M1A1 tank engine, you know, and and he showed me great, you know, kindness, and just was just extraordinarily helpful to someone who had just come to this institution and was, you know, feeling her way around and, you know, what to do. I must say he did ask me if I could talk about the M1A1 tank engine without looking at my notes, and I said, if you'll pardon me, damn straight I can, and he started to smile and so forth, and we created a friendship that lasted a very long time, so I too send my condolences to his family. So thank you very much, and thank you for your words, Mr. Calvert. Thank you. Are there further amendments to the bill?
Madam Chair. Madam Chair, I have an amendment at the desk titled Garcia number 1 and ask unanimous consent that the amendment be considered as read.
The gentleman is recognized for 5 minutes.
Thank you, Madam Chair. This amendment is a simple redistribution of roughly $8.5 million within the National Science Foundation budget. It is pulling from the research and related activities line item and feeding into a bolstering of the Inspector General's funding line. This is in an effort to get it to be roughly 0.3% of the overall NSF budget, the IG's fair share, rather than the current 0.2%, and to help prosecute individuals assisting hostile nations with the theft of U.S. technology and U.S. intellectual property. This is an impedance match to the workload that is being generated by FBI investigations and will allow the NSF to catch up and hopefully keep up with the active investigations. Last year, the FBI director in a speech delivered on the threat posed by the Chinese Communist Party to U.S. economic and national security noted that the FBI is opening a new China-related counterintelligence case about every 10 hours. And of the nearly 5,000 active FBI counterintelligence cases currently underway across the country, almost half are related to China. The increase in activity is impacting the Office of Inspector General at the National Science Foundation, which has reported a massive increase in its workload in recent months because of these inquiries by the FBI and NSF-funded researchers. And this amendment increases that bucket that I was describing by roughly $8.5 million to help them handle their increased workload. This does not swell the NSF budget outside the top lines. While I appreciate the work of Chairman Cartwright in fully funding the $2.6 million increase requested by the Inspector General, I respectfully would say that it's not quite enough given the circumstances that we just outlined there and the threat that China is posing and the workload that the FBI is levying here for good purposes. The Inspector General's budget of only 0.2% is frankly below average when you look at other federal government agencies, and this puts it in line with other federal agencies such as Department of Commerce and the Department of Justice IGs. For the past 2 years, the Office of Inspector General has reported that foreign government talent recruitment programs are a major challenge for the NSF. These talent recruitment programs are literally designed to benefit a foreign state's economic development, industry, and national security at the expense of the United States by obtaining information and technology not only from the U.S. but also our allies. The NSF and other agencies that fund basic and advanced research are facing increasing challenges from these malevolent programs which exploit the openness of our universities and threaten the integrity of U.S. research initiatives. In 2019, a bipartisan report from the Senate Committee on Homeland Security and Governmental Affairs noted that China, with its more than 200 recruitment programs, has been the most aggressive country to exploit our research. The most prominent recruitment program is also coming from China as well. Clearly, with the $1 billion increase in this bill for NSF, the $600 million appropriated for COVID, and the increased FBI caseload, the Inspector General of the NSF does need more resources. And if we don't step up to help, we're simply putting taxpayer dollars, our national security, our technologies at additional risk. And I urge my colleagues to do the right thing and support this simple reallocation of a very small dollar figure that will go a long way for the IG. I yield back.
I rise in opposition to the gentleman's amendment. The amendment seeks to reduce critical funding for NSF research and related activities. NSF research is critical to all fields of science, technology, engineering, mathematics, and all levels of STEM education. Investments in NSF support the economic and national security interests of our nation and help to develop a future-focused science and engineering workforce that draws on the talents of all Americans. And as NSF is the only federal agency dedicated to funding basic research, decreasing funding for NSF research will further impact an already strained pool of scientific researchers. In my opening statement, I mentioned that NSF doing this basic research is increasing American know-how. We need to get back to that. Research investments in advanced manufacturing, advanced wireless communications, artificial intelligence, biotechnology, climate science, and sustainable research, microelectronics, semiconductors, quantum information science, they'll all be impacted. Now, I will agree that adequately funding the Office of Inspector General is also important. Our IGs proactively protect the public from fraud, waste, and abuse, which has proven extremely important in research environments. But I'd like to remind the gentleman that the subcommittee has recommended the full requested amount of $20.420 million for the Office of Inspector General in FY22. I think the gentleman already acknowledged that, for which I thank him. That's an increase of $2.6 million, or 14.4% over last year, over FY21 enacted total. This rate of increase is even greater than the overall NSF recommended increase of 13.5% since last year. So I oppose this amendment to reduce funding for research and related activities, and I urge a no vote. Yield back.
Mr. Anderholt?
Thank you, Madam Chair. I strongly support the gentleman's amendment to redirect these funds to the Office of Inspector General. The economic and the national security implications of all this are severe, and we need to make sure we're doing everything we can to help the National Science Foundation to get a handle on it. So I would urge adoption of the amendment, and I yield back.
Are there any other members wishing to be heard on the amendment? If there's no further debate, the gentleman from California is recognized on the amendment for 1 minute to close.
Thank you, Madam Chair. I appreciate the comments from the chairman. This is $8.5 million. This is a relative blink of an eye in terms of the appropriations budget, even within the NSF footprint. It's being, the chairman couched this as sort of stealing from Peter to pay Paul, and I would rather characterize this as an insurance policy to make sure that neither Peter nor Paul have anything stolen from them, and while we are continuing to develop the critical research and development capabilities and the fruit that we bear from those investments, I don't want to see those very important projects get cannibalized and stolen from the Chinese Communist government. For that reason, I urge support of the amendment, and I yield back.
The question is on the amendment offered by the gentleman from California. All those in favor say aye. Those opposed say no.
No.
In the opinion of the chair, the noes have it, and the amendment is not accepted.
Madam Chair, I ask for a roll call.
A recorded vote has been requested. All those in favor of a recorded vote, raise your hand. A sufficient number being in support, a recorded vote is ordered. The clerk will call the roll.
Mr. Adderholt. Mr. Adderholt votes aye. Mr. Aguilar.
No.
Mr. Aguilar votes no. Mr. Amadei. Mr. Amadei votes aye. Mr. Bishop. Mr. Bishop votes no. Mrs. Bustos. No. Mrs. Bustos votes no. Mr. Calvert. Mr. Calvert votes aye. Mr. Carter. Mr. Cartwright.
No.
Mr. Cartwright votes no. Mr. Case. Mr. Case votes no. Ms. Clark.
No.
Ms. Clark votes no. Mr. Klein. Mr. Klein votes aye. Mr. Cole. Mr. Cole votes aye. Mr. Christ.
No.
Mr. Christ votes no. Mr. Cuellar. Mr. Cuellar votes no. Ms. DeLauro.
No.
Ms. DeLauro votes no. Mr. Diaz-Balart. Mr. Diaz-Balart votes aye. Mr. Espaillat.
No.
Mr. Espaillat votes no. Mr. Fleischman. Mr. Fleischman votes aye. Mr. Fortenberry. Mr. Fortenberry votes aye. Ms. Frankel. Ms. Frankel votes no. Mr. Garcia.
Aye.
Mr. Garcia votes aye. Mr. Gonzalez. Mr. Gonzalez votes aye. Ms. Granger.
Aye.
Ms. Granger votes aye. Mr. Harder. Mr. Harder votes no. Dr. Harris. Dr. Harris votes aye. Ms. Herrera Butler.
Aye.
Ms. Herrera Butler votes aye. Mrs. Hinson. Mrs. Hinson votes aye. Mr. Joyce. Mr. Joyce votes aye. Ms. Capter. Mr. Kilmer. Mr. Kilmer votes no. Mrs. Kirkpatrick.
No.
Mrs. Kirkpatrick votes no. Mrs. Lawrence. Mrs. Lawrence votes no. Ms. Lee of California. Ms. Lee of California votes no. Mrs. Lee of Nevada. Mrs. Lee of Nevada votes no. Ms. McCullum.
No.
Ms. McCullum votes no. Ms. Meng.
No.
Ms. Meng votes no. Mr. Molinar. Mr. Molinar votes aye. Mr. Newhouse. Mr. Newhouse votes aye. Mr. Palazzo. Mr. Palazzo votes aye. Ms. Pingree. Ms. Pingree votes no. Mr. Pocan. Mr. Pocan votes no. Mr. Price. Mr. Price votes no. Mr. Quigley. Mr. Quigley votes no. Mr. Reschenthaler. Mr. Reschenthaler votes aye. Mr. Rogers. Mr. Rogers votes aye. Ms. Roybal Allard. Ms. Roybal Allard votes no. Mr. Ruppersberger. Mr. Ruppersberger votes no. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Ryan.
No.
Mr. Ryan votes no. Mr. Simpson. Mr. Simpson votes aye. Mr. Stewart. Mr. Stewart votes aye. Mrs. Torres. Mrs. Torres votes no. Mr. Trone.
No.
Mr. Trone votes no. Ms. Underwood. Ms. Underwood votes no. Mr. Valadeo. Mr. Valadeo votes aye. Ms. Wasserman Schultz. Ms. Wasserman Schultz votes no. Mrs. Watson Coleman.
No.
Mrs. Watson Coleman votes no. Ms. Wexton. Ms. Wexton votes no. Mr. Womack. Mr. Womack votes aye.
Does any member wish to record their vote or change their vote? The clerk will tally.
Hello, this is Congresswoman Capter. Hello?
Yeah. Marcy, we can't see you on video.
Oh, wait a second. Video. Okay. There we go. I'm in the car. Does that work?
No.
Oh.
Is that her? Okay, we see you now.
Ms. Capter. Oh, she's...
Hello? Okay. I will. I think.
Ms. Capter.
We're down to Garcia, 2, and...
Yes.
Garcia, 4, and Henson.
Ms. Capter?
I had really long arguments on all of them.
Can you hear me?
Yes.
Ms. Capter, how do you want
Which
to be
amendment is
recorded?
this? What is the vote?
Is she on a plane?
I wish it is no. Sorry for the interference.
Ms.
We're in a
Capter
car.
votes no.
Oh.
Summary, please.
I vote no.
On this vote, the ayes are 25, the nays are 33. The amendment is not adopted.
Are there any further amendments? Mr. Garcia.
Madam Chair, I have an amendment at the desk, Garcia number 2, and ask unanimous consent that the amendment be considered as read.
The gentleman is recognized for 5 minutes on his amendment.
Thank you, Madam Chair. This amendment inserts just simple report language that directs the Department of Justice to increase support to local police forces who are combating illegal marijuana grow operations and encourages the departments to prosecute these criminals. The form of this support from DOJ to local law enforcement agencies can take many shapes. It could be additional funding that already is being provided through existing line items. It could be data to help combat the illegal farms. It could be additional headcount from the DEA to support local raids. It could also be grant proposal support to help local agencies navigate the process. In my district, we have a problem right now with these illegal grows, and let me be clear, this is not a problem with the legal cannabis market or distributors. This is a problem with large-scale and transnational criminal organizations that are being primarily staffed and operated by illegal immigrants. These are not legal, nor are they mom-and-pop operations throughout our local deserts. In these illegal grows, we're finding multiple dead bodies. We're finding even dead wildlife, to include bears that are residents of the local habitat who are being killed by the fertilizer being used in these illegal grows. We're seeing the water tables actually decline and lower over the course of just the last couple of years. They're wreaking havoc on our natural resources. They subsist on public lands. They steal the water to the tune of roughly 3 million gallons per day to support just the illegal grows in my district. They aren't licensed. They're not regulated. They're not taxed. And they are actually, ironically, putting the legal cannabis business out of business because they have a zero-cost basis product with no regulations or taxes against them. They are also posing a significant threat to the citizens in the local Southern California area throughout multiple counties. If you are from California, this is affecting your district. And my constituents have told me several stories of troubling attempts to intimidate and threaten them by these cartel members. The illegal grows have spread violence, misery. They are a massive problem that is growing. And I'll highlight an experience that we had where additional support from the DEA was absolutely critical. Just a few weeks ago, we had a 500-member operation from local law enforcement, state National Guard, but also 50 DEA agents who for 10 days were knocking down some of these illegal marijuana grows. They took out roughly 400 locations out of the 1,000 that are just in my district and seized 16.5 tons of illegal marijuana valued at $1.2 billion. They also seized 33 illegal firearms, served 205 search warrants, and destroyed 370,000 marijuana plants. It is likely to be the largest drug bust in our nation's history in a county that was just defunded by about $100 million against the local LA County Sheriff's Department. The problem that they have is that they only hit about 40% of these illegal grows, and this is where the help from the federal government is desperately needed. We were able to provide roughly $500,000 to local sheriffs as a result of existing pots of money through the DOJ. And so what this language is basically asking for is additional support, not only in funds, but also headcount, and also any intelligence or surveillance opportunities that the federal government may employ. And I just want to end with this. This is not an attack on the legal cannabis business. This is actually, ironically, these operations are now being encouraged and supported by the legal cannabis business because, like I said, they have no way of competing against these illegal operations, especially in a state like California that is extremely oppressive against small businesses. So with that, I yield back, request support of this amendment.
Mr. Cartwright? Mr. Adderholt?
I strongly support the gentleman's amendment, which directs these funds to the Department of Justice to increase local police support in combating illegal marijuana growing operations. These illegal criminal enterprises are growing in number and complexity. Local police forces are going to need additional assistance, and I urge adoption of the amendment and yield back.
Is there any other member who wishes to speak on the amendment? Ms. Lee, and then Mr. Calvert. Ms. Lee?
Thank you, Madam Chair. I rise in strong opposition to this amendment. Now, after 50 years of the war on drugs, we know that further criminalization and prosecution does not work to end illicit activity or the spread of illicit drugs in our communities. Enforcing marijuana prohibition has resulted in the arrest of more than 600,000 individuals per year, predominantly, again, people of color and young people. While there is concern around the spread of illegal growers, myself included, the states are working within their own legal frameworks and jurisdictions to address individuals who have chosen to operate illegally. The report language appears to favor prosecution under federal laws as opposed to the state's right to prosecute illegal growers according to their own laws. In states where cannabis is legal, we should be cautious about subjecting individuals to heavier penalties given the clear example of mass incarceration due to the war on drugs. In addition, I'm very concerned with the language in this amendment which correlates the illegal growth of marijuana with increase in, quote, theft, extortion, assaults, human trafficking, and homicides, which are horrible crimes. These are not related, and this is simply fear-mongering rhetoric which aims to amplify negative stigma around cannabis. It's inappropriate for the federal government to spend more taxpayer money to combat illicit operations when it continues to place the heavy burden of federal prohibition on states that have made the wise choice to legalize. The best pathway forward is ending federal prohibition on cannabis, and this is the reason why I must say we must support the MORE Act. I'd be happy to work with Mr. Garcia on the concerns. I know several members have these concerns, and I would hope that he would work with myself and Mr. Joyce as two of the co-chairs of the Cannabis Caucus. I urge my colleagues to vote no on this amendment.
Mr. Calvert.
Thank you, Madam Chair, and I certainly support the gentleman's amendment. I have these grows in my district, too. We had a proposition on the ballot, as the gentlelady knows, Prop 64 back in 2016, which legalized marijuana in the state of California. This is not about marijuana consumption. The reason why these grows exist is because California has a high tax on the sale of marijuana and a high regulatory regimen in developing marijuana. So the cartels, the two major cartels from Mexico, have come in to California with these illegal grows, and they undercut the legal market. That's what's happening. It's just supply and demand. They're undercutting the market. And what they're doing, they're using illegal pesticides, herbicides, fertilizers that you cannot use in a normal marijuana facility where they grow that legally. They use, as the gentleman pointed out, illegal labor. They're taking water out of city fire hydrants. They're on federal land, and that's part of the jurisdictional issue because they have to get all these various jurisdictions. They're going on federal lands, parkland. They're endangering endangered species, on and on and on. So I think this is a no-brainer. I think we all should support this because if you support legal consumption of marijuana, you shouldn't support the illegal growing of marijuana within a state that's undercutting the legal market. So with that, I support the gentleman's amendment and would hope it would pass.
Mr. Joyce.
Thank you, Madam Chair. As a former prosecutor for 25 years before I got here, and some of you who have been on this committee may have known that I'm the one who has put in the amendments in the past to restrain the federal government from spending money in exercising the federal rights in states where they found it to be legal of some sort. I wholeheartedly agree with my colleague, Mr. Garcia from California, and understand and appreciate the depths of the problem that his constituents are currently having, has been addressed by Mr. Calvert as well. I would like him to withdraw his amendment at this time and work together with us to find a comprehensive solution, because those states that have something going, they also have to have be able to have a federal standard similar to the way we distribute alcohol throughout the country, with each state having an independent handling of that within their state confines. We also need to have a way to counteract, to go after those who might be bootleggers in days of old when they had stills. Well, the same thing with these black market grows and these other operations, and we need to have a comprehensive federal plan to once and for all put these arcane cannabis laws behind us and develop a program that works for everyone. With that, I yield back.
Mr. Cartwright.
I thank the gentleman from Ohio. This is obviously a complex problem and one that requires some further thought. I thank Mr. Calvert for his remarks too, and I stand ready to work with Mr. Garcia on working out a solution if he will withdraw his amendment. Yield back.
Mr. Garcia is recognized.
Thank you, Madam Chair. If I may just make a commentary, I just want to be very clear. This isn't fear-mongering, guys. This isn't politics. I've been there. I've been on the ground. I've been seeing this firsthand. I've literally had a cartel member with a 9mm pistol sitting in the front row threatening my staff and I at a town hall. We have seized dozens of illegal firearms. There are dead bodies in these fields as they destroy them. I invite Ms. Lee to come join us and see firsthand what is going on there. This isn't about cannabis, to Mr. Calvert's point. This is a very big problem, and I don't think anyone really understands the magnitude and scope of this. And while there is an existing program under the Domestic Cannabis Eradication and Suppression Program to help local law enforcement, and while I do believe it's not enough, and I do believe this is a state's issue, I think states should have the ability to determine their own fate. But there are still federal crimes being committed here that are literally resulting in dead bodies, dead animals, and in a state where we have no water, literally 3 million gallons of water being depleted per day and stolen. That being said, I want to see additional support under the existing programs, but I do believe there's an opportunity to look at this more holistically and figure out through multiple angles of attack to get federal state funding synergized with the local law enforcement. And so Chairman Cartwright, with your commitment to continue to work on this and help us stay whole for our local law enforcement, I will withdraw the amendment today and look forward to the conversations.
Thank the gentleman. It looks like there is a path forward on a bipartisan basis, and the amendment is withdrawn. Are there further amendments? Mr. Henson? Ms. Henson?
Madam Chair, I have an amendment.
Mr. Garcia, you're recognized.
Last and final one is Amendment 4. I ask unanimous consent that the amendment be considered as read.
You're recognized for 5 minutes to speak.
This is a simple set-aside of $2 million for enforcement within the current Department of Justice budget for our national animal anti-cruelty laws. These are measures that typically have passed both chambers with little dissent. These laws are to combat the rampant and disturbing problems of dogfighting, cockfighting, domestic violence involving pigs, and other forms of mistreatment of animals who cannot defend themselves for this kind of calculated malice and abuse. Congress has taken substantial action, not symbolic action, to stop cruelty, but there's no point in passing these laws if we don't have the money to enforce them. Under the existing structure at DOJ, animal cruelty enforcement is subordinated within sections dedicated to other social and legal concerns. So this amendment aims to build on the structure of the Environment and Natural Resources Division at DOJ and seeks dedicated focus in the area of animal cruelty. This amendment does not silo DOJ's animal cruelty enforcement work. We're seeing problems nationwide. We're seeing problems in my local district. This is something that, frankly, those who don't have any defense available to them deserve. Animal cruelty affects more than the animals in business, and time again, we have studies that show individuals who perpetuate violence against animals are also doing so against people, especially women and children. In addition, dogfighting and cockfighting are almost always commingled with illegal gambling, narcotics trafficking, and human violence. This is not fear-mongering. This is data and historical data. The reality is capacity is needed, the small amount of money to enforce the laws as Congress passes a bipartisan matter. I don't see any other way to support the animals but to support this amendment, and I urge my colleagues to do so.
Mr. Cartwright.
Thank you, Madam Chair. I rise in reluctant opposition to the member's amendment. I do share the member's views on enforcing animal fighting statutes. I think we all feel that way, but just adding a new bureaucracy is what this amendment does. Adding a new bureaucratic office is what it does, and I'm afraid it could actually be counterproductive. What I worry is that you're taking a cadre of prosecutors who are handling an array of crimes and singling out some and saying, well, you're going to be in the animal fighting division, and that's all you're going to do. And I think that's the, if anybody's tried a lot of cases, what you find is that specialists don't do as well as generalists, because generalists can draw upon other resources, other experiences. They make better trial lawyers at bottom. And the truth is that the Environment and Natural Resources Division is doing a good job right now. And I say don't fix what's not broken. At present, the Environmental and Natural Resources Division, through two sections, the U.S. Attorney's offices and other ENRD sections as needed, the division has been able to invoke not just criminal statutes, but civil statutes to prosecute and shut down animal fighting criminal enterprises. There have also been successful efforts using environmental and counter-drug efforts to bring down cockfighting operations or prosecute entities like the so-called Tiger King Park for Endangered Species Act violations and others for Lacey Act violations. These work in part because the Environmental and Natural Resources Division can use all of its legal tools and its staff resources across the organization. And that's the point I'm trying to make, is that just creating a bureaucracy and housing one or two lawyers in that division, that's not the answer. It's a flexibility issue, and it's a flexibility we don't want to give up. Flexibility helps make up for a lean staff operation, with animal welfare efforts benefiting from DOJ's ability to staff complex cases by drawing on its other sections and U.S. attorneys' offices. And the truth is, there is no backlog of these crimes right now. In fact, I want to say this, Environmental and Natural Resources Division prosecutors are doing a fine job for its efforts. ENRD has been recognized by the ASPCA with its Champion for Animals Award for prosecuting federal animal fighting cases. So I rise reluctantly because I think it's a well-intentioned amendment, but it's largely symbolic and one that I think we'd all agree would lead to superfluous bureaucracy, lead to unnecessary micromanagement and insufficient agency flexibility. So I do reluctantly oppose this amendment, and I urge a no vote. Yield back.
Are there other members who wish to be heard on this amendment? Hearing none, the gentleman is recognized for a minute to close.
Thank you, Madam Chair. I'll be brief. I appreciate and respect the comments from the chairman. I do believe the bureaucracy already exists. I believe the people already exist. The money already exists. And what this is simply doing is asking for a few folks as a collateral duty to be responsible and accountable for the measured progress and success to ensure that we don't incur backlog or have any misses. And I do commend the efforts to date on from several other agencies. We can do better, and this will be a backstop for those agencies without inducing or layering up bureaucracy. With that, I urge support of the amendment, and I yield back.
Questions on the amendment offered by the gentleman from California. All those in favor say aye. Those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not adopted. Are there further amendments? Ms. Hinson?
Thank you, Madam Chair. I have an amendment at the desk. It's Hinson Amendment Number 2, and I ask unanimous consent that it be considered as read.
Gentlewoman is recognized for 5 minutes.
Thank you, Madam Chair. Earlier this year, President Biden signed an executive order to eliminate the use of private contracted prison facilities from the federal justice system, and this bill provides $75 million under the U.S. Marshals Service Federal Prison Detention Account in order to carry out the President's executive order. This order would cost $75 million to taxpayers in just 1 year alone. It's a clear waste of taxpayer money, in my mind. An extra $75 million in the federal prison detention account is completely unnecessary. On top of that, this will cost jobs in districts across this country, including in districts represented by several members of this committee. These are jobs that are in Youngstown, Ohio. These are jobs that are in Laredo, Texas. These are jobs that Americans need now more than ever. And by the way, if you look at who's being held in these prisons, a great number of the prisoners are illegal immigrants who have committed some very serious offenses. And so I think it's kind of misguided when we would be sending this $75 million away from this area. We support the effort to close the facilities that save the taxpayer money and that are actually detaining criminal aliens. Again, that seems backwards to me. So this amendment proposes to spend the $75 million of taxpayer money instead to support a different area. Instead of using it to support the executive order without the congressional authority, we would take this $75 million and redirect it to the Drug Enforcement Agency, where DEA agents would be using it to address the flow of illicit fentanyl that is currently crossing our southern border. This is fentanyl that's a direct threat to Americans right now. It's killing Americans. 136 people die every day from an opioid overdose in this country. I know members of this committee have been talking about drug overdoses in this hearing today. And I think when you look at that threat, this is a measurable way where we could address that pretty quickly. And by the way, when you look at where this illicit fentanyl is coming from, we've talked about the cartels today. Cartels are trafficking across the border, but when you look at the country of origin for a lot of this fentanyl, it's coming from communist China. So I think what we should be doing here is spending our taxpayer resources in an area where they are needed right now, where they're going to do the most good, and preserve the jobs in this process. So I urge support of my amendment, and I yield back.
Mr. Cartwright.
Thank you, Madam Chair. I rise in opposition to the gentlelady's amendment. This all stems from the executive order to transition away from contract detention. And we do recognize the U.S. Marshals Service have their share of challenges in carrying out that transitioning away from contract detention. But it's not something they have to do all at once, but gradually as current contracts expire, this amendment would stop the transition entirely. The bill includes the funding required to make the necessary adjustments in fiscal year 2022 to find appropriate intergovernmental detention arrangements and new travel options to make the transition away from private prisons feasible for the U.S. Marshal Service. But fundamentally, this amendment would ensure the U.S. Marshals remain dependent on the private detention industry. Now, we agree that fighting drug abuse and trafficking is obviously a worthy cause, but DEA did not request a $75 million increase, and we are not in a position to assess the impact of that. I urge a no vote on this amendment. Yield back.
Mr. Adderholt.
Madam Chair, I rise in strong support of my colleague's amendment. The Marshal Service has always made an effort to house prisoners within 50 miles of their respective courthouses, which are typically in proximity to their communities and families, and eliminating the contracts with facility operators make it harder for the detainees to access adequate legal representation and support services. And therefore, $75 million can be put to better use at the Drug Enforcement Agency, where it will support the increased efforts to address the flood of Chinese fentanyl coming across the borders. So I would support this amendment, ask my colleagues to, and yield back.
Are there any other members wishing to be heard on the amendment? Ms. Watson-Coleman.
Thank you, Madam Chairwoman. I strongly oppose this amendment. I'm pleased that the President has issued the executive order to the Attorney General not to renew these contracts with these privately operated detention facilities. These facilities are for-profit facilities, and the bottom line is that we created a cottage industry because of the incarceration of African Americans and other brown people in this country. And that in and of itself, for issues that shouldn't even result in the degree of incarceration that we experience. And that in and of itself is enough reason for us to be looking forward to a more restorative, a fairer, a more justice system for everyone. We are to focus our efforts on the decarceration, not the incarceration. And this industry here has grown tremendously because of past policies that did not work to make our communities and our country safer, and in fact devastated families and communities. So I am fully in support of the President's direction here, and I strongly oppose this amendment. I yield back my time.
Are there any other members who wish to be heard on the amendment? Ms. Rutherford, sorry.
Madam Chair, I have to say that these facilities provide much needed bed space in our system. The federal system has tried to utilize local jails to handle the volume that they have been forced to deal with lately. And that's why they moved into this. For-profit, as was mentioned earlier, these for-profit jails. But here's the thing that I would point to. We had a 40-year drop in violent crime and murders across this country until recently. Because recently we began to turn out thousands of prisoners because of COVID-19, and we released these folks early, and we see the result of that. If we start to close all of these private for-profit facilities that are providing that incarceration, we're going to continue to see crime spike. I think the American public has suffered enough. We need to keep people incarcerated, even if, and I have to tell you, they're usually at a less cost than the federal institutions. I yield back.
Are there any other members wishing to be heard on the amendment? The gentlewoman is recognized for 1 minute to close.
Thank you, Madam Chair. Again, I'd just like to remind my colleagues that this amendment is going to not only help save American lives in opposing that executive order and shutting down these facilities that, as we've heard from many of my colleagues, actually help support law enforcement in keeping dangerous criminals incarcerated. We do not want to de-incarcerate or decarcerate these people who have committed serious crimes and need to be behind bars. I'm all for reforms in this area, but I think we need to make sure that we are keeping the dangerous people behind bars, and these private detention facilities allow us to do that. When you're looking at, again, where these dollars could go to help and the good that they could do in stopping that flow of illicit fentanyl across the border, I think that would be taxpayer dollars well spent. So I hope my colleagues will join me in supporting taxpayers and making sure their money is well spent and supporting my amendment. Thank you, Madam Chair. I yield back.
Thank you. Ms. Hinson, this would have been my error. I didn't notice that Ms. Torres had raised her hand to speak. If it would be all right with you, I would recognize her.
Yes, Madam Chair.
Thank you. Thank you very much. Ms. Torres is recognized.
Madam Chair, I'm sorry, I wanted to yield some time to Bonnie Watson-Cole.
Ms. Watson-Coleman?
Thank you, Madam Chair. I just need to say a few things with regard to this issue. Number one is that our prison populations are overpopulated with people for very minor drug violations. They are poor, they are brown, and they are black. And it does not make it real simply because my colleagues on the other side of the aisle choose to exaggerate that we are talking about fentanyl and other really serious transportation of illegal drugs into our country. Pay attention to what really is happening is what I would say to my colleagues. If you want to speak about the impact of private prisons, then speak to somebody who understands the problem. And with that, I yield back, and I still oppose this amendment.
Mrs. Hinson, would you like to say anything?
Yes, I would just say I think we've heard from several of my colleagues who have experience in working with these prisons about the good that they do in not only helping our local law enforcement and our marshals enforce these laws, but respect taxpayers in the process. And when I talk about redirecting this money to deal with the illicit fentanyl that's coming across our border, that's a direct result of policies that I think we can fix with this, or we can work to fix with this $75 million. They are not necessarily connected, but this is a good use of that money that I think taxpayers can support, which is why I'm asking for support for this amendment today. Thank you, Madam Chair.
The question is on the amendment offered by the gentlewoman from Iowa. All those in favor say aye. All those opposed say no. No.
No.
No. In the opinion of the chair, the noes have it, and the amendment is not adopted.
Madam Chair, may I have a roll call
Recorded
vote?
vote has been requested. All those in favor, raise your hand. A sufficient number being in support, a recorded vote is ordered. The clerk will call the roll.
Mr. Adderholt. Mr. Adderholt votes aye. Mr. Aguilar. Mr. Aguilar votes no. Mr. Amadei. Mr. Amadei votes aye. Mr. Bishop. Mr. Bishop votes no. Mrs. Bustos.
Mrs. Bustos? No.
Mrs. Bustos votes no. Mr. Calvert. Mr. Calvert votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Cartwright.
No.
Mr. Cartwright votes no. Mr. Case. Mr. Case votes no. Ms. Clark.
No.
Ms. Clark votes no. Mr. Klein. Mr. Klein votes aye. Mr. Cole. Mr. Cole votes aye. Mr. Christ.
No.
Mr. Christ votes no. Mr. Cuellar. Ms. DeLauro.
No.
Ms. DeLauro votes no. Mr. Diaz-Balart. Mr. Diaz-Balart votes aye. Mr. Espaillat.
No.
Mr. Espaillat votes no. Mr. Fleischman. Mr. Fleischman votes aye. Mr. Fortenberry. Mr. Fortenberry votes aye. Ms. Frankel. Ms. Frankel. Ms. Frankel votes no. Mr. Garcia.
Aye.
Mr. Garcia votes aye. Mr. Gonzalez. Mr. Gonzalez votes aye. Mrs. Granger.
Aye.
Ms. Granger votes aye. Mr. Harder. Mr. Harder votes no. Dr. Harris. Dr. Harris votes aye. Ms. Herrera Butler.
Aye.
Ms. Herrera Butler votes aye. Mrs. Hinson. Mrs. Hinson votes aye. Mr. Joyce. Mr. Joyce votes aye. Ms. Capter.
No.
Ms. Capter votes no. Mr. Kilmer. Mr. Kilmer votes no. Mrs. Kirkpatrick.
No.
Mrs. Kirkpatrick votes no. Mrs. Lawrence. Mrs. Lawrence votes no. Ms. Lee of California. Ms. Lee of California votes no. Mrs. Lee of Nevada. Mrs. Lee of Nevada votes no. Ms. McCullum.
No.
Ms. McCullum votes no. Ms. Meng.
No.
Ms. Meng votes no. Mr. Molinar. Mr. Molinar votes aye. Mr. Newhouse. Mr. Newhouse votes aye. Mr. Palazzo. Mr. Palazzo votes aye. Ms. Pingree. Ms. Pingree votes no. Mr. Pocan. Mr. Pocan votes no. Mr. Price. Mr. Price votes no. Mr. Quigley. Mr. Quigley votes no. Mr. Reschenthaler. Mr. Reschenthaler votes aye. Mr. Rogers. Mr. Rogers votes aye. Ms. Roybal-Allard. Ms. Roybal-Allard votes no. Mr. Ruppersberger. Mr. Ruppersberger votes no. Mr. Rutherford. Mr. Rutherford. Mr. Rutherford votes aye. Mr. Ryan.
No.
Mr. Ryan votes no. Mr. Simpson. Mr. Simpson votes aye. Mr. Stewart. Mr. Stewart votes aye. Mrs. Torres.
No.
Mrs. Torres votes no. Mr. Trone.
No.
Mr. Trone votes no. Ms. Underwood. Ms. Underwood votes no. Mr. Valadeo. Mr. Valadeo votes aye. Ms. Wasserman Schultz. Ms. Wasserman Schultz votes no. Mrs. Watson Coleman.
No.
Mrs. Watson Coleman votes no. Ms. Wexton. Ms. Wexton votes no. Mr. Womack. Mr. Womack votes aye.
Does any member wish to record their vote or change their vote? Mr. Cuellar?
Mr. Cuellar votes aye.
Is there any member wishing to record their vote or change their vote? Hearing none, the clerk will tally. Almost there. Tomorrow, David. Do we start with T HUD tomorrow?
No, it's your water maker. Right? Yeah.
Is she back?
So she's going away to the airport to get back to me.
So who's going to, is she going to, the gentlewoman from Ohio, going to deal with the motion? Oh, okay. Thank you. On this vote, the yeas are 27, the nays are 32, and the amendment is not adopted. Are there any further amendments or discussion? Seeing none, I recognize the gentleman from North Carolina for a motion, and I ask for your support for the bill.
Madam Chair, I move to favorably report the Commerce, Justice, Science Appropriation Act for 2022 to the House.
The question is on the motion. All those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, the ayes have it. Recorded vote has been requested. All those in favor, raise your hands. Sufficient number. The vote is ordered. The clerk will call the roll.
Mr. Adderholt. Mr. Adderholt votes no. Mr. Aguilar. Mr. Aguilar votes aye. Mr. Amadei. Mr. Amadei votes no. Mr. Bishop.
Mr. Bishop.
Mr. Bishop.
Mr. Bishop.
Proud of you.
Mr. Bishop votes aye. Mrs. Bustos.
Aye.
Mrs. Bustos votes aye. Mr. Calvert. Mr. Calvert votes no. Mr. Carter.
Kilm.
No.
Mr. Carter votes no. Mr. Cartwright.
Aye.
Mr. Cartwright votes aye. Mr. Case. Mr. Case votes aye. Ms. Clark.
Hold on.
Aye.
Ms. Clark votes aye. Mr. Klein.
No.
Mr. Klein votes no. Mr. Cole. Mr. Cole votes no. Mr. Christ.
Aye.
Mr. Christ votes aye. Mr. Cuellar. Mr. Cuellar votes aye. Ms. DeLauro.
Aye.
Ms. DeLauro votes aye. Mr. Diaz-Balart. Mr. Diaz-Balart votes no. Mr. Espaillat. Mr. Espaillat votes aye. Mr. Fleischman. Mr. Fleischman votes no. Mr. Fortenberry. Mr. Fortenberry votes no. Ms. Frankel. Ms. Franco votes aye. Mr. Garcia? Mr. Garcia votes no. Mr. Gonzalez? Mr. Gonzalez votes no. Ms. Granger?
No.
Ms. Granger votes no. Mr. Harder? Mr. Harder votes aye. Dr. Harris? Dr. Harris votes no. Mrs. Herrera-Butler?
No.
Ms. Herrera-Butler votes no. Mrs. Hinson? Mrs. Hinson votes no. Mr. Joyce? Mr. Joyce votes no. Ms. Capter?
Aye.
Ms. Capter votes aye. Mr. Kilmer? Mr. Kilmer votes aye. Mrs. Kirkpatrick?
Aye.
Mrs. Kirkpatrick votes aye. Mrs. Lawrence? Mrs. Lawrence votes aye. Ms. Lee of California? Ms. Lee of California votes aye. Mrs. Lee of Nevada? Mrs. Lee of Nevada votes aye. Ms. McCullum?
Aye.
Ms. McCullum votes aye. Ms. Meng?
Aye.
Ms. Meng votes aye. Mr. Molinar? Mr. Molinar votes no. Mr. Newhouse? Mr. Newhouse votes no. Mr. Palazzo? Mr. Palazzo votes no. Ms. Pingree? Ms. Pingree votes aye. Mr. Pocan? Mr. Pocan votes aye. Mr. Price? Mr. Price votes aye. Mr. Quigley? Mr. Quigley votes aye. Mr. Reschenthaler? Mr. Reschenthaler votes no. Mr. Rogers?
Votes no.
Mr. Rogers votes no. Ms. Roybal Allard?
Ms. Roybal Allard?
Ms. Roybal Allard votes aye. Mr. Ruppersberger? Mr. Ruppersberger votes aye. Mr. Rutherford? Mr. Ryan?
Aye.
Mr. Ryan votes aye. Mr. Simpson?
We're at Cava?
Mr. Simpson votes no. Mr. Stewart? Mr. Stewart votes no. Mrs. Torres? Mrs. Torres votes aye. Mr. Trone?
Aye.
Mr. Trone votes aye. Ms. Underwood? Ms. Underwood votes aye. Mr. Valadeo? Mr. Valadeo votes no. Ms. Wasserman Schultz? Ms. Wasserman Schultz votes aye. Mrs. Watson Coleman?
Ms. Watson Coleman?
Yes.
Mrs. Watson Coleman votes aye. Ms. Wexton? Ms. Wexton votes aye. Mr. Womack? Mr. Womack votes no.
The clerk will... Mr. Rutherford, I'm sorry.
Mr. Rutherford votes no.
The clerk will tally. We start early tomorrow at 9 o'clock, friends, for those of you who are left. But 2 more to go. That's it. Thank you. Thank you all.
See you 8 o'clock tomorrow?
Yes. 8 o'clock tomorrow.
Good breakfast spread.
Good breakfast tomorrow. Lox and bagels and more. Right. And lunch is Italian food here. So so we got to do the ethnic thing, right, Henry?
Yeah, I went to Cava. We should go to Cava. I went there last time. I didn't know that.
Is it good? Yeah.
I love that place. That was your last night.
Maybe I'll do that tonight.
See you later, guys.
Thank you.
Thank
Okay,
you.
I'm signing off. Enjoy all the good food tomorrow. Bye-bye.
On this vote, the yeas are 33 and the nays are 26, and the motion is agreed to. I ask unanimous consent that the staff be permitted to make technical and conforming changes to the bill and the report just approved. Seeing no objections, so ordered. 3 days, yes. Without objection, the committee stands adjourned. Okay. Thank you.